exactly are we doing for these people? Because, Mr. Speaker, you see, these frontline health workers, they traverse villages, they visit homes during the day, at night, carrying a backpack, Mr. Speaker, which is supposed to be filled with basic drugs, Mr. Speaker. When we compensate them 2,500 shillings per month, Mr. Speaker, as a Senate, I think because health is a devolved function, and it is our function, we need to have a conversation on better compensation of CHPs. Mr. Speaker, with those many remarks, I support.
Senator Sifuna.
Speaker, thank you for your indulgence to allow us to skim through some of the reports that the committee has presented to the floor of the House. Speaker, in August of 2023, I attempted to bring a motion here in this House for the formation of an ad hoc committee to audit the state of infrastructure in our schools, and especially on the question of adequacy of infrastructure, given the government's policy of 100% transition rates. Mr. Speaker, whereas we all want our kids to transition 100% from the junior schools, the government had not, in my view, done enough to prepare the secondary schools for the influx of the learners. And the reports that have been put forward by the Committee on Health on the visits to county facilities, health facilities in these counties, is a demonstration, Honorable Speaker, that there is value in committees of this House being present on the ground to see for ourselves and not just to speak from Nairobi here. I had hoped that had that motion passed, Honorable Speaker, we would set up that committee, and maybe some of the things that we saw happening at Tutumishi would not have happened. Speaker, it was horrifying just seeing the state of the dormitories, because we were told upwards of 200 kids were packed into one dormitory that was had a capacity of only 100. I saw pictures of beds actually being put in the corridors, and it was devastating, Honorable Speaker. At that time in August of 2023, I was told that the Senate did not have enough resources for us to support the activities of that committee. Now, if you balance what we would have spent, and I think the budget was about 10 million shillings to audit infrastructure in our schools, and the cost of one life, Honorable Speaker, then maybe we need to reconsider some of these things. I like when committees are allowed to do these audits in our facilities, because they bring out the truth. Reading through this committee, Honorable Speaker, the report of the committee, there is a thread in terms of the state of preparedness of our health infrastructure in the counties, be it Kitui, be it Kiambu. Honorable Speaker, it makes for horrifying reading. The story of overcrowded maternity wards is true in Kiambu, it is true in Kitui, it is true even in here in Nairobi, Honorable Speaker. That, for instance, on the report from Kiambu, 2 to 4 mothers were sharing beds, and there's a story that also in Kitui, and Senator Beth was telling me that in Kitui it might actually be up to 10 women on one bed. I don't know how they fit on a bed. Six. Honorable Speaker, this is the true state of our healthcare in this country. We are being told by the report of the committee, the observation that they made from pages 14 to 15 there, Honorable Speaker, that many of the young mothers were not even registered on SHA because of various reasons. They have stated, for instance, that some of them lack IDs, at a time when we are being told that even areas that hitherto had difficulties obtaining IDs, Speaker, that they have been expedited. This was the theme at the recent Madaraka Day celebrations in Wajir. So how is it possible that our young mothers in Kiambu are not able to access IDs so that they can register on SHA? I have seen a good recommendation from the committee there that we should find a way, SHA should find a way of registering these young mothers, even as government processes their registration documents, so that they are able to access this facility. Speaker, our Committee of Health also reported that they were denied access to data on child mortality in some of these facilities. And I don't understand why. a committee of this House can be denied access to data, because we have heard separately that some of these counties and some of these facilities are actually understating the number of children who are dying after birth, Honorable Speaker. And we as a committee or as a House should put our foot down and say we need access to that data, Honorable Speaker, so that we can make proper recommendations to help these facilities. Honorable Speaker, there is also the challenge of SHA reimbursements. And, you know, this is the reason why I say it is good for us to visit these facilities and to see for ourselves and to speak to our people. Because when you hear senior government officials speak, and we were in Naivasha with CS Duale, he will tell you that SHA is working 100%. Speaker, just reading through that report, you will see that this challenge is across counties. And I will continue to insist, Speaker, that the promise that the President made was for free universal healthcare access across the board. And that was a promise that was made to Kenyans when we were being persuaded that those of us who earn a bit more should pay more than what we used to pay at that particular point in time, so that, Honorable Speaker, those who are not able to pay will no longer, will no longer suffer the indignity of having no access to healthcare. In fact, there was a statement that the head of state made recently, Honorable Speaker, that the Harambes that we used to hold, the WhatsApp groups for contributions to support healthcare, have been closed down. I don't know where the head of state gets this information, Honorable Speaker. Just yesterday, I was trying to call the director at the CEO of the Kenyatta University Teaching and Referral Hospital, because, Honorable Speaker, there is a friend of mine who passed away. He was one of the clergy at the ADC Church in Runda. And when he passed away, Honorable Speaker, there was a bill of almost 1 million shillings. And the hospital, and I don't know why, they have refused to release the body, even after the family has pleaded with them. We have written letters, we have made down payments, we have agreed to a payment plan. Speaker, out of that 1 million shillings, SHA only paid 300. So I want the President to know that we are still contributing money to get our people health care. It is the reality on the ground. And you can see, Honorable Speaker, that even the report of the committee is saying even the facilities themselves are struggling because SHA is not giving the reimbursements in good time. And this is true at Mama Lucy Hospital. We have a debt that is owed to Mama Lucy and all the other facilities here in Nairobi, and we're being told the same is the situation in Kitui, the same is the situation in other places like Kiambu. Honorable Speaker, there is still unresolved issues of NHIF, and the report also addresses this, that there's almost 5 million shillings that is owed to Kiambu Hospital. I think the teaching and not the teaching, the Kiambu Level 5 Hospital, from the old NHIF. I don't remember which month we were in Naivasha with the CS, but I remember him giving us some timelines within which the question of the legacy debts of NHIF would be resolved. I think as a House we need to bring him back here, because there was reports that he was supposed to give us on what the ministry is doing to address those legacy debts. I have seen complaints about the quality of food in inpatient wards, Honorable Speaker. They have complained about the quality, the portions, even unhygienic presentations, and one that is quite hilarious that the committee noted, or they were told that the food doesn't even have salt, Honorable Speaker. By the time we are discussing salt in food, there's a big problem there, Honorable Speaker, which is why we must continue to insist that counties be given their monies in time and in accordance with the Constitution for them to be able to undertake these devolved functions. The only ray of light, Honorable Speaker, I've seen is at page 29 of that report. For the first time, I'm seeing that at Kiambu Referral Hospital, that they had a properly stocked pharmacy, that there were actually drugs at Kiambu Referral Hospital. They were well stored, well managed, with proper records. And these are the few things that when we see, we feel happy and we celebrate that at least somebody down there is doing something. Because when we visited the hospital in Busia, Honorable Speaker, when we were doing Senate Mashinani, you could see when you are approaching the hospital there, There is a row on your right of private chemists all along that road, and it is always the first indicator that there's a problem in that hospital. That somehow the systems in the public facility is such that you ensure you can guarantee business for the private pharmacies outside. So I am happy that at least that is not happening in Kiambu Referral Hospital, according to the report of the committee. They have said they also saw digital X-ray that is serving almost 100 people per day. It is suspended on the ceiling, and I've seen the photos there. They also reported that Karuri Health Center, Honorable Speaker, is one of the most well-managed facilities they have seen. They have digitized their systems. So we will give Kiambu their flowers for the things that they are doing, and maybe encourage other things, other counties to also follow suit. The story of mortuaries is the same across the country. When we were in Busia, same problem. The same mortuary that Busia has had since independence, Honorable Speaker, up to today, and is in a bad state. Dilapidated mortuaries is a theme across the report, and Honorable Speaker, we continue to reiterate that something has to be done. And when you look at the totality of all of this, Speaker, and then you ask ourselves, is it really true, Honorable Speaker, that our state of healthcare is such that we could be able to deal with any medical emergency in this country? The report paints a different picture. And this is why when Senator for Kitui Wambua was submitting, he said that the concerns that Kenyans are raising about this Ebola facility in Nanyuki is actually a valid concern. We have proposed to the President that instead of us transferring patients from DRC to come and receive treatment here, I think that the US government should grow the capacity of the DRC itself to ensure that that disease does not leave the borders of the DRC, and all of us will be safe, Honorable Speaker. If the money that has been pledged towards this project is given to President Tshisekedi, he should be given that money for him to be able to put up those centers there and be able to contain Ebola within their borders, although now we are hearing reports of even deaths in Uganda, Honorable Speaker. So the state of our healthcare is quite dire, and contrary to what people speak of here in Nairobi and in other public gatherings, they paint a very rosy picture. But the committees of this House, when they go on the ground, the situation that they find, Honorable Speaker, reads like a nightmare, and you can all see in this report. So with those many remarks, I want to thank the Committee on Health, led by the Senator for Uasin Gishu, Jackson Mandago, for this very well-detailed report. They have highlighted challenges, they have highlighted things that they feel need improvement. They have given flowers where they are due, Honorable Speaker, as the case in Kiambu Referral Hospital with their drugs or their pharmacy, and given proper recommendations here, and I think and I hope that once we adopt this report, some of these recommendations will be taken into account and implemented so that we can give our people assurance that the quality of healthcare in this country is as portrayed by some of the leadership in this country. Thank you, Honorable Speaker.
Senator Sigei.
Thank you, Mr. Speaker, for giving me the opportunity to also contribute to
the various reports that the Health Committee have submitted before this House. Mr. Speaker, I would like to start by commenting the committee for the well-done report. Particularly and of great importance is the fact that they did indeed had an experience that is reflected in the reports from the various hospitals, dispensaries of the various counties that these three reports have been reported from. And indeed, Mr. Speaker, part of what we have as a House and as various members of other respective committees, we have seen and appreciated the presence of various committees on physical ground or in specific places where we are undertaking our oversight role, unlike where we are doing it in the chamber or here in Nairobi. Mr. Speaker, presence in our respective counties, presence in our respective hospitals where we are conducting that particular oversight, Mr. Speaker, gives us the exact situation, and therefore, as at the time of coming up with the report and the recommendations, we are doing it with first-hand information. Reading through some of these reports, Mr. Speaker, reflects a scary situation. There is outright deterioration of health facilities, not only in the counties that we have been provided for by the committee on the basis of their visits to those counties, but it is a challenge that cuts across almost all the counties in the country. And, Mr. Speaker, it reflects on the situation of our health facilities, reflects on the kind of service delivery that the electorate naturally would expect from the county governments, and also reflects on the ultimate service delivery to the people of Kenya. Mr. Speaker, the recommendations that have been given are almost similar across all the counties which have been visited, and as I've said, reflects equally on the rest of the counties. One of the major issues that have been identified, and which is a glaring challenge on administration of the county government managed hospitals, Mr. Speaker, is the capacity of those hospitals. You find that one bed is shared, as we've been told, by more than 3 patients, whether these are mothers who are on their maternity or even patients who've got various ailments. It is impossible to say to get appropriate medical attention when you have got 2 or 3 people sharing one bed. That situation, Mr. Speaker, is common among most of the hospitals where the committee visited, and it is equally reflected in even our various other hospitals where the committee did not. I recall, Mr. Speaker, previously the same committee made a visit to Longisa water in the hospital. You can imagine, Mr. Speaker, a hospital facility with no tap water. It is absolutely disheartening to see patients going out of the facility, getting water from water vendors outside, or even sending, in most cases, like in this case, Mr. Speaker, in Longisa Hospital, I am aware that border riders have now made good business out of water supply to the hospital. They only go, step out, get their 20-liter mitungis and line up along the road in order to supply water to patients who are in hospitals. This situation is serious, and when you look at the report, it can only be appropriately dealt with if our county governments have proper governance, because from the various Senate audit reports, part of the challenge is improper governance. Resources are abused. Resources are directed to non-essential services, and in most cases also, those resources are entirely abused by those who are governing those institutions. Besides the challenge on the bed capacity, where patients are sharing beds, there is also, Mr. Speaker, an availability of essential drugs. This has also been reflected in these reports and is cutting across almost all our institutions of health, which are mostly managed by our county governments. And, Mr. Speaker, this one is one of those issues where, as some of the members have spoken to here, you find that the pharmacies within the hospital have got no essential drugs, but there is, just outside that particular institution, a lineup of private-owned pharmacies where those essential drugs are available
And what happens within the hospital is that patients are given prescriptions and are asked to go and buy for themselves, such that even if a patient was unable to have the financial capacity to purchase and therefore relying on the social health care facility, that's the SHIF, they will be forced to find a way of making sure that they get the drugs from those private pharmacists. And it is one way of, Mr. Speaker, making sure that the drugs which are normally availed in hospitals, we are told in some places we don't have drugs in the hospital, but are normally stolen or are sold out to private practitioners who now make money out of it. And that is a problem on governance. It has been identified in these reports that one of the challenges that most of these institutions from the various hospitals that were visited by the committee is that there is improper governance where no one takes responsibility. The hospital superintendent is not available or is not qualified. Doctors, nurses, clinical officers are not paid in time, and therefore their availability to even be present as and when they are required is, in most cases, discouraged because their services are not paid for in good time, and their working condition, definitely, Mr. Speaker, is compromised. And therefore, if we as a committee, as a House, were to enhance direct and presence in almost all our institutions in the course of our oversight, there is a high likelihood that there will be an improved performance, because being present is not the same as where we are doing oversight at the level where we are in Nairobi, or when we do not have presence in those particular institutions. Another issue that has been identified in these reports, Mr. Speaker, which is also common across, is those health service promoters who, although they are not necessarily under the full obligation of the county governments, they are very essential, and they are the first line of presence in our various areas of representation, because they are the ones who will directly be reaching out to patients. They know almost every other family that has got a patient, and they will be the people who will support in terms of giving directions on what kind of medical attention such people require. And it is, Mr. Speaker, very unfortunate that they are not being paid their stipend. And if they are paid, sometimes they are paid when it's delayed. And therefore, it compromises entirely the service delivery from their part and spills over now to the institutions, the health institutions where they are supposed to report to, or where they are supposed to take the patients in. And sometimes also where they know, after all, even if they were to push themselves to support, there will be no attention relevant to the patient in their health institutions, because poor governance is present, or no drugs, or at some places, Mr. Speaker, they are literally not even operational. And therefore, the decision that this committee did, together with the rest of the committees, including Education Committee and all other committees, by making their presence felt in the various counties, the role that they're supposed to do will entirely support the people who we are supposed to help as the oversight role. And so, Mr. Speaker, as we appreciate the work of this committee, we'd like to encourage them also to make sure that they enhance their visits and make sure that the recommendations that have been made by the committee on the various institutions are followed through, so that some which are possibly able to be implemented should be implemented. Those which are not, of course, will form a basis of future follow-ups by the relevant committees. And Mr. Speaker, I stand to support this report. Thank you.
Senator Siang.
Thank you, Mr. Speaker, for giving me this opportunity to also to add my voice on the report by the Committee on Health. Mr. Speaker, sir, the report touches on Kitui and other counties, and I noted with concern specifically on the matters of the care for mothers and children. Mr. Speaker, when patients are sharing same bed, about 6 patients, and some with newborn babies, it is so unfortunate because babies are sensitive, newborn babies are very sensitive. They can contract infections very easily. And when they are forced to share a bed with their mothers and other strangers, they may contract diseases, and that will lead to death. This is very sensitive. I really appreciate the Committee on Health because of these visits that exposed some of these evils that are happening in our counties and in the hospitals. Mr. Speaker, specifically speaking to Kitui Hospital, my attention was caught by what the superintendent, the medical superintendent, has done. He has appointed or engaged a pharmacist who did a short course of 3 months on echocardiogram. And she is the one now handling patients with cardiac issues. This is putting the lives of my people in Kitui in danger. The hospital should have an experienced, qualified person who takes care of patients who come and visit the hospital when they have heart diseases. But to be treated by somebody whose training is not on the issue of cardiac issues is very, very dangerous, and it is endangering my people of Kitui County. Mr. Speaker, those things were unearthed when the committee visited the hospital. It is serious, Mr. Speaker, when we engage people and then we don't appreciate their services. I'm saying this concerning the CHVs, whose stipends are delayed, not paid in time, and even themselves, their health is also wanting because they are not assured of insurance themselves. They walk, they work, visiting house to house, door to door, supporting our people. And when their stipends are not paid in good time, they have obligations because these are people who have families and they are looking for a way also to survive, if not to live. And when their stipends are delayed and sometimes not paid for several months, they suffer. Mr. Speaker, I would urge the counties as well as the national government, because they share the payment of the stipends, just to hasten the payment and do it in good time. My attention, Mr. Speaker, was also drawn to the situation in our hospitals on electricity. Some hospitals have huge bills with KPLC, and when they don't pay, maybe electricity could be disconnected. And sometimes, even the situation in the hospitals, the electricity is not constant. Sometimes it goes off, and the electricity power may go off when a patient is on the operation table. What does that mean? It means that a life can be lost. Mr. Speaker, it is very important to ensure that our hospitals are constantly connected to power or to electricity. As some of the governors appear before our committees, Mr. Speaker, we also find out that many do not have disposal framework of expired drugs. They are stocked in the pharmacy. They are expired, and I wonder why drugs with a near expiry date are given to our hospitals or distributed. And this also endangers the lives of our people. Mr. Speaker, as some of my colleagues have already indicated, many of the pharmacies in our hospitals do not have critical drugs or very important and common needed drugs. And when they are not there, then they are directed to go out. Sometime when we went around, Mr. Speaker, I noted something very interesting, that near every public hospital, there are so many chemists, private pharmacies. And when people lack drugs in the hospital, then they are directed to go just outside the gate and buy from there. And some are owned by medics who work in those hospitals, and they stock the medicine that is needed, and so they direct people to go and buy from their own private clinics or pharmacies. I think, Mr. Speaker, sir, we need to have serious follow-up on what happens in our hospitals so that we ensure our people, Kenyans, are secure, and there are right policies that are followed to ensure that people are served in these hospitals and they feel secure. I want to thank the President of the Republic of Kenya. He is doing very well. The other day, Mr. Speaker, I watched when they were launching the Ewene program, that mother and the child to be taken care of. This is very encouraging, Mr. Speaker. And we should be people who can see good things and say they are good and we are heading to the right direction. I congratulate the President and the Cabinet Secretary for Health, because they have taken efforts to make sure no mother would lose life when giving life to the world. With this, Mr. Speaker, I submit and support the report of the committee. Thank you.
Senator Wamatinga.
Thank you very much, Mr. Speaker, sir, for also giving me the opportunity to add my voice to this job well done by the Committee of Health. Mr. Speaker, sir, I'll start by picking it from the positive note, Mr. Speaker, that indeed the presence of the committee in various counties has highlighted some issues very worrying indeed: lack and shortage of infrastructure, bad services, Mr. Speaker. But I also want to commend the committee because they've given commendations and they've given good remarks on where they found that the hospitals are working well, Mr. Speaker. Indeed, Mr. Speaker, the challenge of health infrastructure in our country has been left unattended the last 62 years. It would actually we would not be doing justice to the current administration, Mr. Speaker, if we don't say that the effort made by none other than the President of the Republic to make universal health accessible, affordable at any part of the country is a very commendable, to say the least. Mr. Speaker, sir, we recall during our independence days that one of the commitments that the founding father of the President said was to fight illiteracy, poverty, and indeed improve health by making health accessible to everybody. Mr. Speaker, over time, the population has kept on growing. The infrastructure in the hospitals have continued to degenerate. Up until the current regime, Mr. Speaker, where the President took very, very unpopular decision, but the right move to make universal health accessible. Mr. Speaker, today, as we stand here, it is not and it cannot be denied by anybody, especially those in the leadership position, that the Harambes in aid of patients have always been a campaign tool, Mr. Speaker. We've been included in WhatsApp groups, Mr. Speaker, and we must admit that these WhatsApp groups have reduced in number. The commitments and the Harambes that are taking place have reduced in number. There are still some cases, Mr. Speaker, and some of them, Mr. Speaker, can be traced back to corrupt administration in hospitals that are highly compromised, doctors that are willing and have always practiced an ethical behavior by charging operations that they've not committed. This, Mr. Speaker, if we are able to address that, and I think that is an issue that have been left severally, if we are able to address that, Mr. Speaker, among other issues, then we'll see the health system in Kenya work. And I think this is a job for everybody, Mr. Speaker. Having said that, Mr. Speaker, there is still a lot that needs to be done in terms of training, in terms of capacity building, in terms of equipping our hospitals, Mr. Speaker. But I think the approach by the government to make sure that CHA is working so that the health system can become a bankable facility where people can go and be able to offer some of these advanced machines, Mr. Speaker, so that we stop sending all our patients to foreign countries for treatment. If we are able to make CHA work in the sense that we can be able to attract investors to come and bring these equipments in our hospitals, then, Mr. Speaker, we will see it work. If we encourage and make sure that we standardize the charges of the drugs and make sure that we also encourage chemists to be established within the establishment so that they can be able to provide these medicines to the people, then we'll see it work, Mr. Speaker. But this cannot be done overnight. What we have been able to achieve in the last 3 years, Mr. Speaker, we must admit that the last 60 years, it has been impossible because the administrations then were not prepared to take the bull by its horn. They were not prepared to make unpopular decisions because they wanted to ensure that they are re-elected. And I must commend the President, Mr. Speaker, because some of these decisions, as unpopular as they are the right decisions that we ought to have made 60 years ago, Mr. Speaker. And this is the time, Mr. Speaker, that we must say, leadership is not about getting re-elected, Mr. Speaker. Leadership is about making the right decision. When the history of this country is written, even when maybe we are not around, it will say, yes, the President did the right thing to do to implement some of these measures. It is our responsibility, Mr. Speaker, as leaders to ensure that we address the issues of corruption in the health institutions, we address the issues of corruption within the professionals, and most important, Mr. Speaker, the ethical behavior of the doctors that we know has also compromised our ability to offer the services. Having said that, Mr. Speaker, it will also be good to say that there are some of the challenges we have in hospital that are caused by mismanagement of those institutions, administrative mismanagement. There are some that are caused by the county governments not being able to facilitate. And I like the fact that the committee did say that they found one hospital in Thika that had a well-equipped pharmacy. This, Mr. Speaker, is a clear indication that if the governors, if the administration around the hospitals were ethical enough, then we'll be able to face this, to overcome this challenge. However, Mr. Speaker, I would also want to advocate for the fact that we need, Mr. Speaker, to devote more funds to the health center as we also create avenues and IT-based administrative tools so that we are able to address the issues around corruption, the issues around mismanagement, and most importantly, Mr. Speaker, be able to trace the data of the patients so that we can be having a predictable situation where we would know in a couple of years to come, these are the kind and the category of medication that we'll be using, the kind of equipment we're using. And in today's age, Mr. Speaker, where AI enables that kind of projection, forward-looking, Mr. Speaker, is something that we should do. Mr. Speaker, having said that, the issue of CHPs, Mr. Speaker, I must also commend the government because as much as the spending they are getting is little, as has been alluded by one of my colleagues here, we must look at a way of enhancing that, Mr. Speaker, not only in terms of the money they get, but also in terms of the facilities that they get, Mr. Speaker. Things like umbrellas, things like the clothing. We need to give them protective wear so that, Mr. Speaker, as they are going to see these patients, they do not also contract the diseases that they have. Mr. Speaker, I have made it my duty to go around the 30 wards in Nyeri County, speaking the CHPs, and I've seen the commendable job that they've been doing. And indeed, Mr. Speaker, I must say that the spend from the government, national government, comes promptly, but that from the county government comes a little. However, Mr. Speaker, that is a little amount, and we must look at a way of enhancing that so that we can be able to address some of the issues right at the source before they escalate to become major diseases, Mr. Speaker. Improvement of primary health care, Mr. Speaker, should be a priority to every county government. It should be a priority to the national government, and it should be a priority to every leader, Mr. Speaker. And that can be done, Mr. Speaker, by ensuring that we enhance the services offered by the CHPs. But as we're doing that, Mr. Speaker, we must also find a way of capacity building them, Mr. Speaker, so that now we have people who are able to not only to deliver professional services, but also to be able to give timely services by increasing the gadgets they have. And most importantly, the reporting tools that they are using, Mr. Speaker, must be modernized so that we are able to harness that data, harvest it, Mr. Speaker, and use it in our budget-making process so that we do a budget that is data-driven as opposed to the look and feel, Mr. Speaker. Mr. Speaker, it is also very, very important to say that some of the challenges that we are facing in the health sectors are led by the unscrupulous minded administrators who look at opportunity of making businesses out of this, Mr. Speaker. We know it is possible, and it has been done in other countries, Mr. Speaker. We can achieve it in this country. And what we need to do, Mr. Speaker, is to do a evaluation of what we are doing, standardization, and we create standard operating manuals and procedures within all the hospitals so that, Mr. Speaker, we can have a unified approach into how we deal with medical issues, Mr. Speaker. Lastly, Mr. Speaker, as I wind up, indeed, I would want also to end up by commending His Excellency the President, because SHA has ensured that some of the services that has remained inaccessible to some communities is now accessible. However, Mr. Speaker, we must look at a possibility of ensuring that these counties that are marginalized, Mr. Speaker, that they get modernized hospitals. Mr. Speaker, the approach should be to plan all the facilities within our hospitals in a bankable way, Mr. Speaker, in a manner that we are able to encourage and to invite and give initiatives to investors so that they can come and install their machines so that we can reduce the amount of patients, the number of patients that we have to export to foreign countries for advanced treatment. Mr. Speaker, with the advent of cyber medicine, Mr. Speaker, it is possible to have collaboration between local hospitals and international hospitals. What we need, Mr. Speaker, is only to standardize the equipment that we are using, and this can be done when we do have a kind of a public-private partnership within our hospitals that will encourage even those international companies to come and invest in our health systems and making Kenya also a medical tourist destination. And that can happen, Mr. Speaker, if we modernize our facilities and if we go in tandem with the modern technology. Mr. Speaker, having said that, let me take this opportunity to thank the committee for the job well done. How I wish that they would do that more frequently so that their presence and our presence as the oversights can be felt within the county governments, within the county, the grassroots facilities. But most important, Mr. Speaker, I think we have an obligation to ensure that we give civic education to our people so that they get themselves enrolled in SHA, so that they get the services that are offered. Thank you, Mr. Speaker. I do commend the committee.
Senator Dulo.
Thank you, Mr. Speaker, for this opportunity and to contribute to this report of Health Committee of the House. Mr. Speaker, I wish to take this opportunity to thank the committee for having comprehensively outlined the issues affecting our hospitals across the board. Mr. Speaker, right to health is paramount. But unfortunately, in as much as the government at the national level is doing, there is literally very little that is happening at our county levels. Mr. Speaker, patients are really suffering in our hospitals. And if I may start with my own county, yesterday, all the doctors put down their tools. And KPDMU actually advised the county government to have a sitting with them and iron out the issues affecting the doctors in Isiolo County. But surprisingly, they are unable to get the governor of the county of Isiolo to sit down with them to listen to their grievances. And Mr. Speaker, if the doctors themselves are not taken care of, if the doctors are not getting their salaries, if the doctors are not actually covered themselves as far as SHA is concerned, there is no way that they will take care of those patients, Mr. Speaker. And I think if I was actually asked, in as much as health is devolved, Mr. Speaker, I wish health should be returned back to the national government because the situation is very bad. Mr. Speaker, service delivery. In the report, you will see that actually most of the infrastructures are dilapidated. And that is the serious situation across the board. And if you look at the budget actually within the county government, you will see that the chunk of the budget of the county government goes to health. But that budget doesn't actually even reach the hospital, Mr. Speaker. Many of the hospitals, and a very good example is of Isiolo, the hospitals are dependent on FIF. Nobody knows where the budget is going, Mr. Speaker. Because if the hospital collects about 2 million, and the requirement of the hospital is almost 2 billion, how will they cover those costs, Mr. Speaker? There is a very serious situation that is happening in our counties, Mr. Speaker. I saw KPDMU actually telling Isiolo people yesterday, go to the hospital and collect your patients from the hospital because the doctors are not going to be there. That is a very serious situation. And I think maybe Senator for Meru should also look at that clip because Meru was also mentioned. And the patients are told, Isiolo community were told, go to Laikipia or Tharaka Nithi for service delivery. Doctors are not going to be there. It's a very serious and pathetic situation, Mr. Speaker. Mr. Speaker, the issues of promotion, Mr. Speaker, in the counties, as far as the doctors are concerned, nurses, clinical officers, they are all politically driven. If you are not aligned to the current regime, Mr. Speaker, and those are one of the grievances raised by the doctors, you will not be promoted. Mr. Speaker, doctors and nurses, they don't have tools, they don't have gloves, they don't have masks, and I wonder what they are going to do in those hospitals if they are not properly equipped and even protected. You can imagine SHA is there, but the doctors themselves, they are not covered. Nurses are not covered. The county government staff, they are not covered medically. How will they serve those patients, Mr. Speaker? It's a very serious situation, Mr. Speaker. You will see that the revenue is being collected at the county level. And the manner in which the revenue is collected, Mr. Speaker, you pay cash and it is not actually automated. Casuals have been actually going without salary for almost 2 years. And they are the people who actually do the dirty job in those hospitals, especially cleaning the blood in those hospitals. Patients who are very sick, they're the ones who take care of them. How will those staff, especially the casuals, and I think as a Senate, we really need to deal with the issues of casuals in the county government, because you cannot expect a casual who is earning 15,000 or 17,000 to stay without salary for 2 years or a year plus. And you expect that particular staff to perform his or her work. And we are just quiet. Mr. Speaker, I do appreciate what actually the committee has done. And you can imagine, Mr. Speaker, like a staff of Isiolo County, for the last 3 months, they have gone without salary. 3 months, Mr. Speaker. Some of them, they live in rental houses. And the tenants are saying, if you work for the county government of Isiolo, we are not going to give you a house. You better look for a house elsewhere. Share contribution is not actually remitted for the staff, Mr. Speaker. They have taken loans, Mr. Speaker. Those loans are not paid in time. Promotion is not coming. And actually, some of the doctors are forced to even go out and work outside. And the work of the hospital is left to the students who are in KMTC. Today, we have so many cases of actually maternity negligence, where mothers are actually dying at the delivery table. Mr. Speaker, in as much as we say that a lot is being done, our people are really suffering. Dispensaries in those counties, they have no drugs, they have no equipments, and the distances, Mr. Speaker, especially in case of emergency, those patients travel on a rough road, which is over 200 kilometers. And especially the mothers who have complication, they do die before even they reach where they are being taken care of. Mr. Speaker, this is a very good report, and I think this is affecting most of the counties across the board. Senator Wambua talked about CHVs. In Kenya today, how can you pay somebody 2,500 for a month? That is even below the labor law standard. If we really want to keep the CHVs, Mr. Speaker, we need to formalize that particular structure. We need to actually facilitate them, because these are the people who walk around from one place to the other to take care of patients, to report emergencies. Mr. Speaker, CHVs are really suffering. If we don't want to take care of them, Mr. Speaker, they should be actually left alone. Why do you give somebody 2,500? Because today, if I walk to even any of the supermarkets in this country, with 2,500, I can buy nothing, Mr. Speaker. It's really embarrassing to this particular country. Mr. Speaker, I said earlier, and I will say today and tomorrow, that the health care system in Kenya is not doing the best. The standard that is kept in those hospitals, because I remember when CS Health came here, I asked him who is supposed to take care of the standards within the county government. And he said, us, the national government. But those standards are not kept. You can imagine even promotion. Sometimes people are promoted when they don't even have qualification for those particular positions, Mr. Speaker. How will they manage those hospitals? How will they manage revenue? How will they manage patients, Mr. Speaker? So the issue of a standard, and I've been along in this Senate, we have actually said several times, the standards of the hospitals in those counties should be with the national government. And I think national government is also running away from that responsibility, because they are saying they will not micromanage governors within those counties. Medical equipments that were there, the mess, those equipments were really helping Kenyans, especially the dialysis machines. And if you go and check in some of the hospitals, those dialysis machines, most of them, they are obsolete, Mr. Speaker. Patients are suffering. Cancer patients, they are really struggling. And Mr. Speaker, if I was asked, I will even say SHA should be paid for all the citizens in those counties. The county government should pay actually SHA for citizens. They don't have to suffer. If medical services or medical care is free, why can't we allow county governments to pay SHA for their citizens, where they'll be able to get service delivery? Mr. Speaker, this is a very good report because it's really hurting. National government is doing a lot, but at the county level, I'm sorry to say, things are really wanting, Mr. Speaker. The standard of actually theaters, I remember 3 weeks ago, in my own county, the theater was not functioning because it had a problem. What will people do? Where will they run to? The staff are demoralized. There are no drugs, essential drugs, even paracetamols, leave alone anything. Mr. Speaker, let me stop here, but I will request that as a Senate, we should not actually put these reports in archives. We should follow up to make sure that the recommendation of the committee has been implemented. Mr. Speaker, the oversight institutions that are supposed to look at these issues that are affecting our people in the counties, they should wake up and actually deal with the mess within those health facilities in our country. And I wish to support the report. I thank you, Mr. Speaker.
Senator Mulgo, Julius Mulgo. Thank you very much, Mr. Speaker, for allowing me to also add my thoughts to those of my colleagues. This is a very good report, very elaborate, and I think it a lot needs a way of implementation so that what they have recommended is implemented. When looking at this report and think practically about what is going on in the counties, mine included, I think there is lack of work morality on the side of governors. The governors either do not understand their responsibility or what they are supposed to do and end up doing other things that are not helping the citizens. For example, there is a lot of diversion of health budget that it goes to do some other things apart from what the money is supposed to be doing. It is supposed to be buying drugs, they are not doing that. It is supposed to be paying doctors and nurses and even those who are casuals, they are not doing that. And so nearly the whole budget is doing something else that has no connection with health. And therefore, and then the governors are treating this budget and even the whole budget in totality that is coming from the national government to the counties, they treat it as personal and private. So, so that there is no moral obligation that they should be careful about misuse and mismanagement of the funds coming from the national government. And then on the side of doctors also, a colleague of mine expressed a concern about the clinics outside the hospitals and the pharmacies outside hospital and in towns, that patients are directed to go and buy medicine, to go and buy whatever they would get from the hospitals. And so there is a collapse of morality on the side of doctors, and then there is also trade attitude and making of money has kicked on our doctors and nurses, such that they no longer want to treat citizens the way they trained or they were trained as doctors and nurses. And so there is a total inhuman or inhumane in their attitudes towards the citizens and everybody. And therefore, making the whole system, when the governor is not in a position to be answerable and responsible for his job as trained, and then the whole system is collapsed because nobody is paid. Even those that are casuals, they are supposed to be paid some amount. Like my county pays people $4,000 a month, $6,000 a month, and then some of those who are better qualified, better paid, must have a relationship with the governor, either a relative or political supporters. And so the whole thing has lost meaning, and it goes down to when there is a gross mismanagement nationally and all over, why should there be an action taken even on one county government so that it becomes a lesson for the others? But because we go as senators and find findings, and then what do we do? Even if, the best report has been given, but what do we do? What is the plan of action? What is the next step after the report being given? So that is what is left, and therefore, because no governor has been punished or have been made to answer, therefore, they just continue with the mismanagement, with the rogue attitude that is collapsing the whole system of health as far as counties are concerned. And so people wish it would go back like it was. And so while we are happy that devolving of these activities have gone near the people, but those who are managing it are not properly doing what they are supposed to do, so that it makes the services better on the people and in the levels that are supposed to be near the people. Then, on the point of supplies, governors have privatized that part. Like my own county, the spouse of the governor is the supplier. And so she gets paid even without supplying a thing. So you find that there is no milk in the tea because she hasn't paid the supplier. And the supermarkets where maybe she would be taking sugar from, there's no supply because she doesn't pay. So all the supplies, even firewood, nobody brings firewood because she does not pay those who bring firewood. Yet of all the contractors that are contracted to do work in the county, she is number one who is paid, and paid so much money ahead of everybody so that she is okay. And therefore, the whole system of supplies and suppliers have collapsed. Needless to say, they normally corruptly get awarded the project. So I support the report and wish action would be taken against even one county government so that it becomes a lesson for the others. Thank you very much. I support.
Senator Kadri Muma.
Thank you, Honorable Speaker, for an opportunity to contribute to the reports by the Committee on Health. Honorable Speaker, I support the reports on the counties, that is Kitui, Machakos, Makueni, Bungoma, Kakamega, and Kiambu, done by the Committee on Health. Honorable Speaker, whenever I speak on health, I always say that this is the one subject on which we must work collectively as a house to ensure that we contribute the best that we can to ensure that both the national government and the county governments do the best they can to deliver this service to the people. Honorable Speaker, the right to health is only second to the right to life, because when we don't have good health, we cannot do all these other things that we would want to do for development. So it is important that all leaders in this country, the governments at the national and county level, take the implementation of the right to health seriously. Honorable Speaker, I want to commend all the counties that were evaluated for the areas where they are strong. But the key thing in terms of our oversight is to point out areas where they are not working well. Honorable Speaker, if you check all the reports, there is one recurrent issue about the management of clinical waste by our hospitals. Honorable Speaker, this is a problem across the entire country, a problem that you will find with Kenyatta National Hospital and a problem that you'll find in all the counties. Clinical waste is actually an opportunity to further the communicable diseases. So managing clinical waste is actually a health act rather than just managing solid waste. It is an issue or something that our hospitals and our governments have never appreciated. So if you go to a number of hospitals, they hardly have any budget lines around incineration. They are not researching on the modern ways of dealing with clinical waste, and as a result, we are just recycling diseases because we are dumping clinical waste, sometimes mixed with other waste. If you went to Dandora, you will find that people are picking waste that includes syringes, that includes bags that have been used on patients, and many other issues. Honorable Speaker, maybe we need to come up, maybe the committee should recommend a motion around the issue of biomedical, of managing the clinical waste. Maybe we should even contemplate having the biomedical courses in our technical institutions so that we can actually create some industry around the management of clinical waste and be able to create jobs for our young people across the country. So I would urge that the committee follows up on this issue, being one of the issues that is common to all of the places that are found. I'd also like to speak to the issue of the mess. The equipment that were purchased in the first term of the Jubilee government, many of which were just put in boxes, and the committee has found that in some of those places, some of these facilities are not functional. This is a question we casually speak about, but I think it is high time the Senate came to this House with a report on how much we have paid as a country on this leased equipment that were forced down the throats of county governments, and which, some of which are still in boxes, but for which we are actually paying monies every year, many of which have not been operational because we did not think through on how to operationalize them. We did not train the personnel to actually operationalize these facilities, and as a result, we do not have the infrastructure and the personnel to run them. This is a big issue that costed this country a lot of money, and sometimes the failures in our health facilities is designed because of those who are interested in making money through procurement. I think the Health Committee owes this country a final report around the issue of the mess, so that people of Kenya can know what has been happening. Honorable Speaker, another issue that is important, that is cross-board, is the failure by county governments to remit deductions belonging to workers. This committee focused on the health workforce, but this is a problem across the counties. I have said it before this Senate goes off, after this session, one of the things we need to do is to compel all counties to remit the statutory deductions belonging to workers to wherever they're supposed to go. It is painful to hear that someone would be a doctor dying of a disease because they cannot afford health insurance. They cannot be treated. What a contradiction. We need to actually take this seriously, Mr. Speaker. I don't know how we do this, so that the statutory remittances by counties must be taken seriously and actually cleared. The pending bill in respect of the workers' dues must actually be cleared. If there is only one oversight issue that we should focus on collectively as all committees and the entire Senate, is to help the workers in the counties to actually receive their dues. Honorable Speaker, that money does not belong to the county governments. That money is money that belongs to those workers. Why do we have this issue recurring with every committee report that comes here? We learn on how statutory remittances are not being given in respect of ECD teachers, in respect of health workers, in respect of those working in the agriculture sector, and we are doing nothing about it. I think we need collectively to be able to say, out of this report, the one or two things that we must do must include holding counties accountable to these remittances. Honorable Speaker, as you are aware, Kenya has adopted universal health care. Universal health care actually means that we are trying to facilitate every Kenyan who is sick to be able to access treatment. This does not mean free. There is nothing that is free. It means that we must collectively find the necessary resource to ensure that the most vulnerable among us are able to get equal access to treatment that we in Parliament are able to get. Honorable Speaker, it means we must have very prudent management of resources in the health sector. It means we must actually honestly be able to contribute for those who need to contribute. It means we must get rid of this sector, corruption, get rid of corruption from this sector so that every cent is able to go towards the care or the healthcare services. It means we reevaluate the amounts within the national, that the National Health Ministry is receiving vis-a-vis the county governments in order to take care. I don't subscribe to, I can see Senator Dulo is not here. She's talking of reversing the health function to go back to national government. I don't agree. Before 2013, it's not as if we had a functional health service. Devolution has actually brought health services to a better place, but we are retrogressing again because of rampant corruption, both at the national and the county governments. So we, as those who oversight, and this house in particular, because this house has no access to development funds with which you can play monkey business, this house must be the one that is the moral conscience of this nation on how we implement on the right to health. And I am pleading with all of us that if there is one thing that we must agree on, all of us, is that the health system in this country must function and function well. Honorable Speaker, there is the issue of health systems management. Health systems are one way of ensuring you ensure accountability in the health systems. I can see in the reports, we seem to have a failure of health systems everywhere. The digitization is failing, and Honorable Speaker, it's not just in the health sector, it's failing even in the revenue collection systems because people want it to fail. If it fails, then we have opportunity to steal. Honorable Speaker, I don't know what it will take for us to be able to put in place that health systems that will enable us to actually track how we are managing diseases in this country, how we are taking care of our patients. In fact, each county should be able to know exactly how many people it is planning for in respect of whatever non-communicable disease or other communicable diseases and so on. So health systems are important, and I'm glad that the Health Committee put their finger on this and are trying to hold all the counties accountable to this issue. Honorable Speaker, as we speak to the remaining of the counties, I want to urge the Senate that as we do this oversight, we should now start apportioning deliverables to every term that has been there. Sometimes you'll go to a county, you are talking about hospitals that have been there, operating with exactly the same budget from those days. Let us be able to evaluate to find out when Senator Kathuri moved in as governor of Meru, that Meru had X, and Senator Kathuri, now governor of Meru, has moved Meru by 10% in terms of the value of the health system. I'm afraid some of the reports that we have speak generally. And as we found out in one county that I will not name, when we went to evaluate ECDE, we were taken to projects of the previous governor because this particular governor had not done anything. So I'm just alerting us that we need to be able to have oversight tools in Senate that can actually measure progress in every county, so that we don't have the trickery of governors showing us what previous governors did and actually using them to account for monies that they are not actually expending on those projects. So as I finalize, I want to ask the committee to work even harder in order for us as a country, one, to ensure even greater intergovernmental collaboration and cooperation, so that if Kiambu is doing well on X, if Homa Bay is doing well on X, and one of the things I know the president recently launched the maternal and neonatal mortality reduction program. I want to tell you that the counties already have an inter-county MPDRS, that is maternal and perinatal deaths surveillance system, that has helped some counties, amongst which is Homa Bay and Kiambu, that then recorded 0 maternal deaths for a number of months. We are hoping that that program can also move on to neonatal mortality surveillance, so that we do what it takes to also reduce child mortality or neonatal mortality within our counties. So the committee should also interrogate intergovernmental and inter-county cooperation for the better delivery of the health service. Asanteni sana.
Next is Senator Chalge. So before just a minute, let me first make this communication. Honorable Senators, we have a visiting delegation of teachers and learners from Musingu Boys High School in Kakamega County. Honorable Senators, I would like to acknowledge the presence in the public gallery this morning of a visiting delegation of 4 teachers and 130 learners from Musingu Boys High School in Kakamega County. The delegation is visiting the Senate for an academic exposition. On behalf of the Senate and on my own behalf, I extend a warm welcome to the delegation and wish them a fruitful visit. Thank you. I understand one of the members, senators, is an alumni of Musingu Boys. Senator Wakoli.
Thank you, Honorable Speaker. Naomba nizungumze kwa lugha ya taifa. Nikushukuru sana Mheshimiwa Speaker kwa nafasi hii ili niweze kuwakaribisha wanachuo wenzangu wa shule ya upili ya Musingu, ambayo mimi nilikuwa mmoja wao kutoka mwaka 1999. Na hivi ni kudhihirisha kwamba shule hii kauli mbiu ni nidhamu na bidii. Mheshimiwa Speaker, nina furaha sana wanafunzi hawa kuja, kwa sababu siku zetu haikuwa rahisi kupata nafasi kupita mipaka ya mkoa Magharibi kuja katika jiji, ila ni katika tamasha za muziki katika jumba kuu la KICC. Lakini zaidi ya hapo, Mheshimiwa Speaker, mara kwa mara wenzangu jitapa vifua na kudai kwamba wao wako katika shule nzuri sana katika Kenya. Leo lazima watu wajue kwamba maji matulivu yana kina kirefu. Mheshimiwa Speaker, katika jumba la Senate, Mheshimiwa Daktari Boni Khalwale alisoma shule hii. Mheshimiwa Wakili Edwin Sifuna alisoma katika shule hii. Mheshimiwa Alan Chesang alisoma katika shule hii. Mimi mwenyewe kiranja wa wengi, Mheshimiwa Speaker, nilikuwa katika shule hii. Katika jumba la kitaifa, Mheshimiwa Speaker, Mheshimiwa Fred Kapondi alikuwa katika shule hii. Mheshimiwa Fred Ikana tulikuwa darasa moja kule Msingu. Mheshimiwa Tindi Mwale alikuwa katika shule hii. Hii ni kudhihirisha kwamba, Mheshimiwa Spika, katika historia ya Kenya, shule kutoa wabunge 6 sio mchezo. Ni kwamba ukiona vyaelea, bila shaka vimeundwa. Ndio kwa sababu tutaendelea kuchonga historia ya uongozi katika Kenya hii, kuendelea japo tofauti za kisiasa, kudondoa hoja za kutetea mnyonge katika Kenya hii, na kuwapa vijana wa nchi hii motisha na ari ya kufuata azma zao katika barasti ya maisha. Sasa ndugu zangu wanafunzi, mimi nilikuwa kiranja wa bweni la taifa. Nilikuwa vile vile kiongozi wa vijana katika mchezo wa vikapu. Nilikuwa katika kikosi cha Ngonjera. Na licha ya hayo, mnajua kikosi cha Jombi extra muzika, wale ambao tunapocheza kandanda, tunapocheza raga, sisi ndio tulikuwa tunaimba pale uwanjani tukitumbuiza watu, na ukileta mchezo tulikuwa pia tunakabiliana nawe. Hii ninamaanisha kwamba, ndugu zangu, penye nia kuna njia. Bora ujisitiri na uwe mwaminifu kwa Mungu, mwaminifu kwa azma yako, na uheshimu walimu wako. Hapa unapoona ni viongozi waliobobea. Mheshimiwa Mungatana nikiwa shule hiyo nilikuwa namuona kwa runinga. Leo ni mwenzangu ananiita mheshimiwa. Kwa sababu gani? Fuata azma yako na usikize, kwa sababu wahenga walisema. Mheshimiwa Spika, hawa ndio hawaamini kwamba mtoto wa maskini anaweza pana azma hii akawa seneta katika nchi ya Kenya. So ndugu zangu na walimu, mimi ni mwalimu kitaaluma, nafurahi sana kuwaona mkiwaongoza watoto ili vile vile waweze kufurahia matunda ya nchi hii. Na Kipchoge alisema, chochote unachotaka hakuna kikomo, bora unafuata azma yako.
Maybe point of information maybe.
Mheshimiwa Spika,
yeah.
Nimepaswa ujumbe huu miaka nyingi nilipoanza safari ya kuja bunge. Lakini kwa sababu ya heshima tu yake kama wakili, seneta aliyebobea, nimempa nafasi aweze kunijuza yale alionayo.
Mr. Speaker, I am amazed by this very beautiful Swahili my colleague Mheshimiwa, who is also a very good basketball player in our team, so I like to listen to his speeches. But is he aware that I didn't attend his school? I heard him say I attended that school. I didn't. I attended the Alliance High School, which produced very many ministers, Mr. Speaker, and continues to do so to date. I thank you, Mr. Speaker.
Yeah, I think you did conclude your welcoming remarks, Senator Okoli.
Dakika moja, Mheshimiwa Mstahiki Speaker.
Leo uko na inaitwa nini?
Ninabubujikwa na furaha mpito Mheshimiwa Speaker.
Yeah?
Ndugu zangu, mnapoona maseneta wanachangia na kusifia shule zao, ni kuashiria kwamba uliko ndiko kitovu cha azma yako ama ndoto yako. Haijalishi kule unakotoka, lakini kule unakwenda muachie Maulana. Asante Mheshimiwa Speaker.
You know, Senator Chairai was signaling me because also he wanted to give you the list of MPs and governors, CSs from Kapsabet boys. Senator Catherine Muma, what is your relationship with the
Musingu High School? 1 minute, kindly.
Thank you, Honorable Speaker. Honorable Speaker, I am a daughter of Ikolomani constituency. And Musingu High School is in Ikolomani constituency. My brothers went there. My nephews go to Musingu High School. So I wanted to also welcome the young men and the teachers from Musingu to this house and to encourage you to continue thriving. Senator Wakoli did not mention that last year you actually beat Kakamega High School in football. Was that correct? Senator, I hope you will actually see them at the back and be able to commend them for that very exemplary performance that they had last year. But just wanted to encourage you and to urge you that since you come from a constituency, can you be among the schools that can stand tall in terms of discipline, in terms of integrity, in terms of performance, so that all we can hear of Musingu is good, 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 and nothing for bad headlines. Karibuni sana.
Senator Chelagay.
Thank you, Mr. Speaker. I also extend a warm welcome to Musingu High School as I contribute, Mr. Speaker, sir, and also inform them that our standards are quite too high, because out of the 5 presidents, we have produced the 2, so they still need to work hard to achieve that. Mr. Speaker, let me make the following. These county visits to Bungoma, Kiambu, Makueni, Kitui, Machakos, I want to commend the Committee of Health. And more so, the Vice Chair, Senator Omar, who she has been very consistent. Although I was disappointed she didn't come to my county, but I equally know the role that she has been playing as one of us in this committee. So, Speaker, we agree, and colleagues have said that there is consistent challenges that continue to bedevil the health sector. Mr. Speaker, I want to join my colleagues that the true definition of what evolution is will only be mentioned by one yardstick, and that is health. I don't agree with my colleagues who want to say, let us take back health to national government, because the national government, Mr. Speaker, their role is to provide standards. And that is what the Constitution in 4th schedule has provided for in Constitution of 2010. So, Speaker, it's very sad that we are still discussing mundane things about our health sector, especially in Kiambu, Bungoma, Kakamega, Makueni. I am happy that the students come from Kakamega. Mr. Speaker, it's very unfortunate if one of them falls sick, because when the committee visited Kakamega County Referral Hospital, they found a dilapidated ambulance that cannot carry the sick. And I don't think these handsome young men would want to be carried in such a ambulance, and I think Italanyi is doing a bad job there, Mr. Speaker. So it is important that the issue of health must and should be considered, Mr. Speaker, because there are raft of issues that are similar. The issue of drugs expiry and unavailability of drugs despite the initiation of Dawa Mashinani by KEMSA. Can you believe, and I agree, when you visit most of these health facilities, Mr. Speaker, you will find so many pharmacies near many hospitals. It is because there are no drugs in hospitals. The reason most Kenyans, Mr. Speaker, see that share does not work is because you go, see a doctor, you are done prescription, but you end up buying drugs outside the hospital. And that is why many Kenyans might think that share is not working, because they have to buy drugs out of their pocket, because Dawa Mashinani by KEMSA has failed miserably, Mr. Speaker. There is the issue of dilapidated infrastructure, Mr. Speaker. Window panes, walls, you saw in Kakamega, in Bungoma, where my brother, Senator Wakoli, is coming from. The floor of the Bungoma County Referral Hospital has cracked. It is very pathetic. When you go to Kimaeti, Mr. Speaker, in Bungoma, the issues are similar. There is dilapidated infrastructure, dysfunctional incinerator, Mr. Speaker, and I saw the governor there wearing school uniform. I don't know which belongs to which school. Mr. Speaker, we should also know when you come from a certain school, you must maintain standards that come with certain. So in Bungoma, a county referral hospital, in Kimaeti, Mr. Speaker, the story is very unfortunate. And therefore, I hope the whip will do follow up to ensure that what we see in Bungoma County Referral Hospital, in Kimaeti, all of them, they have roofs, walls, floors, kitchen, Mr. Speaker, and you know, when you go to Bungoma County Referral Hospital, the kitchen is in pathetic state. And you know, Senator Wakoli will agree with me, the people from that region, and even the young men from Musingu, what is important to them is the kitchen. If the kitchen is not functional, if the busuma, the ugali is not well done, Mr. Speaker, it is hard to recover in such hospitals. So when you go to Bungoma County Referral Hospital and you find a dysfunctional kitchen, you are doing disservice to the Mulembe nation. And the governor of Bungoma should and must be called to order, Mr. Speaker. There is the issue of asbestos or asadias. Most of the hospitals that we saw in Kitui, anywhere, in Makueni and many other areas, Mr. Speaker, you have to appreciate that the issue of asbestos has been condemned. But most of these facilities do not have resources to remove them, Mr. Speaker. We want to challenge the governors through FIF, Facility Improvement Fund, which we pass as a house, that they should use those resources, Mr. Speaker. The issue of deterioration of physical infrastructure is a big concern, Mr. Speaker. Even when you go to Makueni County Referral Hospital and Makuyuni, you will find, Mr. Speaker, that most of the hospitals continue to have dilapidated in Makueni. The issue of Makueni Level 4 and Makueni County Referral Hospital, Mr. Speaker, we have a dilapidated kitchen, crowded ambulance. There are a number of them. When you go to Makueni County Referral Hospital, it's very bad, Mr. Speaker. Even Makuyuni, there is understaffing challenges and also lack of laundry, Mr. Speaker. And when you go to visit, and when the health committee came to Kapsabet County Referral Hospital, we found that most of the bed sheets are dilapidated, Mr. Speaker. They are in bad shape, just like what we see in Health Club here in Bunge, where most of the towels are in pathetic situation, Mr. Speaker. Mr. Speaker, the issue of, and therefore, Makueni, where my brother, Senator Governor Mutula Kilonzo, should up his game. Because I expected a lot from Makueni, because we saw them, they had an qualified opinion, Mr. Speaker, which is, I expected Makueni County, Makuyuni Level 4 in Makueni County should have performed. Mr. Speaker, when you come to Machakos, we are still discussing lack of water. Mr. Speaker, when you visit at River, Level 4 Hospital, Mr. Speaker, there is no water. If we are discussing issues of water, issues of lack of salt, issues of dilapidated kitchen, issues of unbroken window pins, then the governors are doing a bad job, Mr. Speaker. And that might have been the reason, Mr. Speaker, you saw the governor of Wajir, Governor Ahmed Abdullahi, Mr. Speaker, was crying during the Madaraka Day celebrations in Wajir Stadium. He was not crying because he was emotional. He was crying because out of 50 billion that has been given to Wajir County government, nothing has been done in terms of health services in Wajir. You saw when we visited Wajir, Mr. Speaker, the TB, people who are treated with TB are living outside, Mr. Speaker. The disposal of asadas in Wajir Hospital is pathetic, and therefore, the governor of Wajir was crying because when he looked at the Wajir people, he realized he has done nothing despite receiving over 50 billion as a governor in his tenure, Mr. Speaker, while we continue to thank the president. And I expected to see you there, Mr. Speaker, but since the speaker himself was there, I knew you were in Meru handling Jurinjeke matters and preparing to run for the governor of Meru. And I'm told you are called Kamia nowadays. Mr. Speaker, the issue, another point I wanted to make is on the issue that we saw in At River. And I want to challenge, Mr. Speaker, that our counties, we must look in Kiambu, because I want to be very precise.
There is a point of order from Senator Veronica Maina.
Honorable Speaker, I want to raise a point of order on accuracy of fact. Honorable Speaker, is the Honorable Senator in order to indicate that the governor of Wajir was crying because of having failed to do what he was supposed to do on the hospital and health infrastructure, while in actual fact he indicated he was having tears of joy to see the celebration of Madaraka having recognized a county that was treated as an outlier county or marginalized or peripheral county, and he acknowledged that now the president had brought that county to the mainstream and considered it good enough to host the Madaraka celebration, a historic event which has never happened in Wajir County, Honorable Speaker, and which I had the honor to attend, and would have also loved to see you there, Honorable Speaker, though you had other engagements, maybe in Meru County, is that, Honorable Senator, in order to indicate that the governor cried for different reasons than what he enunciated on that day.
So can you verify now your facts?
No, Mr. Speaker, I thought Senator Veronica wanted us to know that she attended the Madaraka celebrations, and we're happy she did that. If she wants information about the performance of Wajir, the report has been tabled by the Health Committee, and Senator Omar is seated to her. She can share with the report, and I'm willing.
You know the issue is you arranged that the governor for Wajir County.
Yes.
For shed tears.
I said the
because of
governor was
non-performance.
emotional. I didn't say he's shedding tears.
So that is the point of order from Senator Veronica.
I said, Mr. Speaker, if the answer can bear me out, I said he became emotional. I didn't say he shed tears.
Actually,
so I don't
you
know
said
where.
he was not emotional, but you know, the answer
But
is very clear, and I was really keen listening to you. I thought there will be a member who might raise a point of order on your statements.
Mr. Speaker, I think the issue is
so
very
how
simple.
can you prove about the emotional issue? How can you prove now to this floor, to this house?
Mr. Speaker, I have, and I will table, and it is part of the documents, on the report by the Health Committee of this house that tabled the report
it was
on the
not the
status
report
of
which
health.
was being discussed in Wajir. It was celebrations for Madaraka Day celebrations. So
Mr.
how can you table now a report on the county?
Mr. Speaker, if it will ease the house.
Can you kindly withdraw that?
Yes, he was shedding tears. He didn't shed tears, but I say he became emotional. So that is the point, Mr. Speaker. So, Mr. Speaker, on Kiambu.
Can we withdraw that part about the non-performance? Please, you have to do that.
Which one?
You know when you arrange some issues that you can't really substantiate, and this governor.
So I withdraw the part of
Abdurrahim,
shedding tears.
cannot be
Mr.
able
Speaker.
to come to this floor to defend himself.
So, Mr. Speaker, I withdraw the part shedding tears, but the fact remains that there was a report on Health Committee that indicted, and I wish Senator Omar,
So
and
have
it is
you
part of the
withdrawn?
documents. So I have withdrawn the part of shedding tears. So I proceed, and there was a report that was tabled on even, and I seconded that report,
There's a
and it
point
is
of
part of
information
documents.
from Senator Mariam.
No, I thought that report is before the House.
Senator Mariam wants to
Can I
inform
proceed?
you. Are you ready to be informed?
Maybe Senator Omar can inform me because she's the owner of the report on health.
Senator.
Thank you, Mr. Speaker. Mr. Speaker, I wanted to inform the Senator that what he is contributing is two different things. This is Madaraka Day, and the other one is about the report we have tabled in the Senate. Yes, the report has so many discrepancies. Nothing has been done, but it is there. But when it comes to emotional issue, Mr. Speaker, it is about the northern Kenya, which President has recognized in Madaraka Day. So let the Senator to withdraw on the issue of emotional on what has not been done by the governor. It's only that. If he withdraw that one, the report is the way it is. The recommendation is there. Thank you.
He didn't withdraw about the shedding of tears, and he has withdrawn that bit.
Mr.
So
Speaker.
can you really discuss the report without censures?
No, Mr. Speaker, we were discussing, I heard my colleagues had mentioned the issue of health across the country, and they were tying him to the report, so I don't know why. I even heard a senator here speaking about Ebola, which is not part of the report. Mr. Speaker, anyway, let me proceed, but I will restrain myself to the Kiambu, Karuri, Kiambu, Ruaka. Mr. Speaker, Kiambu, in as much as there were some issues, we realized that their maternity are overcrowded and missing mosquito nets. So if you have us discussing Mr. Speaker, the ODM party leader is in the House today, Senator Oburu Odinga. If you have us discussing about non-availability of mosquito nets in maternity ward in Kiambu and Karuri and also Ruaka hospitals, it's very unfortunate. And even overcrowded maternity. In fact, this committee will deny data of mortality to the hospitals, Mr. Speaker, which is very unfortunate, Mr. Speaker. Even the dilapidated infrastructure. And Mr. Speaker, in Kiambu, people are operating in a funny way. You can just walk into a Kiambu hospital and walk because there is no identification documents. The nurses there, the staff are not wearing badges, Mr. Speaker, which is very unfortunate, Mr. Speaker. And even the issue of mortuary, we agree, and I agree with my colleagues, that the issue of mortuary, Mr. Speaker, we must agree that there is a problem. We don't want Kenyans to have international departures to heaven. But we must agree that the issue of mortuary is still a problem. All over counties, even in Nandi, I have only one functional mortuary in Nandi Sub-County Hospital, but we don't have in other. And there are many dilapidated, even here in Kenyatta National Hospital. So, Mr. Speaker, I want to appeal to the committee that after they done visits, because they have done Nandi, they did Elgeyo Marakwet, they have done others, Mr. Speaker, we must also visit referral hospital, Mr. Speaker. You know, referral hospital are suffering because of overcrowding by counties. Like Eldoret, Moi Teaching and Referral Hospital, I want to appeal to the Health Committee, if it is not too much, through the Vice Chair, to visit Moi Teaching and Referral Hospital of Eldoret because it's slowly collapsing, Kenyatta National Hospital, Mbagathi, Mr. Speaker, so that we can ensure that as a county, we move forward as a country, Mr. Speaker. Finally, Mr. Speaker, on this issue of stall projects, health projects, as I conclude, when you look at counties, I think like in Nandi, Mother and Baby, you have seen most of them, Mr. Speaker, across. And I'm happy that Senator Omar-led committee has noted this issue of infrastructural problems, Mr. Speaker. Because even in my county, the governor has been doing Mother and Baby for the last 10 years, and yet it's not complete. You go to many counties, and I'm happy this report has talked about infrastructure delay, even in Bungoma, even in Kakamega, Kiambu, Makueni, and Kitui, Mr. Speaker, and even Meru, Mr. Speaker. There are some of the dilapidated infrastructure. Like, for example, in Wazingishu, they have stall projects worth 2.4 billion, which is the highest in the country, Mr. Speaker. And these stall projects, they have paid 1.0 billion. Yet all of them are stalled, like when you go to Siwa Level 4 Hospital, when you go to Tarbo Sub-County Hospital, when you go to Keses, all of them are stalled, yet 1 billion has been paid. And you find yourself funny in most of these counties. Mr. Speaker, they are doing a snake park worth 5 million, and they have used 4.8 million for a snake park. Yet there are no drugs in hospital. For example, in Wazingishu, you have a snake park that have paid 4.8 million. And 5 million. You know, in my culture, if you do around with sex, we are worried what you want to do with the snakes, Mr. Speaker. Because it is not like India where snakes are being used for sports. Snakes are used for other things, Mr. Speaker. So we must, and even they are doing, I'm wondering, they are doing a museum worth 25 million in Wazingishu. Yet they are not completing those toll projects. Even in Nandi, Mr. Speaker, can you believe in Nandi dispensaries are closed between Saturday, Sunday, and they open dispensaries between 8 a.m. and 5 p.m. I don't know whether sickness has a way of coming. So I don't know, can sickness not come after 5? This is a problem that we must face as counties. Finally, I want to challenge counties on the issue of Ebola preparedness. We want to hear counties discussing what are they doing to prepare the issue of Ebola preparedness. And I've had my colleagues, Mr. Speaker, we have to accept there are Kenyans working in DRC. This is not a corridor where our drivers drive all the way to DRC. Our colleagues who are opposing Ebola preparation by the country, telling us that Kenyans who are in DRC or drivers, they should be locked out. And Mr. Speaker, what people are not telling, and I'm happy the president said in Wajir, what people are not telling, the biosecurity agreement was signed in 2015 by former President Uhuru Kenyatta. When 640 a plane from China landed here during COVID crisis, no one went to demonstrations because it was Uhuru Kenyatta. But when President William Ruto prepares facilities to fight COVID, not Ebola, which 15 cases have been reported in Uganda, the demonstrations are being done. And we don't know to blame our school children when they burn down their dormitories. because they have seen what their parents are doing in the streets. They are burning houses, they are looting, Mr. Speaker. So we must be ready as a country, and I want to encourage the President, the government, led by the CS Aden Duale, that we must be ready, prepared for Ebola preparedness, Mr. Speaker. It is the obligation of government to ensure that we have necessary facilities to prevent Ebola in this country. Mr. Speaker, with those many remarks, I beg to support this report.
Senator Veronica Waheti, and then we approach the chair for some more guidance.
Thank you, Honorable Speaker, for this opportunity to comment on the report that has been brought to this House by the Health Committee. Let me first commend the committee for the good work they have done.
Honorable Speaker, they carried out the mandate that they were supposed to carry out, and I would say this is how oversight is supposed to be done. Oversight of functions that are devolved must be followed up by the relevant committees to see whether they are actually implementing what is expected, that counties are implementing what is expected. So the committee has gone out there to the different hospitals from Kitui, from Makueni, from Kiambu, and a few other counties, Machakos also, and they have assessed the state and the quality of the infrastructure, facilities, hospital equipment, and even provision of emergency services. They have assessed the automation of healthcare provision systems for patients, drugs, and commodity management. They have assessed the availability of requisite healthcare personnel, the gaps and challenges in the counties that are cited in the report, and they have also assessed the availability of training and capacity building programs and avenues for healthcare workers in emergency healthcare, specialized services, and referrals. Honorable Speaker, the shocking thing is that the report they have returned here is not something we did not really expect, because we do know that our healthcare has still not yet achieved the standard and the quality that it should have achieved by now. But shockingly, Honorable Speaker, is to see that the same problems we may have discussed in year one when we were in Senate are the same problems in those hospitals that we are discussing today, which is year 4, just before the tenure of this Senate comes to an end. And we ask ourselves, Honorable Speaker, in the mapping of the healthcare, the scope of healthcare services, and the standards that are supposed to be rendered by the healthcare services in our respective counties, what is going wrong? And what exactly do governors think about the right to healthcare, the right to health for the citizens of Kenya? I think, Honorable Speaker, to be fair, national government has done a lot, even rolled out the Universal Health Coverage Program, Honorable Speaker, that intends to ensure that citizens have access to health services, have access to health care, have access to medical medications, Honorable Speaker. But unfortunately, the counties are not holding to the end of the bargain. I have especially looked at the report that was returned against Kitui County, which has a population of about 1,136,187 people. If you look at what's happening in Kitui County, Honorable Speaker, it is pathetic to see that even the TB patients are being boxed within a cube inside an ordinary ward. Now, who does that, Honorable Speaker? This country is the one that is even giving medical personnel to other countries within the region. Even a lay person knows you cannot put a TB patient who is at a very infectious stage next to other patients. It's no wonder, Honorable Speaker, that you'll find the way counties are running these hospitals is in a very, how would I say it, lackluster manner, kienyeji, if I was to use Kiswahili. I have even looked at the Reno unit in Kitui. You should look at these photographs that are attached to this report, Honorable Speaker. It is a big shame if a county cannot even clean up an area and it's within a hospital setting, Honorable Speaker. And I think, Kitui County, just wake up. You want to tell us that even if you had the facility and the drugs,
You are not able to manage your personnel to clean up areas within a hospital setting, even housekeeping, to avoid infections being passed. Honorable Speaker, we are very much aware that in hospitals, there is always a possibility of catching one of the worst bugs because of hygiene, just basic hygiene. So, Honorable Speaker, it looks as though counties have still not taken healthcare with the seriousness that this healthcare deserves. And I want to say this, while as the Senate has done well to oversight, and that committee needs to visit the 47 counties, and health committee, led by their chair, Senator Madago, and deputized by the very able Senator Mariam Omar, a member of Kenya Women Senators, who is doing a very good job. Honorable Speaker, they need to go to other counties and assess periodically, maybe even every 6 months, to check what is happening. And I welcome them to Murang'a, because just the other day, on 20th May, Honorable Speaker, a resident of Murang'a reached out to me. She was expectant and she had an emergency. She was going to give birth in the hospital. And when she got there, 4 days, Honorable Speaker, she was not attended to. I do not know her personally. She sent a message to me, crying if she could be helped. And within the course of those 4 days, I do not know where the doctors were, where the personnel was, where the records people were, where the emergency section was, what the maternity wing was doing. On the 4th day, unfortunately, the baby died in her stomach, Honorable Speaker. And she still was not attended, so she called for help, saying, now help me to get discharged from this hospital so that I can find help. It is very wrong, Honorable Speaker, that women who are expectant, 4 women, 5 women are sharing a bed with their babies there, with their infants, who are very fragile and very sensitive to any kind of infections, Honorable Speaker. And then we bundle those mothers together. If one child is ill, maybe the infection will be caught by the other children, the other infants who are sharing the bed. Can we say on a bare minimum, there is a level we are not supposed to fall below? Can the counties dignify the mothers, expectant mothers? Counties, we ask you governors. We know we only have 6 women governors who may have gone through maternity and labor ward. But can we, on behalf of all the mothers in the Republic of Kenya, ask the counties to ensure mothers, when they are delivering, are not sharing beds? It's a very sensitive moment, and that's why you see infant mortality, maternal mortality is a question that is discussed the world over, and data is retained to show whether we are doing better or we are doing worse, because a mother being expectant is not a death sentence, Honorable Speaker. And if it's a death sentence today, it will be a big shame to our universities that are churning out doctors within the Republic of Kenya, and even training doctors for other countries that are around Kenya, neighboring Kenya. Honorable Speaker, we also need to remind the counties that they need to enable their doctors and the personnel to be able to carry out their duties with ease. And I want to make a proposition today, Honorable Speaker. Some of this money you are seeing, these billions that are allocated to counties, I am happy with Governor Anne Waiguru. She has dedicated about 68% of her budget. I heard that when we went for the launch of Enewe. Is it called Enewe? Every mother, every newborn program, Honorable Speaker, that she has dedicated around 68% of her budget to medical care and health care facilities. Honorable Speaker, I want to request the governors, could we dignify the mothers who are expectant? Can we dignify them and allow them to at least have a bed and have access to medical personnel that is able to help them promptly, so that we do not have women dying today in Kenya while giving birth, Honorable Speaker? And the infants also, Honorable Speaker. You remember there was a time Kiambu County was cited on media that so many infants had lost their lives there. And the county, though it denied those allegations, it also admitted to an extent that some had been lost. In this day and time, Governor, you must get interested. If one infant dies in your county, don't accept it as an ordinary thing. Let the reports be brought to the table to know why that infant was lost or why a mother was lost. Nothing is as painful, Honorable Speaker, as a day when I went for a funeral for a 24-year-old in my county who died while giving birth and left an infant who was 1 day old, Honorable Speaker. And I looked at her eulogy and asked myself, at 24, she bled to death because a hospital that purported that it should have been licensed pretended to be a healthcare institution, and yet they did not have capacity, allowed that young girl to bleed to death. Honorable Speaker, I want to ask the Council of Governors, can we wake up? Nobody should touch, in the name of corruption, a coin that is intended for healthcare within this republic, Honorable Speaker. If you do that, remember, you have done it against your very relatives who are within that county and who will one day or the other unable to access that health care, Honorable Speaker, and they will follow the channels that you would never want to follow, and yet you may not link it to them. But the fact is, if we have a level 3 hospital in one part of the county, and your relative was unable, you relative of the governor was unable to access that health care, if they die out of that failure to access medication, Honorable Speaker, it means that you have failed your relatives, and even your relatives will follow the same path that the Kenyans are following, and God forbid. So I want to say this, because we have struggled a lot as a nation with the question of corruption, we need to check the procurement. And if KEMSA is the one that is supposed to refill the drugs in all these hospitals, because under every hospital here, we are seeing the capacity of KEMSA to refill drugs to hospitals is actually low. It's about 50 to 60%. There should be no reasons why procurement cannot be seamless for emergency, to assist with medical emergency, Honorable Speaker. And finally, Honorable Speaker, because I want to give a chance to other members to talk about the healthcare and the report that has been brought here, I want to commend the national government for the SHA program, and I want to ask any person, any Kenyan, especially kutoka Murang'a, please don't come asking for medical bill support if you have not registered for SHA. Because what do you want us to do with you? If everybody brings a medical bill to Mheshimiwa, and yet you have refused to register for SHA, which could take care of about 30-40% of that bill. In fact, nowadays when I'm brought a bill to assist, the first question I ask the residents is, are you registered for SHA? Have you registered? And I believe it is star 147 star, or maybe 147 hash. And I believe every Kenyan should be registered for SHA, so that you can hold the county government accountable, you can hold the national government accountable to share in the bill that they are supposed to pay for you in the eventuality, the unlikely eventuality that you are admitted in or you are accessing medical care and health care within the public facilities. And finally, Honorable Speaker, over 95 or maybe 96% of Kenyans are only subject to be helped through the public healthcare facilities. So it's not a small issue, and governors need to take it very seriously. The allocation of funding that is supposed to go to improvement of facilities, Honorable Speaker, should go direct to the improvement of those equipments and facilities. Why do I say so? Because right now, the healthcare ecosystem has been allowed to receive money, to have an income directly from the county to ease the process of repairs, the process of maintenance of equipment in hospitals. And I'm shocked to see that there was an X-ray machine which was not working for 3 weeks in Kitui. Why would we not have basic equipment working or operational and serviceable to be able to serve the people? Honorable Speaker, with the advent of technology, we should be managing diseases, we should be managing infections, we should be having public health departments within the counties which are so strong that we can have preventive measures to avoid a situation where diseases get too serious until they require much more resources to be treated in high-level hospitals. And let me take this opportunity, Honorable Speaker, to congratulate
Wajir County for the hospital that His Excellency President William Ruto opened, a level 5 teaching and referral hospital in Wajir County, which has opened that whole northern region of the country with 3 operating theaters, with an ICU, with a HDU, and a state-of-the-art emergency section, emergency center there, Honorable Speaker. And I believe with this hospital, the people from Wajir and the neighboring counties now have help closer to the people, and it's easier, it's cheaper, and they can get access. But that facility may not help if there is no follow-through with maintenance, follow-through with the medication being available, follow-through with dignity to patients, patients like mothers who are delivering, being given the dignity that they require to have when they are delivering, and in their moment of pain, their moment of struggle as they bring forth newborns, Honorable Speaker, they require to be given that dignity. Women have suffered for so long, and it's time we have health care that is also gender sensitive and sensitive to the needs of the mothers, sensitive to the needs of patients who are having infectious diseases. And Honorable Speaker, let me also say that because we are advanced in how we are rolling out healthcare in Kenya, we must also accept that preparedness does not mean we are inviting disease. Can you imagine, Honorable Speaker, in 2019-2020, if the Ministry of Health did not take any measures to prepare for COVID, to contain COVID, we must have centers that contain disease, not to attract that we are asking for disease to be brought over to Kenya, but centers that contain that infection, so that in the event that anybody crosses into Kenya, even with Ebola, the doctors, we would expect the doctors and the Ministry of Health to have a center where they can manage and contain it and separate it from people who are not infected, to avoid fatalities because of public infectious diseases. And Honorable Speaker, maybe the Ministry of Health and Public Health need to be sharing information more to tell Kenyans that the U.S. Embassy has had a CDC center within the Republic of Kenya. And for the longest, I've always seen CDC, people being employed by that center for disease control, which is within the Republic of Kenya. Maybe if that information is shared, then Kenyans will be more at ease. And if Kenyans are explained for what isolation means and what quarantine means, that when patients are quarantined, then they are not supposed to be in contact with the rest of the world. They are supposed to be contained until they recover, so that the disease does not spread in any way. Honorable Speaker, with those many remarks, I wish to support this report and request the Committee on Health to please come and assess our health care in Murang'a County, because there are some of those clinics which have just been painted nicely in blue and white, but there is no medication. Even if you queue there and you're given a prescription, you are told to go and do your examination. If it's an X-ray, you are being sent out. There is no medication. And even if you are given some medication, ni Panadol, ama paracetamol, we want to see health care that meets the needs of the people. And finally, Honorable Speaker, we must accept that even ourselves as Kenyans, we have accessed health care in India. We have accessed health care in South Africa. We have accessed health care even in Singapore. Kenyans have accessed health care even in the US, in many other countries, Honorable Speaker. So maybe when a center is being done, we need to have a bigger, wider perspective that if the government kept quiet about Ebola and then a case happened, then what questions do they answer? What answers do they give to Kenyans if we cannot contain even one case of Ebola? It will spread to 10, to 20. It will do exactly what people are fearing. But I know right now, people must be very afraid. Everybody would be afraid of Ebola. I would be afraid of Ebola. I don't want to come into contact with it. But we must be realistic to know we must accept medical centers that take us to the next level and that are able to contain all the disease. The reason why Kenyans go to India, the reason why Kenyans go to United States or the UK is to seek for more advanced technology and more advanced medical help.
And if we do not have access to those countries when you need it, and when our nation does not have the facility that is required, then it becomes a very big difficult. We must think within that context, because God has positioned Kenya as a nation of influence, as a nation that has also supported our neighboring countries in many, many other issues. Thank you, Honorable Speaker. And we must also remember we are trading with all our neighbors, and the trade will not stop. We want life to continue, so let disease be contained within the centers that should contain disease. Thank you, Honorable Speaker.
Very well. Next is Senator Ososi Godfrey.
Thank you, Mr. Speaker, for this opportunity. Mr. Speaker, I have read the report that was prepared by the Committee on Health for the counties they visited, oversighting the county referral hospitals. And Mr. Speaker, when you read the reports, you get a shock of your life on the conditions in those hospitals. Conditions in those hospitals, Mr. Speaker, are not encouraging, and clearly you get the impression that very little work is being done to provide decent quality health care in our county hospitals. I have particularly read the report for Bungoma and Kakamega counties, which are counties near Vihiga County or in the same region. And it is very annoying that a big referral hospital like Kakamega, Mr. Speaker, has only one ambulance, which is a very dilapidated ambulance. If you look at the pictures that the committee has put in the report, you get shock of your life. How can such a big institution that is supposed to have quality services have that kind of an ambulance? Mr. Speaker, we have also noticed that as Senator Veronica said, the mothers sharing beds, the mothers who have delivered or are just about to deliver are sharing beds. It's very pathetic. We have issues to do with the detention of patients over unpaid bills. We have issues to do with the quality and size of the mortuary, particularly for Bungoma County Referral Hospital, Mr. Speaker. Mr. Speaker, all this is happening, and we are appropriating a lot of money to these counties. Kakamega alone gets 12 billion every year, Mr. Speaker. And they cannot prioritize the county referral hospital. Even just buying an ambulance, a good ambulance, is a problem, Mr. Speaker. Mr. Speaker, to me, when I read this report, and I've visited the 3 referral hospitals. I visited my own county, Vihiga. I have visited Kwale, Msambweni. I also visited Kilifi. I also visited Bomet. The situation is the same. Waste management is a problem in these hospitals, Mr. Speaker. Even the kitchen, Mr. Speaker, look at the kitchen in Bungoma. You can't believe it, Mr. Speaker, that kitchen is a place where they cook food that is supposed to be consumed by patients. It looks like a toilet, Mr. Speaker. Mr. Speaker, I'm very concerned because the governors in our regions are not working. The governors in our region, Western region, are not working. They are busy campaigning, Mr. Speaker. This weekend, it was one of the most sad weekend in our region. That governors would go to functions instead of telling people what they are doing to improve the quality of life of the people in the region, improve the healthcare system in the region. They were busy telling people how a certain leader is not qualified. to lead this country because he has no money and because he's young. I want to tell the governors, I don't want to mention your names because you know yourself. Please work for the people. Work for the people. Give people quality health care they need. 2027 will take care of itself. Why are you fixated with the presidency and at your county level you are not delivering for the people? So, Mr. Speaker, I am talking because I have read this report and I'm very disappointed that all the big money that we are sending to Bungoma and Kakamega counties, it seems that money is not doing the work that it should do because the governors are spending little time in working for the people. They are spending most of the time doing politics. If you look at the amount of money they are using in rallies, Mr. Speaker, that money is enough to buy an ambulance for Kakamega Referral Hospital. That money is enough to fix the kitchen in Bungoma Referral Hospital. That money is enough to buy extra beds for Kakamega Referral Hospital so that the mothers don't share beds. So I am calling upon our governors, particularly Governor Baraza and Governor, my friend Lusaka, please stop campaigning, go back to your offices and work for the people of the region of Western. We are not interested in you telling us you are so rich and a particular leader is poor that he cannot do campaigns. We are interested in you telling us that you have bought an ambulance for Bungoma Referral Hospital, you have bought an ambulance for Kakamega Referral Hospital, you have improved the kitchen in Bungoma Referral Hospital, you have employed those UHC staff. Mr. Speaker, sorry for diverting a bit to talk about politics of our region, but I want to tell those people who were talking over the weekend, I want to inform them that the President Obama became the president of US after serving for only 2 years as a senator. 2 years, and he became the president because the people decided. So when you tell us someone is not capable of becoming the president simply because of age or simply because he has been a one-term senator, and you are not telling us about what you are doing to uplift the standards of living of our people, you are missing the point. Madam Speaker, when you look at the report talks about non-functional machines in the hospitals. It is sad that MRI machine is not working in Kakamega Referral Hospital. Mammogram is not working in the same hospital. And this replicates in all referral hospitals. You see beautiful machines, but those machines are not working. What is happening, Madam Speaker? You also, we also have a problem with the automation in these hospitals. A big hospital like Kakamega Hospital has no system. They are relying on reports which are manually generated. That is a hospital that should have an integrated hospital management system so that operations in those hospitals are made efficient, are accountable, and they serve the people. At least Bungoma, they have tried. They have a semblance of an HMI system, which this report has recommended that they need to overhaul it and make it better. The issue of UHC, Madam Speaker, this is a very important issue. And it's not just UHC in terms of converting those staff to permanent and pensionable, but also meeting the standards, the so-called quality health model, UHC quality health model. Most of these referral hospitals, Mr. Speaker, they have audit queries on compliance to the UHC health model, which requires that the hospitals must comply with certain criteria of matters to do with the human resource and matters to do with equipment. The same affects these hospitals that were visited by the health committee. So something has to be done. Issues to do with FIF, Mr. Speaker. If there is one thing that was done right, is the decision to come up with the FIF. But FIF is still facing challenges, Madam Speaker, because we have scenarios where on paper you are told that the FIF has been implemented. But practically, Madam Speaker, you find out that there are still challenges with the FIF. I am saying that because I chair the committee of CPIC, and almost every hospital have an audit query on FIF. But there is something that we can do about it as a Senate, because you know FIF is for level 4 and above. But for the lower hospitals in the villages, the dispensaries, they do not have FIF. So what happens in some counties is that governors decide to distribute that money to lower level health facilities so that they can sustain them. But the law does not allow that. But practically on the ground, that is what they do. What we need to do is we need to amend the FIF Act so that we can have a system of sharing of the funds from the bigger hospitals to the smaller hospitals to sustain those smaller hospitals so that they don't run into financial challenges. Madam Speaker, the issue of drugs management, it has been reported in this report for Bungoma particularly, that though they have a pharmacy which is stocked, that patients are now being referred to go and buy medicine outside the hospital. Mr. Speaker, this is something that is affecting all referral hospitals. And something has to be done by the health committee. Because if you go to almost every referral hospitals, you see a proliferation of chemists around the referral hospitals. You see so many chemists and you wonder what is happening. It is because the medical staff are referring those patients to go and buy medicines outside. And some of those pharmacies are owned by those medical staff. This is something that the health committee needs to investigate to finer details so that we deal with any form of corruption that may be existing in the process of managing drugs in the hospitals. The issue of SHA, Madam Speaker. Madam Speaker, the delays in reimbursing SHA is a big problem and is an audit query in most of these referral hospitals because the delay affects the budgeting process, budget and control process, because they are not able to get the money in time. The delay affects the operations of the hospital. And this is something that must be worked on so that the SHA reimbursements are done in time so that end up not inconveniencing the hospital. And in some cases, it may even lead to total collapse of that particular health institution. Mr. Speaker, we have also noted in the audit report that most of these hospitals do not have hospital boards. The management boards are not there. And this is a simple thing to be done, Madam Speaker. I don't know why it is so difficult to have a hospital management board in place for many years. So this is something that, again, I'm challenging the health committee to look into, because the idea around having hospital boards is because the Office of the Auditor General is now auditing all hospitals. And the boards are accountable for all the processes in that hospital, including issues of budgeting, including issues of financial management. So it is important to have hospital boards in place, particularly in this environment where we have FIF. So the issue of having boards in place will help us in dealing with some of the challenges that have been noted in these reports. The issue of expiry of drugs, Madam Speaker, which of course links to the issue of inventory management, it links to the issue of drug management, it links to the issue of automation. It is a major problem. And it is a common audit query in all these health institutions. Something has to be done on it so that to reduce the cost incurred in expiring drugs and also the danger that is exposes to the patients in those particular hospitals. Madam Speaker, the matter of sanitation in these hospitals, I have looked at the report for Bungoma County. Look at the toilets. They are in shambolic state, Madam Speaker, and this is supposed to be a hospital where people go to be healed. You end up getting diseases in those hospitals. What is in a toilet? How much does it take to fix a toilet, Madam Speaker? So that is why we are saying, our governors, you are letting us down. And I'm happy Senator Wakoli is here listening to me and he knows all this. I'm talking from my heart because the Bungoma Referral Hospital serves many people. Even people from Kakamega, people from all the way Mount Elgon, people from even Rift Valley. And the same applies to Kakamega Hospital. We cannot afford to have this kind of environment in our health system because it now becomes a center of acquiring more diseases and not healing. So, Madam Speaker, these are very important reports. I want to encourage the Health Committee that, yes, you have given us very good reports, but now there is a problem in implementation. The recommendations you give, you need to follow up to ensure that they are implemented. You came to my county, you spent the whole day, you did a very good report, but I want to tell you, the challenges that you identified still exist because there is no implementation mechanism. You need to punish people. In fact, in this report, one of the recommendations that you should have made is to punish the officers or government officials involved. Because we cannot entertain some of the things that you have noted in your report. A hospital, a big hospital that has a dilapidated ambulance, and nothing is being done about that.
A big hospital that has so many mothers who have gone for delivery and they are sharing beds with their babies and with other patients, there is a problem. So, Madam Speaker, I want to encourage the Health Committee, even as they continue with their oversight engagement, they also need to put in place mechanisms to follow up on the recommendations that has been made in their own report so that we can succeed as a country. Madam Speaker, the matter of health must be taken seriously, and when Kenyans are concerned about some matters, I think the government needs to take it very seriously. When people are concerned about reports that Ebola centers are going to be set up in this country, they must be taken very seriously. Americans have said that they do not want those patients in their country. Why do we want to allow them to come to Kenya? That is something that must be taken seriously, and it must be handled with a lot of concern and care, and not in the manner that I've heard Senator Cherargei responding to. We want answers, and answers must be satisfactory.
And the health of Kenyans is more important than anything else, and more important than the health of any other citizens of our globe. Madam Speaker, I support these two reports, but I request that the Health Committee must do more on implementation follow-up on the recommendations they give. Otherwise, this is just going to be some kind of a cyclic problem, that every year we'll be doing these visits and nothing happens, and that will not
be serving our people in the right manner. Thank you, Madam Speaker.
Thank you, Senator Osotsi. Senator Mudigi, have you pressed? Okay, Senator Mudigi.
Asante Bispika kwa kunipa nafasi niweze kuchangia mambo ya kamati ya afya na vile ilionelea vile kazi inafaa iwe imefanyika katika nchi yetu ya Kenya katika kaunti 47. Bispika, yangu ya kwanza ni kushukuru kamati ambaye ile ilikuwa tengeneza sheria ya 2010 ambaye ilionelea kuwe na devolution, kwa sababu ilikuwa na maono. Bispika, ilikuwa imeangalia kamati kama 10 itaweza kuwa katika kaunti zetu, na moja kamati ilipitisha ni mambo ya afya, kwa sababu kulikuwa na mambo ya national government, na ile kamati Bispika ilikuwa imeangalia vile mwananchi alikuwa anateseka, na vile wakati kama huu vile mwananchi atakuwa amekuwa katika nchi yetu ya Kenya, watu watakuwa wengi. Alikuwa na maono aitoe katika serikali kuu ailete katika serikali ya county government. Kwa hivyo Bispika, wale watu wazee na kina mama ambayo walipitisha hii nieko kwao, wale wako sahihi na wale hawako, kwa sababu walikuwa na maono. Kwa hivyo Bispika, nikiwa senator wa Embu County, mimi naunga mkono mambo ya afya ikae katika kaunti zetu kuliko kaa katika serikali kuu, kwa sababu tunajua governors ndio wenye katika kufanya kazi ile inafaa mpaka katika mwananchi pahali alipo. Kwa hivyo mimi naunga mkono mambo ya kupandurisha, kama vile senator wengine wanasema mambo ya afya itolewe katika counties ipelekwe kwa serikali kuu kwa serikali kuu. Bispika, mambo ile kamati iliangalia ni mambo mengi sana ambaye haitufurahishi, na ukiangalia katika kaunti ya 47 ile kamati iliona iko hiyo makosa, iko Embu, iko Meru, iko Tharaka Nithi. Kwa hiyo ile kaunti wametembea, na si haja tembea, unaangalia shida ni moja, mambo ya wafanyikazi, mambo ya mambo mingi inaonekana katika hii document na haikutufurahisha. Kwa hiyo kuna mambo inafaa iangaliwe. Kitu ya kwanza, Bispika, watu katika mashinani wanataka hospitali itengenezwe. Watu katika mashinani kama Embu County kuko na wodi 20. Ningeomba Bispika, kama kuna uwezo serikali kuu na parliament iweze kuongezea pesa, ndio kila county pate pesa ya kutosha ambaye ya kusaidia mambo ya afya. Ndio kute hospitali imejengwa kule mashinani, na kila ward Bispika ukute kila ward iko na ambulance, kwa sababu ndio economy. Watu wengi wana pesa ya kukomboa ambulance, wengine wana pesa ya kununua dawa, na hii serikali ya William Ruto Bispika imesema mambo ya SHA iende mpaka mashinani. Yes, sasa imekuwa ikifanya kazi, lakini governors wanapata pesa ya kutosha. Bispika, tunjulishe treasury inapeana pesa wakati inafaa. Kwa hiyo kuna mambo mengi sana sisi tukiwa maseneta tunafaa tunjulishe. Yeye ikawa kila wakati yote tukisimama tunasema governor, wafanyikazi, lakini serikali kuu ambayo imesimamia pesa, ambaye treasury iko hapo, inapeana pesa wakati inafaa. Tunafaa tujiulize, wakati magavana wamepatia pesa, wanafanya kazi kulingana na vile inafaa. Mambo ya misahara wafanyikazi, madaktari, nurses, clinical officers, wanapata pesa wakati inafaa. Tujiulize, hii pesa, Speaker, kama wale wafanyikazi wametosha katika hospitali zetu. Mambo ya health, wale watu wanaangalia usafi, wanapata pesa wakati wa kutosha, wametosha katika hospitali zetu. Kwa hiyo mara mingi mpaka hata sisi maseneta mpaka tuangalie vile pesa inatoka treasury na inaenda county government, vile pesa ikifika kwa county government na inaenda kwa mwananchi. Kwa hivyo tunaweza kuwa hapa tunalaumu huyu na yule mwingine. Kwa hivyo Bwana Speaker, tunafaa tujifikirie mambo ya oversight. Sisi tukiwa masenators mara mingi tuko hapa tukitengeneza sheria, tukililia county ipatiwe pesa. Speaker, tunafaa tujiulize, pesa ikienda county government, mtu wa kwanza oversight, nani wa kwanza kuangalia ile oversight? Kwa sababu tunaweza kuwa tuwapeana pesa, tuwapatia governor apatiana kwa wafanyikazi, yende gawa governor akombise angalie wale wafanyikazi. Mpaka sisi tuwe na hutu ya ubinadamu. Wewe uko kule mashinani, ukiwa daktari, ukiwa clinical officer, GSPs, ufanye kazi kulingana na vile unafaa. Na pia Speaker, hata kama ni hivyo, huyo mtu anapatiwa pesa mwisho wa mwezi ama apatiwe. Kwa sababu Speaker, nataka nikumbushe Senate hii, GSPs ambaye ni yeko kwa rais wa Kenya kwa hii mwaka wa 2022 alisema wao kipatiwa 5,000, 2,500 iwe ikitoka kwa county government, 2,500 iwe ikitoka kwa national government. Sile pesa imekuwa na shinda. Watu wengi wanasema au watu waongezewe pesa. Kitu ya kwanza ni kujua hii pesa 5,000 inapatikana mwisho wa mwezi ndio au la, kwa sababu mara mingi kila hospitali, kila county imekuwa ikilia juu ya budget. Speaker, mambo mengi, mambo ya primary oversight, tunataka kutujulishe MCS katika counties sote 47 iko na MCS wale wamechaguliwa na watu. Kuna nominated MCS. Pia kuna kamati ya afya kule mashinani. Pia katika county zote governor ako na uwezo na CEC na civil officer na MCS kuchagua kamati ya health. Na pia kamati ya health ile ambaye ni MCS. Kuna kamati nyingine kila hospitali inachagua, inaangalia usafi ya hospitali, utendaji wa kazi. Sile kamati ya watu kule mashinani kuonekane kama wanapatanga alawanzi yao njia ile nafaa, ndio kila mara iwe ikienda kuangalia utendaji wa kazi. Oversight, primary oversight pia MCS ambaye walikuwa katika budget ya county, ambaye walikuwa wamekaa pamoja wakati wa public participation wa kuona kila hospitali na pesa ile governor amepeana upande wa afya, hiyo pesa kama imefanya kazi. Tujiulize tukiwa masenators, wale primary oversight MCS wanaangalia ama waangalie. Kwa hivyo kuna mambo mengi, hata tukiwa tunalaumu governor, tunalaumu senator, tunalaumu MCA, ningeomba kama kuna uwezo Speaker kuonekane kama kunaweza kutengenezwa kamati, kuundwa kamati ambaye ya haraka ya Senate iweze kukaa chini iangalie kwa nini hii shinda yote iko katika county 47. Speaker, kuna mambo mengi, mambo ya clinical officers. Ndio tumewapatia pesa governors, juzi tulikuwa ngangana wapate pesa. Tuone kama walianjiri watu ambaye wako na unjuzi wa kusaidia wale wagonjwa katika kaunti zetu. Speaker, kuna mambo ya level 4, level 3, level 5. Speaker, wakati serikali ya Kenya ilisema mambo ya saa ni kitu mzuri sana, kwa sababu tumeona sisi tukiwa masenators, wakati watu wamegonjeka, wakati mama mboga amegonjeka, wakati bodaboda amepata ajali. Speaker, nataka nikumbushe Senate hii, wakati wa zamani sisi tulikuwa masenators na MPs na leaders, hata ingawa harambee hainjarundi chini, Bispika, mara mingi kila wakati yote kwa kijinji kila kona zote ilikuwa ni mambo ya kusaidia ya harambee. Unakuta mtu wa bonda ameanguka chini, unakuta mguu akipelekwa hospitali, mguu inakaa mwezi mmoja, akisangiwa pesa unakuta ile mguu imeosa. Bispika, mimi naunga mkono mambo ya saa. Kwa sababu siku hizi kama kuna watu wanafaa waserekee ni mama mboga ambayo wako na ile pesa kidogo na watu wa bonda. Kwa sababu siku hizi ukiona mtu wa bonda akipata ajali, akianguka, apigwe na gari, hapo huyo mtu apate watu wa kumpeleka hospitali ama Good Samaritan, wakati amefika ile hospitali siku 3 kama injaisha, unakuta anakuwa registered kwa saa, na huyo mtu anawekwa mguu, anawekwa chuma kwa mguu, ama mahali ameteseka ama amegojeka anasaidiwa. Samani haikuwa hivyo. Kwa hiyo ningeomba katika nchi yetu ya Kenya, kaunti 47 watu wote saa hii wajiandikishe katika hii mambo ya SHA. Mambo ya harambee injaisha ikawa iko, lakini pia ningeomba kuweze kutengenezwa vile kuna wezekana mambo ya kanza imelete shinda Bispika katika nchi yetu ya Kenya. Siku hizi samani kulikuwa semekana kanza ni ya watu, ni wazee na akina mama na wale wazee, lakini siku hizi Bispika, ugonjwa ya kanza iko wa kila mmoja wetu, mtoto mdogo, mtoto mkubwa. Ningeomba serikali ya Kenya weze kutafuta vile itaweza, weze mambo ya kanza iwe ni mambo ya disasa na mambo mbaya, kuweze kuwa kila county iwe kijitegemea, na ukute ugonjwa ya kanza kila kona sote itakuwa ikitipiwa bila kutoa pesa zozote. Kwa hiyo Bispika, kuna mambo mengi sana tumeona. Bispika, wakati tunaendanga nchi ya ngambo, unakuta kule mambo ya afya hakuna kitu mtu analipa. Ukiwa mama mzee hakuna kitu unalipa. Ningeomba tuweze kuona vile magonjwa mengi ama mtu akizeeka watu wajiandikishe, ndio tuweze kupata pesa nyingi ambayo ya kusaidia. Ndio wakati akina mama wazee na wanaume wazee, wakati mtu akizeeka uwe hakuna shinda, mtu atakuwa akiangaliwa kama zile hospitali ambaye tuliona Bispika katika Ujerumani, katika UK, katika Amerika, katika China, kuna sota na mambo yingine. Bispika, ningeomba kuwe na watu ambaye wenye sayansi wataweza kuangalia mambo ya Kenya, kwa sababu dawa nyingi zinatoka nchi ya ngambo. Bispika, kuonekane kama kutakuwa kunaweza kutengenezwa ama watu watafanya research tuweze kupata dawa ambaye miti ile iko hapa ama vile ile vitu yatengeneza dawa. Bispika, ukute hizi ile dawa itakuwa na bei ya chini, kwa sababu watu wengi wanateseka njia ya dawa siko juu. Kwa hiyo Bispika, mimi kiwa senator wa Embu County, ningeomba kuna mambo mengi inafaa iangaliwe, na pia ndio nchi yetu ya Kenya uweze kuendelea na njia ile inafaa. Kwa hiyo Bispika, nikimalizia, ningeomba tukae pamoja. Hata Biblia inasema njoo tusemezane, kujeni tuongee, kwa sababu mambo ya ugonjwa, mambo ya afya imeleta shinda katika nchi yetu ya Kenya. Ingawa rais wa Kenya anajaribu vile kutakuwa mambo ya afya itaendelea na njia ile inafaa. Kwa hivyo Bispika, mimi nikiwa senator wa Embu County naunga hii kamati mkono, lakini wakae chini kuonekane kama kutatengenezwa kamati nyingine ambayo itaangalia shinda iko wapi, iko kwa governor, iko kwa treasury, iko kwa nani, ama ni oversight. Kwa hiyo Bispika, nikiwa senator wa Embu County naunga hii kamati mkono. Asante. Ni mimi senator wa Embu County, Alexander Munyi Mundigi, daktari.
Thank you Dr. Senator Alexander Munyi Mundigi kutoka Embu County. Senator Wakoli, Bungoma County.
Asante Mheshimiwa Spika kwa nafasi hii niweze vile vile kuchangia ripoti ambayo imewasilishwa bunge na kamati ya afya katika jumba la Senate. Mheshimiwa Spika, ni jambo la kuhuzunisha sana kwa sababu wenzangu wametaja kwa kina changamoto ambazo zinakumba kaunti yangu ya Bungoma. Mheshimiwa Spika, tunaenda kufunga ukurasa wa makadirio ya fedha za kiserikali mwaka 2025-2026. Tunapozungumza hivi Mheshimiwa Spika, wale madaktari mashinani CHPs Kwa miezi 8 sasa, Mheshimiwa Spika, hawajalipwa. Na swali ambalo tunajiuliza, Mheshimiwa Spika, ni kweli kwamba watu wenye akili timamu, watu wenye utu moyoni mwao, wanaweza bania fedha za madaktari mashinani shilingi 2,500 kwa mwezi kwa miezi 8? Na wao wanaendesha magari ya kifahari, wanakunywa mvinyo, chai sio ya mkanda, ni chai ya maziwa, Mheshimiwa Spika. Hata wamewacha kutumia majani chai, wanatumia kahawa, Mheshimiwa Spika. Na huku madaktari mashinani hawana viatu, hawana begi, yale mashati wanayovaa yamechoka, yamekungutwa na jua, Mheshimiwa Spika. Ni jambo la muhimu sana, Mheshimiwa Spika, kutoka sasa kwenda mbele. Ripoti zinapokuja, wanapojibu maswali, kwa mfano katika makadirio ya bajeti, lazima fedha zilitengwa. Tume ya kupambana na ufisadi isiwe tu tume kama gofu la kutazama na kuogopesha watu. Lazima EACC wajibike na iweze kutatua masuala haya. Mheshimiwa Spika, wametaja kuhusiana na maeneo ya kuweka walioaga kule Bungoma. Na jinsi tulitembea katika hospitali zingine, watu wamerundikwa kama kuni, Mheshimiwa Spika. Japo wamefariki, lakini si vyema wahangaike walipo hai, na wanapofariki wanawekwa kama kuni zilizokaushwa, Mheshimiwa Spika. Lazima waliotuacha waandaliwe mahali pazuri pa kupumzika wanapongoja siku ya kiyama, Mheshimiwa Spika. Na unagundua kwamba hata wanaporundikwa hivyo katika maeneo hayo, lazima watalipishwa. Sasa ni jambo la muhimu magavana wa magatuzi yetu wawe na utu. Angalau Mkenya anapopambana maishani, anapofariki, awekwe mahali pazuri akingoja Mungu wake. Jambo lingine, Mheshimiwa Spika, ni kwamba kuna walioajiriwa ama wafanyikazi gushi wengi sana katika sekta ya afya katika magatuzi yetu. Kule Bungoma kulikuwa na tashwishi, na hata juzi niko na takwimu na ushahidi kwamba kuna wale ambao walikuwa wameandikwa kwa awamu, kwa kibombo contract workers, ambao koti ilipitisha kwamba waandikwe. Lakini wale ambao wanasimamia uajiri wao wakajaribu kupenyeza majina wale ambao hawakuwa katika orodha, na mshahara wao ukarudishwa nyuma ili waweze kukamua ng'ombe ambaye tayari anapiga mateke. Mheshimiwa Spika, ni jambo la muhimu. Kamati ya afya, kamati ya hesabu za bunge, tuweze kuhakikisha kwamba wafanyikazi ambao wanalipwa ni wale ambao wameajiriwa kihalali, mastakabadhi zao zipo, na kuhakikisha kwamba fedha za mnyonge wa kawaida hazipoti. Nikitamatisha, Mheshimiwa Spika, kwa sababu nikiangalia klabu yangu muda umeyoyoma, ni kwamba ukiangalia miundombinu, hospitali na zahanati nyingi katika magatuzi yetu, Mheshimiwa Spika, bado haijakamilika. Na baadhi ya magavana wanaenda muhula wa mwisho, Mheshimiwa Spika, wanatumia miradi hii kupora na kupunja pesa za mnyonge. Lazima kamati ya afya na sisi maseneta wengine tuhakikishe kwamba gavana anapoanzisha miradi akamilishe kabla hajaondoka. Mheshimiwa Spika, naomba umakinike ili Wakenya waweze kunipa umakinifu wao. Nikimalizia, Mheshimiwa Spika, tunaenda katika makadirio mapya ya bajeti, lakini tunaenda pia mfumo mpya wa siasa na kampeni. Watu wasichukue awamu hii kwa kunyooshea vidole wale ambao tuko mrengo wa serikali. Hata wale ambao wananyosha vidole, Mheshimiwa Spika, wanatamani kuingia serikali. Sioni wakipiga debe wakisema sisi liwe liwalo tutabaki upinzani. Sasa kile tunasema, japo huko upinzani na mimi niko serikali, cha muhimu tufanye kazi. Lakini usitunyoshe kidole ilhali vidole vingine viko katika uso wako. Sasa wale walio katika upinzani, naomba muendelee hivyo na Mungu watamatishie haja yenu, mubaki upinzani. Sisi tuko katika serikali, tufanye kazi, tuboreshe maisha ya Wakenya na tusonge mbele. Asante, Mheshimiwa Spika.
Honorable Senators, we have now concluded the debate because I do not see any other senator interested to contribute to this motion. So I will defer this motion so that the mover can reply. So it will be listed when we next sit. and honorable senators. For the remaining orders, I will also reorganize the order paper and defer them because the movers are not there. Yours truly was having a motion number 11, but I'm the one on the seat, so I'm not able to move it. So they will all be deferred. Honorable senators, there being no other business on the order paper, the Senate stands adjourned until later today, Wednesday, 3rd June 2026 at 2:30 p.m.
Contribute to
the various reports that the Health Committee have submitted before this House. Mr. Speaker, I would like to start by commenting the committee for the well-done report. Particularly and of great importance is the fact that they did indeed had an experience
that is reflected in the reports from the various
hospitals, dispensaries of the various counties that these three reports have been reported from. And indeed, Mr. Speaker, part of what we have as a House and as various members of other respective committees, we have seen and appreciated the presence of various committees on physical ground or in specific places where we are undertaking our oversight role. Unlike where we are doing it in the chamber or here in Nairobi. Mr. Speaker, presence in our respective counties, presence in our respective hospitals where we are conducting that particular oversight, Mr. Speaker, gives us the exact situation,
and therefore, as at the time of coming up with the report and the recommendations, we are doing it with first-hand information. Reading through some of these reports, Mr. Speaker, reflects a scary situation. There is outright deterioration of health facilities, not only in the counties that we have been provided for by the committee on the basis of their visits to those counties, but it is a challenge that cuts across almost all the counties in the country. And, Mr. Speaker, it reflects on the situation of our health facilities, reflects on the kind of service delivery that the electorate naturally would expect from the county governments, and also reflects on the ultimate service delivery to the people of Kenya. Mr. Speaker, the recommendations that have been given are almost similar across all the counties which have been visited, and as I've said, reflects equally on the rest of the counties. One of the major issues that have been identified, and which is a glaring challenge on administration of the county government managed hospitals, Mr. Speaker, is the capacity of those hospitals. You find that one bed is shared, as we've been told, by more than 3 patients, whether these are mothers who are on their maternity or even patients who've got various ailments. It is impossible to say to get appropriate medical attention when you have got 2 or 3 people sharing one bed. That situation, Mr. Speaker, is common among most of the hospitals where the committee visited, and it is equally reflected in even our various other hospitals where the committee did not. I recall, Mr. Speaker, previously the same committee made a visit to Longisa
water in the hospital. You can imagine, Mr. Speaker, a hospital facility with no tap water. It is absolutely disheartening to see patients going out of the facility, getting water from water vendors outside, or even sending, in most cases, like in this case, Mr. Speaker, in Longisa Hospital, I am aware that border riders have now made good business out of water supply to the hospital. They only go, step out, get their 20-liter mitungis and line up along the road in order to supply water to patients who are in hospitals. This situation is serious, and when you look at the report, it can only be appropriately dealt with if our county governments have proper governance, because from the various Senate audit reports, part of the challenge is improper governance. Resources are abused. Resources are directed to non-essential services, and in most cases also, those resources are entirely abused by those who are governing those institutions. Besides the challenge on the bed capacity, where patients are sharing beds, there is also, Mr. Speaker, an availability of essential drugs. This has also been reflected in these reports and is cutting across almost all our institutions of health, which are mostly managed by our county governments. And Mr. Speaker, this one is one of those issues where, as some of the members have spoken to here, you find that the pharmacies within the hospital have got no essential drugs, but there is, just outside that particular institution, a lineup of private-owned pharmacies where those essential drugs are available. And what happens within the hospital is that patients are given prescriptions and are asked to go and buy for themselves, such that even if a patient was unable to have the financial capacity to purchase and therefore relying on the social health care facility, that's the SHIF, they will be forced to find a way of making sure that they get the drugs from those private pharmacists. And it is one way of Mr. Speaker, making sure that the drugs which are normally availed in hospitals, we are told in some places we don't have drugs in the hospital, but are normally stolen or are sold out to private practitioners who now make money out of it. And that is a problem on governance. It has been identified in these reports that one of the challenges that most of these institutions from the various hospitals that were visited by the committee is that there is improper governance where no one takes responsibility. The hospital superintendent is not available or is not qualified. Doctors, nurses, clinical officers are not paid in time, and therefore their availability to even be present as and when they are required is in most cases discouraged, because their services are not paid for in good time, and their working condition, definitely, Mr. Speaker, is compromised. And therefore, if we as a committee, as a house, were to enhance direct and presence in almost all our institutions in the course of our oversight, there is a high likelihood that there will be an improved performance, because being present is not the same as where we are doing oversight at the level where we are in Nairobi, or when we do not have presence in those particular institutions. Another issue that has been identified in these reports, Mr. Speaker, which is also common across, is those health service promoters who, although they are not necessarily under the full obligation of the county governments, they are very essential, and they are the first line of presence in our various areas of representation, because they are the ones who will directly be reaching out to patients. They know almost every other family that has got a patient, and they will be the people who will support in terms of giving directions on what kind of medical attention such people require, And it is, Mr. Speaker, very unfortunate that they are not being paid their stipend. And if they are paid, sometimes they are paid when it's delayed. And therefore, it compromises entirely the service delivery from their part and spills over now to the institutions, the health institutions where they are supposed to report to or where they're supposed to take the patients in. And sometimes also where they know, after all, even if they were to push themselves to support, there will be no attention relevant to the patient in their health institutions because poor governance is present, or no drugs, or at some places, Mr. Speaker, they are literally not even operational. And therefore, the decision that this committee did, together with the rest of the committees, including Education Committee and all other committees, by making their presence felt in the various counties, the role that they're supposed to do will entirely support the people who we are supposed to help as the oversight role. And so, Mr. Speaker, as we appreciate the work of this committee, we'd like to encourage them also to make sure that they enhance their visits and make sure that the recommendations that have been made by the committee on the various institutions are followed through so that some which are possibly able to be implemented should be implemented. Those which are not, of course, will form a basis of future follow-ups by the relevant committees. And Mr. Speaker, I stand to support this report. Thank you.
Senator Siango.
Thank you, Mr. Speaker, for giving me this opportunity to also to add my voice on the report by the Committee on Health. Mr. Speaker, sir, the report touches on Kitui and other counties, and I noted with concern specifically on the matters of the care for mothers and children. Mr. Speaker, when patients are sharing same bed, about 6 patients, and some with newborn babies, it is so unfortunate because babies are sensitive, newborn babies are very sensitive. They can contract infections very easily, and when they are forced to share a bed with their mothers and other strangers, they may contract diseases, and that will lead to death. This is very sensitive. I really appreciate the Committee on Health because of these visits that exposed some of these evils that are happening in our counties and in the hospitals. Mr. Speaker, specifically speaking to Kitui Hospital, my attention was caught by what the superintendent, the medical superintendent has done. He has appointed...
It is one of the clearest demonstrations of constitutional leadership. On public debt, your administration cannot continue blaming borrowing while continuing to borrow. It cannot continue increasing taxes while claiming to protect hustlers. Leadership requires responsibility, not selective memory. On youth protests and public criticism, claims that young Kenyans are merely being incited underestimate an entire generation. Young people do not need politicians to tell them whether they are unemployed. They do not need opposition leaders to tell them whether food prices are high. They experience these realities every day.
Finally, we have the Deputy Minority Leader of the Senate, Senator for Kitui, Senator Enokio Wambua.
Article 33 of the Constitution of Kenya 2010 protects freedom of expression. Article 37 protects the right to assemble, demonstrate, picket, and present petitions. Article 38 guarantees every citizen the right to make political choices, participate in political activities, and engage freely in the democratic process. Article 238 requires national security to be pursued in compliance with the law and with utmost respect for human rights and fundamental freedoms. These constitutional guarantees cannot coexist with intimidation, unlawful force, abductions, suppression of dissent, or the criminalization of legitimate political participation. A government confident in its record responds to criticism with answers. A government that responds primarily with insults, threats, arrests, or intimidation signals insecurity, not strength. Mr. President, Kenya needs a unifying leader at this moment in its history. It does not need new political enemies. It does not need fresh divisions. It does not need a return to the habits that have previously endangered national cohesion. The presidency must remain above factional warfare. It must speak for all Kenyans, including critics, opponents, dissenters, and those who did not vote for the government. That is the essence of constitutional leadership. The president is not elected to lead one side of the nation against another. A president is elected to lead the nation itself. The Constitution does not permit government by propaganda. It demands accountability. Chapter 6 does not permit arrogance in public office. It demands integrity. Article 129 reminds all who hold executive authority that such authority is derived from the people of Kenya and must be exercised for their benefit. Power belongs to the people. You are merely its temporary trustee. The Constitution demands government by law, not government by political convenience. It demands obedience to court orders, respect for constitutional freedoms, accountability in public office, and fidelity to democratic principles. No administration can credibly claim commitment to constitutional governance while simultaneously tolerating impunity, undermining judicial authority, permitting abductions, allowing public institutions to be drawn into partisan political warfare, or creating circumstances in which citizens struggle to distinguish between lawful policing and organized political intimidation. Kenya's democratic future depends upon strong institutions, respect for the Constitution, and unwavering commitment to the rule of law. These principles are not optional. They are constitutional obligations binding upon every holder of public office, including the president. Therefore, we tell you plainly, Mr. President, stop hiding behind UDA officials. Stop outsourcing insults. Stop blaming retired leaders. Stop campaigning against the past. Start governing the present. Kenyans, Mr. President, did not elect you to write letters to Uhuru Kenyatta. They elected you to lower the cost of living, create jobs, support farmers, improve healthcare, strengthen education, protect constitutional freedoms, and restore hope. If your administration has performed, let the lives of Kenyans testify. If the economy has recovered, let households feel it. If jobs have been created, let young people find those jobs. If healthcare has improved, let patients experience it. If agriculture has been revived, let our farmers confirm it. If housing has succeeded, let completed and occupied homes speak. But do not ask suffering citizens to ignore their pain because UDA has written yet another political letter. Let us stop the pretense. Let us stop pretending William Samoei Ruto was not deputy president for 10 years.
Let us stop pretending today's challenges were created entirely by retired leaders. Let us stop pretending propaganda can reduce the price of unga. Let us stop pretending slogans can lower electricity bills. Let us stop pretending blame games are leadership. The people of Kenya are awake, Mr. President. They can see, they can remember, they can compare. Today, William Samoei Ruto
is president. UDA is the ruling party. Kenya Kwanza is the government. The responsibility is yours. No excuses, no scapegoats, no endless campaigns. Govern, Mr. President. I thank you.
That will be the end of our statement. Over and above this statement, you get signed copies of the members who endorsed this particular statement. It has been signed by at least 50 members of parliament. We have agreed amongst ourselves that this statement is very exclusive and it communicates the spirit of the message that we wanted to send across. So asanteni sana, thank you very much and have a good day. Thank you.
Borrow. It cannot continue increasing taxes while claiming to protect hustlers. Leadership requires responsibility, not selective memory. On youth protests and public criticism, claims that young Kenyans are merely being incited underestimate an entire generation. Young people do not need politicians to tell them whether they are unemployed. They do not need opposition leaders to tell them whether food prices are high. They experience these realities every day.
Finally, we have the Deputy Minority Leader of the Senate, Senator for Kitui, Senator Enoch Wambua.
Article 33 of the Constitution of Kenya 2010 protects freedom of expression. Article 37 protects the right to assemble, demonstrate, picket, and present petitions. Article 38 guarantees every citizen the right to make political choices, participate in political activities, and engage freely in the democratic process. Article 238 requires national security to be pursued in compliance with the law and with utmost respect for human rights and fundamental freedoms. These constitutional guarantees cannot coexist with intimidation, unlawful force, abductions, suppression of dissent, or the criminalization of legitimate political participation. A government confident in its record responds to criticism with answers. A government that responds primarily with insults, threats, arrests, or intimidation signals insecurity, not strength. Mr. President, Kenya needs a unifying leader at this moment in its history. It does not need new political enemies. It does not need fresh divisions. It does not need a return to the habits that are previously endangered national cohesion. The presidency must remain above factional warfare. It must speak for all Kenyans, including critics, opponents, dissenters, and those who did not vote for the government. That is the essence of constitutional leadership. The president is not elected to lead one side of the nation against another. A president is elected to lead the nation itself. The Constitution does not permit government by propaganda. It demands accountability. Chapter 6 does not permit arrogance in public office. It demands integrity. Article 129 reminds all who hold executive authority that such authority is derived from the people of Kenya and must be exercised for their benefit. Power belongs to the people. You are merely its temporary trustee. The Constitution demands government by law, not government by political convenience. It demands obedience to court orders, respect for constitutional freedoms, accountability in public office, and fidelity to democratic principles. No administration can credibly claim commitment to constitutional governance while simultaneously tolerating impunity, undermining judicial authority, permitting abductions, allowing public institutions to be drawn into partisan political warfare, or creating circumstances in which citizens struggle to distinguish between lawful policing and organized political intimidation. Kenya's democratic future depends upon strong institutions, respect for the Constitution, and unwavering commitment to the rule of law. These principles are not optional. They are constitutional obligations binding upon every holder of public office, including the president. Therefore, we tell you plainly, Mr. President, stop hiding behind UDA officials. Stop outsourcing insults. Stop blaming retired leaders. Stop campaigning against the past. Start governing the present. Kenyans, Mr. President, did not elect you to write letters to Uhuru Kenyatta. They elected you to lower the cost of living, create jobs, support farmers, improve health care, strengthen education, protect constitutional freedoms, and restore hope. If your administration has performed, let the lives of Kenyans testify. If the economy has recovered, let households feel it. If jobs have been created, let young people find those jobs. If healthcare has improved, let patients experience it. If agriculture has been revived, let our farmers confirm it. If housing has succeeded, let completed and occupied homes speak. But do not ask suffering citizens to ignore their pain because UDA has written yet another political letter. Let us stop the pretense. Let us stop pretending William Samoei Ruto was not deputy president for 10 years.
Let us stop pretending today's challenges were created entirely by retired leaders. Let us stop pretending propaganda can reduce the price of unga. Let us stop pretending slogans can lower electricity bills. Let us stop pretending blame games are leadership. The people of Kenya are awake, Mr. President. They can see, they can remember, they can compare. Today, William Samoei Ruto
is president. UDA is the ruling party. Kenya Kwanza is the government. The responsibility is yours.
Is strong. The current stocks of specialized test kits, reagents, personnel protective equipment, which are estimated to support only approximately the first 200 suspects, are in place now. And this is why additional emergency financing and partner support are required to build a more adequate testing capacity. In infection prevention and control, the World Health Organization has provided 1,000 Ebola PPE kits, which are available in the country and being prepositioned to support preparedness activity. Initial preposition is focused on strategic sites, including Kenyatta National Hospital, Kenyatta University Teaching, Referral and Research Hospital, Mombasa, MTRH in Eldoret, Turkana, and other high-risk points of entry. Honorable Speaker, the fourth item was on regional cooperation coordination with our neighbors, foreign governments, and international health agencies. Honorable Speaker, the House requested a report on that. Kenya is working closely with all the affected and neighboring countries, regional institutions, international partners, because Ebola is not a national problem. It's a regional, it's a global security, it's a global public health security threat. The ministry is engaging in cross-border coordination with our sister country, Uganda, with a particular focus on sharing surveillance, information, traveler screening, case notification, contact tracing, laboratory referral, and rapid response readiness. Kenya is coordinating, and we have held meetings at the highest level with the World Health Organization, with the Africa CDC, with the IGAD, with the EACC, with the International Organization for Migration, with the U.S. Center for Disease Control, all these at ministerial level, and with other development partners. This cooperation is focused on surveillance, on laboratory support, on simulation exercise, on technical guidance, training, risk communication, logistics, and partner resource mobilization. And I wish to emphasize, Honorable Speaker, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya, international partners provide technical assistance, commodities, financing, training, and logistical support. Regarding the recent media reports alleging that Kenya has entered into an agreement with the United States of government to establish a quarantine facility for U.S. citizens or foreign nationals, I wish to state it clearly that Kenya and the U.S. government signed an agreement on cooperation in threat reduction, biological and infectious diseases engagement program on the 24th July 2015 during the state visit of our President and President Barack Obama. President Uhuru and President Barack Obama. The agreements were therefore approved by the cabinet then in April of 2016 and subsequently introduced in this House in Parliament, laid on the table of the House on the 19th of July 2016. Upon undergoing parliamentary procedures and public participation and the House process, the House approved the ratification of the agreement on the 9th of February 2017. This agreement subsequently entered into force on 6th of April 2017 and has a validity of 5 years. And Honorable Speaker, the renewing of this cooperation was again signed and came into force on the 5th of April 2022, which the annex I have provided. The extended agreement has a validity period of 7 years and is valid to the 5th of April 2029. Further, on the 4th of December 2025, we again signed a cooperation agreement with the United States of government to strengthen Kenyan healthcare system on our different areas, including digital health, including HIV/AIDS, TB, and malaria. Over the last 23 years, Honorable Speaker, the government and the people of the United States, through the U.S. government health program, has provided close to $8 billion, equivalent to slightly over 1 trillion Kenya shillings in support of the Kenyan health sector. This investment has significantly strengthened our national response to HIV, TB, malaria, maternal newborn, and global health security. The government of Kenya deeply appreciates this long-standing partnership and remains committed to ensuring that the gains made are sustained through the increased domestic investment, strengthened institutions, and successful implementation of the Kenya-US Health Cooperation Framework, which provides a pathway towards greater country ownership and sustainability of our health program. Honorable Speaker, the proposed Ebola treatment and isolation unit at Laikipia Air Base is part of the 23 similar units to be established in the country as part of our preparedness and response. This facility will jointly be run by the government of Kenya and the U.S. government under the command of the Air Force Commander, the base commander, and the entire medical team of the Kenya Defense Forces, working together with the Ministry of Health. This proposed facility reaffirms Kenya's position as a medical hub in the East Africa region with the capacity to offer specialized care for complex infectious diseases like Ebola. I must also inform the House that aspects of the matter relating to the alleged international health agreements and containment arrangements are now before court. Accordingly, and in keeping with the doctrine of sub judice and standing orders of this House, I will avoid discussing the merits of any active litigation. But I will, however, continue to provide this House with the government's public health position and preparedness status. Honorable Speaker, you also asked about the establishment and accessibility of the Ebola disease control and isolation centers. Honorable Speaker, the House asked whether Ebola disease control and isolation centers have been established in the country. And I want to say this. I hasten to add that there is a significant presence of Kenyans in the affected regions of both DRC and Uganda. Many Kenyans work in Uganda and do business both in Uganda and DRC. And two of our leading banks, KCB and Equity, employ Kenyans who live in that region. In addition, Kenya has approximately 450 specialized KDF officers and servicemen who are in DRC under the MONUSCO peacekeeping mission. Any of these Kenyans could be exposed and could require a quarantine and isolation facility back home in Kenya. The government has established undesignated isolation and treatment capacity as part of our national preparedness. These include, I said, our national referral facilities, our county designated sites, temporary holding areas for points of entry, county isolation facilities. These facilities are being progressively verified for quality, for safety, and for readiness. And I want to reiterate that all such facilities are established for the protection of the people of Kenya and all persons within the Kenyan borders. They are not only foreign facilities, they are not for foreign facilities, they are not exclusive facilities, they are not facilities reserved for any nationality, they are public health assets established and coordinated under the authority of the government of Kenya. In the event of a suspected case, the response will be guided by medical triage, exposure risk, clinical need, and public health protocols. A Kenyan citizen, a foreign national, a refugee, a diplomat, an expatriate, or a traveler will be managed according to the same public health principles: safe isolation, testing, clinical care, contact tracing, prevention of further transmission. Our objective as government is to protect communities, to protect healthcare workers and the country. When a case is detected, the safest place to manage it is within a properly equipped isolation and treatment facility under the controlled conditions. Finally, Honorable Speaker, you have told me to give guidance on the public health guidance. Honorable Speaker, any person who develops fever, headache, vomiting, diarrhea after recent travel to the affected areas or one of their community members after contact with a suspected case should seek medical attention immediately and report through the 719 public health hotline. Honorable Speaker, our readiness assessment gaps and resource requirement are all provided in this document, and I think I have provided the agreements, the documents, but just to conclude so that I take questions from members, Honorable Speaker and members, it's very important, you play a very important role in the public health protection of our country. Misinformation during disease outbreaks can cause panic, can cause stigma, can delay health seeking and resistance to public health measures. I therefore request members of this House to support the Ministry of Health by amplifying accurate information, encouraging early health seeking behavior, supporting screening at border points of entry, and urging the public to use the official 719 hotline. Honorable Speaker, I want to repeat for emphasis, Kenya has no confirmed case of Ebola virus disease. Our surveillance systems are active. Our laboratories are functional. Our points of entry are screening travelers. Our rapid response teams are on standby. Our health workers are being trained. Our isolation facilities are being verified and strengthened. And the government of Kenya remains fully in control of the preparedness and the response architecture. Our approach is guided by science, the law, the national interest, the public health protection, and the international obligation that as a country we have. We will continue to act transparently. We will continue to act decisively. We will continue to respond responsibly in order to protect Kenyans and all persons within our borders. I thank you, Honorable Speaker, and I'm ready to respond to any questions from the honorable members.
Thank you, Honorable Duale. Sarah Korere.
Thank you, Speaker. Speaker, we've had a very elaborative explanation from the Cabinet Secretary. And Speaker, coming from Laikipia, we have a lot of reservations and especially concerns from the people we lead because we are representatives of the people. Speaker, it is clear that this Ebola is rare and fatal disease. And common sense will dictate that if this disease starts in a particular place, it will be natural that you just contain it where it has started. I want to ask the Cabinet Secretary. He has said that the government of Kenya and the government of the US signed an agreement way back in 2015. And in 2019, there was Corona, which was a global problem. We didn't see the US come out, the way they have come out now, to construct a Corona isolation center or a center to help the Corona people who are infected by Corona in Laikipia or anywhere in this country. And if they have, probably the Cabinet Secretary can tell us. About this Ebola thing, I want to ask the Cabinet Secretary. You know, it's very unfortunate that we saw a US Secretary of State in Washington declaring that they will not allow even one single case of a corona-infected US citizen, I mean Ebola, set foot in America. So if they're infected in Congo, they will not take them to treat them in America, they will not treat them in Congo, they will bring them to Laikipia. And you know, members, allow me to say this. You know, the people of Laikipia, we have never healed from the aftermath of colonization. We still feel that even today we are still being colonized because half of our land went to the British colonizers and it later on went to their citizens, and we have never regained a single inch of the ranches they took from us. And now they want to bring Corona. And you know, I mean Ebola. And you know, I'm just saying because I represent people who are concerned that if Americans are to be flown to Laikipia Air Base to be treated there, what happens if this disease, God forbid, you know, leaks out and probably people around Nanyuki are infected by Ebola? Will the American government take charge and treat the Kenyan citizens the way they would like to treat the American citizens? That is one.
You've made your point. There are many interests,
let me
Sarah.
finish.
I can't allow you to continue making a speech.
I'm finishing, finally. The concern also is we have a lot of tourism in Laikipia, and as I speak now, there is a lot of cancellations by the people who are traveling to the lodges of Laikipia. Can the cabinet secretary tell us how are they going to communicate to the citizens? Because probably most of this mayhem is because of miscommunication. Whose message is it that the citizens are getting miscommunicated by people who are not in authority to give that information to them? Why should the people who are in authority didn't give the correct information to the citizens of Kenya and the citizens of Laikipia?
Thank you, Sarah. Mary Masse. Avoid the temptation to make speeches. Ask questions.
Thank you,
Yes.
Honorable Speaker. Honorable Speaker, and I thank you for giving me this opportunity because I'm from the border to Uganda, and my people are more at risk. My question is, I have listened to the PS, to the CS, I'm very sorry, to the CS. I have a concern. The ministry officials were in Busia County, Teso South at Alupe Hospital with a proposal to convert Alupe Hospital into an isolation center for managing Ebola. Honorable Speaker, I do not have any other hospital to serve the people of Teso South. None. It is only Alupe Hospital. So I want to tell the CS that we will resist that Alupe Hospital cannot be made an isolation center for Ebola. Whereas I support the government initiative for preparedness to protect the people of Busia because we are at the border, let another venue be identified to build that isolation center, but Alupe will not be converted, Honorable Speaker.
Robert Mbui. Minister, I hope you are recording the members and the questions.
I have to.
Mbui.
Thank you, Mr. Speaker. Mr. Speaker, listening to the CS, he was very clear when he said that Kenya has no cases of Ebola. And Mr. Speaker, the ministry should endeavor to ensure that Kenyan citizens are safe, because that is the purpose of this ministry. Now, we know that Ebola is highly contagious. There is this agreement that he says there is, because of sub judice, he cannot maybe table it before us. But Mr. Speaker, I want to ask him to just clarify. In that agreement, which is between Kenya and the US.
He didn't say that. He didn't say he cannot table. In fact, the
because
agreement
he has not
is...
tabled, Mr. Speaker.
The agreement is here.
Oh, we have it, okay.
Yes.
Or the court case, the matters
He said
that
he
are
will not delve
contained in the
into
court
matters
case.
sub judice.
So, Mr. Speaker, I wanted to just find out, where in that agreement does it say that we can expose Kenyan citizens at the expense so that we can be able to save citizens of the US? It's very important that he points out that, because in my opinion, I think that cannot have been something that this House would have passed. And Mr. Speaker, finally, I also want him to clarify, is it true that this center that is supposed to be built in Mount Kenya region is supposed to be only meant to be used by US citizens and not Kenyans? He needs to clarify that for us. Thank you, Mr. Speaker.
Yes, Ndindi Nyoro.
Thank you very much, Honorable Speaker, for this chance. And direct to the point, I have listened to the CS, and there is actually no space in his speech about the view of Kenyans. I'm yet to meet one single Kenyan who is in support of having this quarantine in Kenya, Honorable Speaker. And it is important for the government to know that the government exists for the welfare of Kenyans. And Kenyans know when their space is being cropped, Honorable Speaker. Honorable Speaker, the US budget in terms of health is 860 times ours. Their technology is better in all respects, including biotech, Honorable Speaker. They have better capacity to handle these kind of issues than Kenya. Honorable Speaker, while the CS is here, I would request him, Kenyans have spoken in one voice. We do not want that facility of Ebola here in Kenya. Please listen to the Kenyan voices. And Honorable Speaker, as the CS is here, the CS should actually bite himself and the obligations to what the Kenyans are looking forward to. Lastly, Honorable Speaker, in terms of the fragility of our health sector, and also listening to some officials from the US proclaiming clearly that they do not want any case of Ebola in their country, how reckless would the government be in doing exactly the same that which the country that is the US do not want in their soil? As Kenyans, we refuse. The government must listen to Kenyans and desist from having this quarantine in Kenya.
Yes, Mama Zamzam.
Asante Mheshimiwa Spika, na mimi pia niweze kumwelezea waziri. Ndio, Ebola na kujitayarisha ni kitu kizuri sana, kwa sababu hawa ni majirani zetu, wengine wanatuuzia kahawa umumu, wengine wanafanya nini, lakini iwe ni kama kukinga wa Kenya peke yake, waziri. Lakini waziri, ikiwa, na mimi nataka niwaambie hata wale wabunge walikuwa hapa, kwa sababu inasemekana hiyo ilipita hapa bunge hapa, na Ndindi Nyoro ulikuwa hapa kwa hii bunge. Kwa hiyo ni vitu ambavyo mngeweza kukataa wakati ule, ili isiweze kupita, mumpatie rais wakati mgumu. Waziri, mimi napenda kusema tu, kama Mwamerika amekataa kule kwake, hapa Kenya tukubali, na nasikia katika counties 20 ambao walikuwa wamekubali, Mombasa ilikuwa moja wao. Kama mama Mombasa, sitaki kuona mzungu kule anatibiwa Ebola. Iwe kama itajengwa ni ya kuangalia watu wetu peke yake, waziri. Sisi ni kitu kizuri na tuna support kama tuwe na preparedness. Manake sisi ni majirani, huwezi jua, na wanasema ina spray na unyevunyevu, either through sex ama maji ama mate, hizo vitu tumesikia. Lakini sasa huwezi jua kitu yote za kutokea, Mheshimiwa Spika, kitu chochote chaweza kutokea. Na ikitokea iwe ni sisi wa Kenya peke yetu, isiwe kuwa ni mtu mwingine anakuja kutibiwa hapa, waende kwao ama warudi Kongo, kule walipata ugonjwa watibiwe Kongo. Asante sana Spika.
Yes, Ichungwa.
Honorable Speaker, first I don't know whether Honorable Zamzam, but the Deputy Speaker tells me Honorable Zamzam is actually right, because the Minister did speak about...
But that's what the Minister said.
Bodily fluids.
She simply said what the Minister said.
So, bodily fluids could be transmitted in many ways.
The Minister didn't speak in such good Swahili. Or at all.
So, thank you, Honorable Speaker. Honorable Speaker, let me first begin by thanking the Minister for this statement, because as Honorable Sarah Korere has said, is indeed very elaborate. And also to note, Honorable Speaker, that at the time this agreement was tabled in this House, I highly suspect the Honorable Aden Duale, as leader of majority, is the one who tabled this report in 2015. And the subsequent one tabled in 2022 was tabled by the Honorable Kimunya, my predecessor, as leader of majority. And it is true that the agreement between the Republic of Kenya and the United States was tabled, debated, and ratified by this House. Therefore, even as we speak, I know there is a temptation, Honorable Speaker, to speak to the gallery. And I wanted to begin by asking the CS to clarify just one thing that he has already said in his statement, but which many of us probably did not hear, or we have blocked our ears from hearing it. And because I have the privilege of having a copy of this statement here, Honorable Speaker, the CS did state that the proposed Ebola treatment and isolation unit at the Laikipia Air Base is part of the 23 similar units to be established in the country as part of our preparedness and response. So I would want first, CS, clarify to us and to the country that we are not establishing one isolation center at Laikipia Laikipia Air Base. The one at Laikipia Air Base is one amongst 23 others. Two honorable CS, including some of the ones, the minister did name a few, including one in Busia, was it Alupe or somewhere?
Order. Gone.
Two, Honorable Speaker, I want the minister to clarify to us and to the country something again that he has said in this statement, that this isolation center is not being established for foreigners exclusively. The minister has said that we have 2 Kenyan banks with Kenyans, our sons and daughters working in the DRC, some in Uganda. We have 450 of our armed men, our armed officers, who have given their lives to protect our lives in this country and the region, our region of peace. Should any of those 450 of our officers, our sons and daughters in DRC, God forbid, catch the Ebola virus, where shall we take them? Do we take them to America? Do we leave them to die in the Congo forest? Or do we establish isolation centers as any responsible government and administration would do to make sure that should you, Honorable Speaker, this weekend, I traveled to Rwanda. Honorable Speaker, I traveled to Rwanda as a Kenyan.
Yes, Millie, what is
Any
your point
other
of order?
Kenyan would have traveled to Congo.
Yes, Millie.
Sorry, Mr. Speaker, I had to interrupt the majority leader, especially now that I'm in leadership of the broad-based. But I'm just wondering, is the honorable member in order to imply that the United States of America is irresponsible by not setting up their own facilities in America? Because Kenya is responsible setting up one in Kenya. Are you in order implying that America is responsible by not setting up in their own country when they are a superpower and we are a minion power? Are you, even Honorable Buru is still looking for power and you are bringing, are you suggesting that America is irresponsible by any chance?
Honorable Millie, are you saying that America is incapable of being irresponsible?
Mr. Speaker, I am actually asking for clarification. I am not saying,
Yes.
Mr. Speaker, I plead the 5th Amendment. I just want to know from the...
Okay.
Honorable Speaker, in direct response to my sister, Honorable Millie, I am very well versed with our standing orders. I would never allude to the irresponsibility of a friendly nation on the floor of this House. I will not do that. But my point was, Honorable Speaker, back to my point, that as a responsible country, should we or should we not have isolation centers? Because this disease, we can't run away from the fact that it is there, and it is there in our neighborhood, in this region. Therefore, the question that I wanted the CS to clarify,
Yes.
and I'm saying this, Honorable Speaker, deliberately in a leading manner, so that the CS clarifies for us and for the nation, this isolation center, from what I read in his statement, you know, Honorable Speaker, the problem is that members don't listen, like the member for Aldai is making noise and distracting me. And that is why maybe we may have missed some of the issues the CS has said. Because my understanding, and that is the clarification I sought, was that this isolation center is for preparedness, even to cater for Kenyans who may catch the disease, whether it is a staff of KCB, Equity Bank, or one of our armed officers who are working in DRC. Should they catch the disease, for instance, the military, the natural thing would be if it was the commander-in-chief or the CDF, airlift anyone in an isolated manner, to the airbase, to the isolation center there, to be treated there. But a truck driver, Honorable Speaker, who
Senator.
catches the disease in DRC, in Goma, and probably is detected at the Busia border. Is there a facility at the Busia border? Because I have read about the laboratory testing there. Maybe among us, the 23, the CS should also clarify where are these other 23 centers to be established? Do we have them around the border with Uganda and where the trucks are passing, both legal and the illegal crossings? Because I see in his statement he's spoken about the legal crossings. But there are also illegal border points. What are we doing? Lastly, CS, on your preparedness, you have spoken about the 100 contact tracing. We're at about 100%, 87% on laboratory readiness, rapid response teams at 90%, infection prevention and control at 56%. But you have also told us that we have kits for the first 200 suspected cases. And that is where preparedness comes in, Honorable Speaker, and I hope the CS can tell us, have you then prepared? Because I've also seen your request. You are saying the first 100 cases will cost about 2.686 billion. Is this money already provided for in the budget? Or should we, as we go to the budget process, now factor additional resources for this preparedness for Ebola? Because the first 200, if we learned anything from COVID, to get from 0 to 1,000 cases would take less than 3-4 weeks. Therefore, Honorable Speaker, I would just seek those clarifications. And Honorable Speaker, let me just close by saying this. Ebola is a dangerous disease from what we have seen. But as a country, we must be prepared. And those isolation centers ought to be there, but they cannot be exclusively for others to use without Kenyans. And I think that's the very critical clarification. Because, Honorable Speaker, you know, in closing, this country, as Michael Joseph once told us, we have peculiar habits. Now, as politicians, many of us are very good experts in Ebola. And many Kenyans, almost all Kenyans are experts in Ebola. Let us hear from the experts, including the doctors here.
Waziri, let him respond to those. But before that, Minister, allow me to acknowledge your children, students in the galleries. In the Speaker's Gallery, we have Githunguri Girls School from Kandara, Muranga. We have St. Musingu High School from Ikolomani, Kakamega. Students, when your school is mentioned, you stand up to be acknowledged. In the public gallery, we have Kapsimbeyo School from Kuresoi South, Nakuru. USIU Africa, I believe there are students from Roysambu, Nairobi. Masjid Al-Amen Academy from Starehe, Nairobi. Gijiwe Methodist Fellowship from South Imenti, Meru. And Githurai Mixed School, Ruiru, Kiambu. On my behalf and on behalf of the House, we welcome the students, their teachers, and those accompanying them to Parliament. Minister, you can proceed to respond. Thereafter, we'll take another round, which will be the last one.
Thank you, Mr. Speaker. Mr. Speaker, I am ready to answer the valid questions by our honorable members, my colleagues. But Honorable Speaker, we are dealing with a very abnormal situation. And I want the House to look at the Public Health Act, Section 35 and Section 36. That mandates the Ministry of Health to take all the necessary action to protect and safeguard the safety of our citizens, our visitors, and all those who live within the borders of our country from any of the infectious diseases. To my sister, Honorable Sarah Koreri, but before even Honorable Speaker answer that question, first I think for information, we have 12 counties which are very high risk. These counties are Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Trans Nzoia, West Pokot, Turkana, Homa Bay, and Migori. And this is because of the air, the road, transport, and the northern corridor. Then we have got high risk. The first one was very high risk. The high risk counties are 13. These are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Makueni, Kilifi, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa. Honorable Speaker, again, for the information of the House, as of today, we have designated, verified 3 major hospitals as treatment centers. Kenyatta National Hospital, the Kenya National Police Hospital, MTRH in Eldoret. Secondly, we have also identified that we are in the process of completing the isolation, the treatment center of 2 hospitals in Busia. And I want to urge my sister, Mary Emase, even before COVID, the people of Busia and the country as a large, under the Ministry of Health, agreed that Alupe Hospital, a research center, is one of the very few infectious research hospitals. So in terms of qualification, that hospital is the most qualified because it's a research and infectious. Where have we done that? So in Busia, we have Alupe Sub-County Hospital, Referral Hospital, and we have Kocholie Sub-County Hospital. The reason why we picked on those 2, you know, that is where the biggest
for
crossing.
the record, it's called Kocholia, not
Kocholia. Kocholia. That is where the epicenter in terms of crossing from either DRC, our tracks, and the movement are. But we are doing assessment of these sites in the following counties. And Honorable Speaker, under the Public Health Act, we don't need to do public participation. We are not going to consult citizens. Even members of parliament here, when they fall sick, they rush to their doctor to make sure they get the best treatment. So this epidemic does not require any consultation. Tomorrow, God forbid, if Ebola is found in this country, this House will call me back here to this chair to ask me why are Kenyans dying. So before Kenyans die, before Kenyans are infected, we as a government have a moral, constitutional responsibility to protect both Kenyans and other people who are non-Kenyans who live within our border or who transit within our country. Honorable Speaker, on Laikipia Air Base is one of the 23 quarantine isolation center we are building. And we will not stop it. Why we are building? We are building in the air base, far from even, and there are a number of reasons why. The runway in Laikipia is one of the longest runway. That is where we have KDF medical team. That is why even our 450 Kenyans who are serving today under the UN, our special forces, the quick response unit. I'm the speaker, I was the Minister for Defense. I went to Ituri. I know all those areas. Those who have gone to Lumumbashi. Kenyans, the biggest hospitals in DRC are run by Kenyans, are owned by Kenyans. So we must protect, Mr. Speaker. So Laikipia will protect both Kenyans and the US. Honorable Speaker, when we had the COVID, and some of us were members of parliament here, the UN, the US, and many other international bodies built a hospital in Nairobi Hospital, a UN specialized hospital to deal with COVID. There was no noise that time. We have a responsibility to protect
Kiamba, let him respond.
Honorable Speaker, on what the Secretary of State, Mark Rubio, said, that if it was said by the Minister, the Secretary of Health, I will respond. But I think that is an area for diplomats. The best person to respond to this House is the PCS. Because if it was my colleague, C.S. Kennedy, Alupe have answered very well. Laikipia we will build. Honorable Dini Nyoro, I think you are a bit very unfair. Because if all counties refuse to host isolation centers, the way you are suggesting, where will the Kenyans who will be infected, God forbid, go? I mean, as a leader, I don't think that way we can be irresponsible. And I agree with you, Madam Zamzam. Semen is part of the fluid. You are right. You are right. I saw people laughing at her. Body fluids. When we talk of body fluids, there are different types. Semen is one of the body fluids. So Honorable Ndindi Nyoro, I really want to urge you, my very good friend, if we say every county refuses, then where are we going to treat Kenyans? Are we going to treat them up in the air? We as a government have a responsibility. We can still even create another isolation center in one of our barracks in any part of the country. If today it was in Mordika in Garissa, in Isiolo, so it will treat both Kenyans and foreigners. And please, let us not politicize it. The document that we signed, and it was for the good of our country. It's the good of our country. It was good for our country. Kenya, Honorable Speaker, is number 2 in terms of healthcare delivery. South Africa is ahead of us. And very soon, even the US that you are praising, having a very good healthcare system, I can assure you, under the good leadership of President Ruto, we will become number 1 in healthcare delivery in another 10 years. Honorable Kimani, I have given all the 23 on our table of all the isolation centers, including let us not politicize the health of our citizens. And I want to ask a question, Honorable Speaker. A Kenyan who is in DRC crosses today. He passes through the scanners in Busia.
Minister, you are not here to ask questions.
Yes.
Give a hypothesis.
No, Honorable, I want to compare with the US one.
Yes.
If a Kenyan crosses and then the scanners don't detect as having Ebola, the incubation period for this disease is 3 weeks. He comes and joins his family and the community. After 2 weeks, he's found to be infected with Ebola. What is the damage that Kenyan can cause? You know, we must look at how to save the nation. So we are more concerned about Americans coming, but we are not concerned about even the thousands of Kenyans, truck drivers who pass every day, go on there. We are just focused. Let us not make, Honorable Speaker, this thing a more of the Kenya Kwanza administration. The health of the citizens of our country is a collective responsibility. Those in government, those in the opposition. We can play around with anything else. Honorable Speaker, the Honorable Sarah Korere, there have been 16 other previous Ebola outbreaks in our country. This is the 17th one. So it didn't come with this government. COVID was not with this government. So, and then Ebola and all infectious diseases, they don't know borders. They cross. They can cross from anywhere. And we must make sure the isolation and treatment centers, including the one in Laikipia, are securely controlled. The environment, even within the Laikipia, in fact, because it's the military camp, is even more secure than the ones we are putting in the counties. Any one of us can be infected with Ebola, God forbid. Healthcare workers will be trained. Waste management will be done. Honorable Speaker, Honorable Mary Emase have answered a question. Honorable Ndindi have answered this question. I think there was Honorable Zamzam under the International Health Regulation Act of 2005, which this House has adopted. We are obligated. We are part of the global community. We are part of the global health security. Kenya is celebrated as one of the key leaders in global health security. We are obligated not only to take care of our own, but we are obligated to treat, to detect, and make sure even those who are not Kenyans, but who are within our border, must be taken care of, so that we are not safe until all of us are safe. I think the Honorable Deputy Minority Leader, my old colleague, the facility is receiving patients. What we have passed in the House was on infectious, biosafety, biological, which were all stipulated in the agreement. And Honorable Speaker, I have carried all the documents for this House. It was there before. You can get it from the Hansard, how it was passed, but I still have copies at the Ministry of Health. So quarantine is not only for Americans, even Kenyans will be isolated at the facility, and I have highlighted the huge Kenyan population in DRC and Uganda need our support. Honorable Speaker, I think most of the questions I have answered. The last one is, let our preparedness and response be dictated by science and not by politics. How we respond, how we protect our citizens from Ebola, which has no vaccine, it should be guided by science, but not politics. We'll go back to politics when we know the country is safe, the citizens are safe. And Honorable Speaker, finally, Nairobi is the center of the diplomatic community. The UN at Gigiri, the only one in the global south, extra 8,000 staff have been brought in the last 3 months. This is where we have the multilateral institutions. This is where we have JKI last year received 9 million visitors and about 3 million tourists. All those, plus our citizens, we must be cognizant of their health. Honorable Speaker, so Laikipia, Honorable Korere, the one on the land taken, I think it is this House again which has passed the agreement between us and our UK partners. So there's nothing illegal the government has done. Let's all of us be the voices and help us communicate to our constituencies that Ebola, and particularly this variant, is dangerous, it has no cure, and all of us must be vigilant and alert, and those of us in the health ministry, we will protect our citizens.
Order, Mary Emase. What is it, Emase? He has responded to your question. What is it you want to clarify? You want to recount what you said?
Thank you, Honorable Speaker. Honorable Speaker, I do not want to be misunderstood. In Teso South sub-county, I have 2 sub-counties. The only hospital I have offering the normal medical services to the community is Alupe. Honorable Speaker, my position and the position of the people I represent is that there is enough land in Alupe. Let the ministry build an isolation center for quarantine purposes,
Away
but
from the
away from the hospital,
Point
but
made.
not to take the hospital for that purpose. That is
Point
what
made.
we are objecting.
Point made. You have made your point, Mary, and you and the minister are saying the same thing. Honorable members, order. Honorable members, the time I allocated has been overshot. Just hold your horses. Has been overshot by 9 minutes. Given the interest, and whoever give 3-3. Okay, Minority Leader Junet, you will be number 1 on this side. Number 2, I'll give Honorable Kiamba Susan. That is number 2. Number 3, I'll give the Chair of Health. This side, I'll give Professor Jaldeza, number 1. I'll give my Deputy Speaker, number 2. And I'll give Madenge number 3. I've already given members of your committee. So let's start with number 1 in quick succession. Junet. I'll come to you. After Junet, Kiamba, after Kiamba, Nyikal, in that quick succession.
Mr. Speaker, thank you very much for giving. Mr. Speaker, I want to ask this. But having noticed that, Mr. Speaker, there is a ratified document by this House. Mr. Speaker, members should take very serious when the Speaker is putting a question. Because many of that opinion say, you just say, you don't know you're ratifying something that's going to bring a disease. So be careful next time. Next time, be careful, please. But Mr. Speaker, my question is, I have condensed this thing into 2 aspects, Mr. Speaker, and I want the Minister to clarify. What Kenyans are grappling with, Mr. Speaker, is how does the government intend to safeguard Kenyan sovereignty and decision-making authority? Just explain to the House how you have safeguarded your sovereignty and your decision-making. And then lastly, whether it is the foreign governments that will decide who gets admitted to those facilities, and whether you have done public and security assessment, and whether you have done that report public. If you answer those 4 questions, then Kenyans will be safe. Thank you very much.
Next, Kiamba.
Thank you, Honorable Speaker. I think my first one was point of order. Is it in order,
There is no
Honorable
first
Speaker?
one. I've given you to ask a question. A point of order arises when a member is on the floor. There's no member on the floor. Ask the question. If you don't, you yield the floor.
Thank you, Honorable Speaker. I would want to ask the Minister, now that Kenyans have spoken loudly and clear, that the context has changed and we do no longer want this center, what is his recommendation? Does the wishes of Kenyans become irrelevant, or can dynamic Kenyans think, or once something is passed in this parliament, it's passed in heaven? Thank you.
Yes, Dr. Nyikal.
Thank you, Mr. Speaker. Mr. Speaker, let me ask one. Who will be admitted in this facility, and what would be the criteria for admission? 2, will people who are already sick be transferred to this admission? 3, will people other than Americans be admitted in these institutions? And on the contrary, will Americans be admitted in the other 23 institutions that you have put in place? And why didn't we...
Nyikal, I gave you an opportunity for 1 question.
Okay,
Those
then let me just, I've asked 3, I'll leave it there. But let me make a comment about the agreement, because I know the agreement, I remember the discussion, and I've had time to look at it. The agreement is a general agreement, Mr. Speaker. It is not just Ebola, it is other diseases, it is nuclear materials as well. And in every point in the agreement, it says with mutual agreement. At every point in that agreement, it says with mutual agreement. So, Mr. Speaker, I only wanted to make those 2 points.
What is the point of order, Carol Omondi? What's your point of order?
Honorable Speaker, is it in order for the chair of the Health Committee to mislead the House and the nation that in those 2 agreements, which I have here and which I've read, there's a clause that provides for the establishment of an isolation and treatment center in case of any outbreak of Ebola or any other disease? There's none. I can read them out for you. If it is,
that.
show us, tell us the article.
Order, Honorable Carol Omondi. Order.
Mr. Speaker, I say.
Dr. Nyekal, I heard you clearly. Take your seat. Take your seat. Carol Omondi just wanted an entry to make an inflammatory statement. Yes. You never said that. Jaldeza? Jaldeza?
Here, thank you.
Order, Carol Omondi. Nyekal never said what you are saying. I'm closer to him. And I listen to all of you.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. I want to tell the House that Kenya is lucky to be having the leading and the best researchers in this region. Kenya has been taking leadership in leprosy research at Alupe, which was an isolation center. Mr. Speaker, when HIV started, HIV patients were actually isolated until people learned that it's not such contagious disease. And it was based at Cambridge, and it has done very well. And the research work which was done and the researchers were left behind for the country. Mr. Speaker, last COVID was such a threatening disease that we were actually trying to look for beds for patients who have COVID. And people are going to all sorts of funny places, including some hospitals in Kibera, and it saved people's lives. But the good thing, the Nairobi Hospital East Wing, was left behind for the hospital
Yes,
and for the country.
what is the point of order?
Oh.
Mr. Speaker,
Point of order. Let's hear it.
is it right for my colleague to refer to Kibera as funny hospitals, even in Kibera? Is Kibera not a constituency?
Yes.
It's demeaning my constituency.
Go on.
Mr. Speaker, Kibera is a constituency, and it has the highest concentration of people in this country, and it deserves better services. Mr. Speaker, my point is this. Mr. Speaker, when this Ebola virus outbreak ends, what will be the benefit left for the country? That now we can say the country benefited financially in terms of resource and research from this outbreak.
Deputy Speaker.
Honorable Speaker, I would like the Cabinet Secretary to confirm to the members here who have objected to having the quarantine centers in their own counties that in our case, Uasin Gishu County is one of the quarantine centers. And because of our close proximity to Malaba border, we can be at risk and our people can be at risk. And that is the reason why we are not politicizing it. We are welcoming it because we know they'll take the necessary steps to make sure that we don't risk. And also, I want the Cabinet Secretary to also confirm to members that you're not going to endanger our health because of politics. This is a highly infectious disease. In fact, it can warrant calling of a state of emergency in the country. It is not a choice for people to make or a court process. The moment the country, if people's health is endangered and livelihoods are at risk, we might not even be, you're not supposed to even question. So I think it's important to know that that is not something that is within our prerogative to say, I don't want this hospital, or I do not want that hospital. And for Honorable Karoli Omondi, if you look at page 5, you will see the participants intend to collaborate in the following areas: surveillance and outbreak response. What is exactly happening now is surveillance and outbreak response. All the steps that the Cabinet Secretary has read here are exactly those. Thank you, Honorable Speaker.
Madenge.
Thank you, Honorable Speaker. Honorable Speaker, I want to draw the Minister to the attention to the first agreement that was tabled in this House for ratification. On page 6, Article 3, Executive Agents and Implementing Agreements. For the United States, the agent responsible is the United States Department of Defense. And therefore, Honorable Speaker, the Minister cannot fail to respond to the words of the Secretary of State in saying that the United States will not allow Ebola-infected patients into their borders, because that is the issue that Kenyans are talking about. In Kenya, it is the Ministry of Health. So, CS, you cannot abdicate responsibility. Honorable Speaker, my second content, again on the agreement, is Article 11, page 11, that this agreement shall remain in force subject to Article 13.2 for a period of 5 years from the date of entry into force and the ratification by this House. There was no express, although there is a provision in 3, this agreement may be renewed for an agreed period upon mutual consultation and consent. In the approval provided by this House, did this House envisage that when I am talking about the approval by the House. The approval by the House. In the approval by the House, did this therefore mean automatically that then when the Cabinet then renewed, that extended the approval granted by this House? Lastly, Honorable Speaker.
I gave you an opportunity for one, Madenge.
Allow me just one. The committee recommendations, Honorable Speaker. Number 5, the implementing review committee be constituted and should develop a mechanism for reporting back to Parliament on the status of the implementation of this agreement. How many reports, Honorable Speaker, have been brought to this House on the implementation?
Minister, before you answer, let me give the minority whip, Millie. Millie.
Thank you.
Ask one question only.
Thank you, Mr.
Don't
Speaker.
make a speech.
No, I actually wasn't going to give a speech. You are the one prompting me. But I'm not asking.
I will stop you if you
I'm not asking. I'm not going to.
Go ahead.
Thank you, Mr. Speaker. Mr.
I've
Speaker.
given Millie on account of being your leader. Go on.
Thank you, Mr. Mr. Speaker, you can see Suberians are disturbing each other. Mr. Speaker, mine is really very, very simple. And if you listen to the concerns, Kenyans are not really too worried about setting up of centers that protect Kenyans. Kenyans are worried about the statement that was made by Rubio from the US that seems to imply that this facility is for Americans to protect Americans so that the infected Americans do not touch American soil. And Mr. Speaker,
if you want my opinion, it was a very irresponsible statement.
yes, it was a very responsible statement.
Yes.
And all I want to ask Honorable Duale, even though he's throwing back this to the Ministry of Foreign Affairs, is what is he doing to deal with this issue squarely with America? We have seen our counterparts in West Africa when they are being bullied by the French, that they take a firm position and say no. So what are you doing to tell America that they are a friendly nation and we are friends to them, but we cannot allow a situation that compromises our own nationals to maintain that friendship? We cannot allow such things in Kenya.
Thank you. Last, Bukose.
Thank you, Honorable Speaker. Honorable Speaker, I want to confirm that when the report was tabled in 2016 by the Committee of Health, I seconded that report, and the chair was Honorable Nyamai. What I wanted to ask the Cabinet Secretary, what I wanted to ask the Cabinet Secretary, why are you laughing? No, it was Honorable Nyamai.
If it's a statement of fact, it remains a statement of fact.
It's a statement of fact.
Yes.
Honorable Nyekal was a member of the committee. And Honorable Speaker, one funny thing about that report is that when we put into the dailies to ask for public participation, there was no single memorandum from the public. Nobody wrote anything. And I think Kenyans also need to be responsible. They must be able to look at some of this when the parliament puts a document for opinions or memorandum in the dailies, that they should also be able to give inputs. And therefore, honorable members who are not members of parliament by them cannot say that they were not Kenyans at that time. They needed to have even put their input. What I wanted to ask the Honorable Minister, Mr. Speaker.
Kajiado South, Parashina, what's your point of order?
Mr. Speaker, is a member in order to come to maybe to relate the public participation by then, and what is going now is Ebola. So we're talking about the Ebola, the foreign, whatever is happening is the question is about Ebola. It's not about the agreement by that time.
I think you're wasting my time because you don't understand. That is,
yes,
this is the problem of not understanding what we were ratifying. Honorable Speaker, what I wanted to ask.
Honorable Junet, what is it? Hold your horses.
Mr. Speaker, Dr. Pokose should have given us more information that Dr. Nyamai was the chair and he was the vice chair.
Yes.
He put it like he was a member.
No, I
but,
was a
but, but, Mr. Speaker, just to...
He said he seconded.
Yeah, but he was the vice chair of that committee.
Yes.
Mr. Speaker, the fact of the matter that is coming out today here is that Parliament ratified this treaty. Yes. Mr. Speaker, yes. Let us be open to Kenyans. We gave them opportunity to give their public participation. We ratified. We told Americans, do what you want to do. Yes. And when the Speaker says, as many of the opinions say, don't cheat Kenyans.
It is true what minority leader is saying. We ratified the agreement as the National Assembly. And it became the law of Kenya because by ratification, what it means is that it becomes part of the law of the country.
Ask the question.
My question to the Cabinet Secretary. Yes. You know, when people are raising about the isolation centers being set up in certain areas, does it mean the whole hospital becomes an isolation center, or there is a specific area within the hospital that is set up as an isolation center? Because I think that is what Kenyans need to understand publicly, so that, like my colleague, when we talk about Kocholwa or Alupe, thinking that the whole of Alupe is an isolation center. So I think the Cabinet Secretary needs to clarify. Even as we speak of Kenyatta having an isolation center, what does it mean? Thank you, Honorable Speaker.
Minister, can you answer all those in 5 minutes?
Yes, Honorable Speaker. Honorable Speaker, let me start where Honorable Pukose left. That isolation centers are not part and parcel of the hospital where citizens access for other services. And it's not something only with Ebola. It is a standard procedure when an infectious disease happens, whether it is Marburg, Mpox, name it. So even in Alupe, in any facility, even in Laikipia, it is very far. Those who come from Laikipia know the expansiveness of Laikipia Air Base. It is far from the base and all the facility in the base. So no hospital. Honorable Chair, Honorable Junet asked whether the issue of our sovereignty. And in my statement I say, and I want to emphasize, that international cooperation does not mean surrender of our national authority and sovereignty. All public health decisions within Kenya remain under the authority of the government of Kenya. International partners and governments, including the US, they provide technical assistance, they provide health commodities, they provide finance, and I want to thank the US government, the only one so far, apart from WHO, who has provided 1.7 billion for just only Ebola. They provide training and logistics support within the framework approved by the Kenyan authorities, and which is consistent with the Kenyan laws. So, Honorable Junet, I want to assure you that all the facilities which are being established, including the one in Laikipia, for the protection of the people of Kenya and all persons within the Kenyan's borders, they are not foreign facilities. They are not exclusive facilities. They are not facilities reserved for any nationality. They are public health assets established and coordinated under the authority of the government of Kenya. Honorable Speaker, Honorable Sholei, I think, made it very clear. We have a moral responsibility. Every county where we are setting isolation, quarantine, treatment centers, they are based on science and the law. And it's done by experts who are Kenyans. Honorable Madenge, you are a member of the health committee. You know that I have never shied away or abdicated my role as a Minister for Health, and I'll never do it. But this agreement first was signed by Minister Macharia. It was again extended by my very good colleague, the current Minister for Agriculture, Kagwe. And when an extension is being done, it only requires one ratification by the House. So the House has passed, the way we have passed many other many other agreements, and this is all to protect our people. Honorable Nyikal, Kenyans will have a priority in admission to any of the centers, including Laikipia. And we should not be very much preoccupied just one center. I don't know what is so fast about Laikipia. We have 23 centers. Even in my own backyard in Garissa, it's one of the counties. Tomorrow, if we agree to put it, and we're going to put it, the people of Garissa will be saved. So we have 23 centers, Laikipia included. And Kenya is one, and let us promote one Kenya, one health, and we protect Kenyans regardless of where they come from, regardless of their counties. We need the isolation quarantine centers, Honorable Speaker, first and fundamentally, morally and constitutionally, to protect our citizens, Kenyans. Again, also to protect other people who live or who come through our country. But for our partners who have signed the agreement, they can access these centers. Americans can access any of the centers. Of course, Laikipia is one of the centers they have jointly worked with the Kenya Defense Forces. Honorable Speaker, Honorable Susan talked about loud and clear. I don't know, I can't answer what is loud and clear, because Kenyans, when they want to make their choice, they do it through a referendum or through public participation, not through demonstrations. And the health of our citizens cannot and will not be decided by 3, 4 people, 10 people who will demonstrate outside MOH. Tomorrow, if Ebola, God forbid, finds itself in our country, the person and the people who will be held responsible is the current government. And we must do whatever it takes to protect the citizens of our country. Honorable Speaker, Honorable Jalesa and Honorable Jalesa, I think, he said we did this. We have the best capital.
Jalesa didn't ask a question.
Yes,
He
Honorable
made a
Millie.
statement.
Please, my good, we join Millie, Honorable Millie, together to this House of Excellency, Honorable Speaker. Don't compare us with some other places. We are ahead. We are #1 in the healthcare. We have a very good relationship with the US. They spent $8 billion. Today, the gains we are proud of in HIV, in AIDS, in malaria, in the capacity of the laboratories in Kisumu, like Kemri, CDC, Walter Reed in Kericho, those were built because of the partnership we have with the US government. For Mark Rubio, I think Senator Mark Rubio, the Speaker, has spoken about it. He's a former long-serving Kenyan foreign minister. He understands diplomacy better than me. I've never been a diplomat. Thank you, Mr. Speaker.
We'll end there. Yes, Nyekal. Which one?
Will people who are already sick where they are be transferred to this unit? Mr. Speaker, I ask that question because science and international practice is when people are sick of a disease in a pandemic or an epidemic, you treat them where they are. You don't move sick people to a place where there's no disease. I would want a question to that. And Mr. Speaker, let me also say, this agreement does not oblige the government to put an Ebola unit. This agreement was general.
Yes.
Honorable Speaker, even to Honorable Nyekal, even here members are sitting. We transfer our patients from one hospital to another hospital. Why do we do it? Because we want them to get better care. The healthcare system, and I don't want to be misquoted, the healthcare system there and the healthcare system for a Kenyan who gets sick. I am sure all of you sitting here, if your next of kin gets Ebola in DRC, the first thing you do is to bring to a better healthcare system in Kenya. Honorable Speaker, and I don't want to talk about hypotheses. As of today, there is no Ebola outbreak. So don't take me to a situation where I discuss about people who are infected with Ebola. When that comes, then the House can call me back and ask me that question. That, are you bringing in people who have Ebola? As of today, there's no Ebola patient in Kenya. When that time comes, I am around, the House can call me back.
And there, honorable members, we'll now go back to order number 8. It is now 4, you'll call it. Well, it's now 4:23. This second allotted day will end at 7:23. And the next allotted day will end at 10:23:25. Call out the next order. Minister, you are released to go back to your office.
Order number 8, motion. Consideration of the budget estimates for the financial year 2026-2027, general debate, second allotted day.
My record shows the Honorable David Ndakwa, member for Malava, had 6 minutes to go. Ndakwa, you have the floor.
Thank you, Mr. Speaker, to have given me this opportunity to continue with the debate on the consideration, the estimates for this financial year, 2026-2027. As I had done my first point, Mr. Speaker, I would like to emphasize on the youth funding, which is an empowerment programs for the youthful Kenyan population, which is a potential that remain underutilized. Mr. Speaker, to the little economic and employment opportunities, we must allocate more resources towards vocational training, enterprise development, innovation hubs, sports and digital skills. Mr. Speaker, we need to offer youth affordable credit facilities so that they can empower themselves where the employment is scarce in our country. Mr. Speaker, sir, empowering our youth is not just about expenditure. It is about investment of this country into the youth, which is for the future and the prosperity of this country, looking at the stability of the economy. Mr. Speaker, I'd like to comment something on education, whereby an educated society is empowered. An empowered society, Mr. Speaker, in the nature that we strongly advocate and enhance the funding of this education sector. Mr. Speaker, sir, education remains an equalizer to our standard of life, and most effectively is a tool in fighting poverty and also creating job opportunities. Looking at this budget, Mr. Speaker, we look at the allocation and find that it has been given a substantial amount of 789 billion towards education. Mr. Speaker, sir, this is a good gesture on infrastructure development. Mr. Speaker, sir, on the recruitment of teachers, whereby we need to have GSSC teachers to be confirmed because they are serving on contract. Mr. Speaker, sir, we are looking at the allocation of bursary, whereby the needy students are to be helped to enhance in their academics. Mr. Speaker, sir, bursary also as a conduit for getting to understand the measure of academic in our law society. The much that is given to education should be given a latitude in bursaries, whereby bursaries in our constituents is also giving lifeline to the low earners in our society. Mr. Speaker, sir, we need digital learnings to be enhanced and also some improvement in learning environments, not just in local areas, but also in urban areas. A denied child to access education is a disservice, because for equity in understanding what education is all about, to acquire knowledge, Mr. Speaker, we need quality education and we need financial constraint. Mr. Speaker, sir, looking at this budget on healthcare. Healthcare has been given an allotment, Mr. Speaker, that I find to be well, depending on the primary healthcare, Mr. Speaker. An improved access to healthcare, Mr. Speaker, it can keep some good survey in equipped hospitals, whereby health centers, like where I come from, Kamchisu dispensary, has got its alignment to understand and be given a leeway to make sure that we are accessing health facilities with no difficulties. Unemployment given to our medical practitioners, Mr. Speaker, sir, where they are not motivated, you will find that their working condition is very poor, which is leading to demoralization. Mr. Speaker, sir, we need to strengthen universal health care because most of our vulnerable in the society are the one getting pressure to tip into their pocket for them to get treatment. Mr. Speaker, sir, we have been talking about Ebola.
Martin Owino, did you speak to this? Okay, get yourself out. Victor Koech. I'm following the screen.
Thank you. Thank you so much, Honorable Speaker, for the opportunity as well to contribute to the motion that is before this House on the consideration of budget for the financial year 26-27, Honorable Speaker. I will constrain myself, Honorable Speaker, to the most of the basic needs. And as to why I say so, Speaker, is because where I come from and where we, members of the rural constituencies and single constituencies that we come from, Honorable Speaker, there are basic needs that still require proper budgetary consideration. Honorable Speaker, on matters education, as far as we are happy with what the Department of Education is doing and are planning to appropriate good monies to infrastructural development, Honorable Speaker, it is very paramount for this House, Honorable Speaker, in the future to as well consider the constituencies that are believed to be underdeveloped. Because, Honorable Speaker, a constituency like Chepalungu constituency that has 187 primary schools that are registered, that has 97 day secondary school that are registered, Honorable Speaker, that is a 5-ward constituency and getting an allocation of 192 in CDF, Honorable Speaker, it is paramount and it's reasonable that the budget and the chair for budget is here, and I'm happy he visited Bomet County, the first ever budget chair to visit Bomet County. He was there in person, he listened, he went through the proposal that we gave him. And I have a belief that he understood the reason where we're coming from, that Chepalungu constituency and other rural constituencies require affirmative action so that our students can be able to compete fairly. Because, Honorable Speaker, they say education is an opener and it's an equalizer. Failure for rural constituencies to have basic infrastructure like the laboratories, like the libraries, like tuition block classrooms, Honorable Speaker. That is why we call upon the Department of Education, together with the chair for budget, to be considering such constituencies like Chepalungu constituency. Honorable Speaker, when we talk about TVET, we know the steps that TVET has put, the efforts that is being put by the TVET department in announcing and in disseminating knowledge, the skills, the basic skills. There are other constituencies like my constituency, Chepalungu, that has an incomplete lab. And that is why we always run to the budget committee to ask if we can at least get some few shillings to complete such infrastructure. But Honorable Speaker, there's something that has been crossing my mind for so long. Because we give free registration, free examination fee, courtesy of the government, to the grade 12, let me say to the Form 4s. We also give it to previously under 844 to class 8. When it goes to the tertiary level, and I'm specific to TVETs, Honorable Speaker, a student or a learner who wishes to sit for exam is being asked to pay to a tune of 12,600. These are amounts, Honorable Speaker, that we've been discussing and encouraging that the Ministry of Education, through TVETs, if it is possible, they can also give free registration to these particular learners so that they do not fall or drop out of school because of lack of examination fee. Honorable Speaker, when I come to electricity, Honorable Speaker, we have had various debates on how we appropriate these monies. Honorable Speaker, a rural constituency in Turkana, a rural constituency in Kisumu, a rural constituency in Bomet compete for the same limited resources like an urban constituency that has a better electricity connectivity. Honorable Speaker, we have always called upon anyone who is relevant to at least consider affirmative action for constituencies that are still below 20% in terms of electricity connectivity. Honorable Speaker, when some of us were elected, we were below 15%. The much that we've tried, no one is able to appreciate, simply because the demand versus the supply is too huge, Honorable Speaker. And that is why all the time we find ourselves in the ministries, we find ourselves with the chairman for budget, trying to at least argue our points that these rural constituencies have to be given proper support in terms of affirmative action. Honorable Speaker, when it comes to other basic needs, that is water and health, I am happy that this government, that East House is appropriating proper finances so that the health care, that is the Social Health Authority, is being given proper consideration so that our people can be able to access free and cheaper and affordable health services. Honorable Speaker, I want to end there by saying at least this particular financial year, we are able to, when, at times, Honorable Speaker, when we sit here and you put a question like, do as of the 7th opinion say hi, we normally say hi, whereas we appropriate money to go and to develop other constituencies. At least for this financial year, when we were saying hi, Kapkwen, Shongiroi Road that is going up to Ndanai is in the budget. At least when I'm saying hi as a member of parliament, a road that is linking from Chebole that has been a problem, going to Chebunyo, going to Emurwa Digir, is considered for rehabilitation. At least today, Honorable Speaker, when I'm saying hi, water that is from Posta has been given proper consideration. At least, Honorable Speaker, today when I'm saying hi, there is proper money that is being appropriated to education to go to support and to confirm our interns who have been serving there for so long, Honorable Speaker. Honorable Speaker, allow me to end there and say I support. Thank you.
Robert Mbui.
Yeah, thank you, Mr. Speaker, for this opportunity to also make my contribution on the budget of this financial year. Mr. Speaker, first and foremost, I just want to demystify this issue of budget because many times Kenyans will be glued on their screens looking at what is happening here and looking at the budget like it's a very major issue. But budgets are very basic, Mr. Speaker, because the budget just deals with expenditures, and it's the same, personal expenditures also are budgeted, family expenditures are budgeted, expenditures of organizations, businesses are also budgeted. So it's the same thing that the government does. And Mr. Speaker, there are certain basic things or basic principles that all budgets must adhere to, and that's what any budget has to have. And Mr. Speaker, those are the things I want to talk about and point out where I feel that this budget has succeeded and maybe also failed. Mr. Speaker, the first thing is that we are spending a lot of our money dealing with the issue of public debt. And Mr. Speaker, it is quite unfortunate because it is many times leaders have spoken about public debt, not just this regime, even the previous one. And Mr. Speaker, it's unfortunate because I remember a while back, before the last election, I remember leaders telling us that, when you are in a hole, you stop digging. And Mr. Speaker, unfortunately, we are digging even faster and deeper than the hole was. In fact, right now, we have submerged ourselves. We are invisible, Mr. Speaker, because we are completely in the hole. I don't even know how we are going to get out of this hole. The kind of percentage of the money that is allocated to this country that goes into paying debt is just too much. It's astronomical. And Mr. Speaker, we must find a way to reduce this. But Mr. Speaker, there is also the matter, Mr. Speaker, of pending bills. Mr. Speaker, we have an issue. A lot of Kenyans have invested in doing business with the government. And and it's not just even at the national level, even at the county level. And they are owed so much money, in excess of 60 billion. Mr. Speaker, I ask myself, that money, if it was released to go back into circulation, obviously that's how the economy grows, because then we have money that is being spent, and therefore we can be able to grow our economy even faster. But Mr. Speaker, the money is tied. People have done business, they have not been paid. People have committed suicide. People have, it is so unfortunate. And Mr. Speaker, what surprises me is that almost every year, we always insist that, we'll set aside some money and make sure that we sort out the issue of pending bills. How many times are we going to have our grandchildren come to this house and continue that discussion? We must reach a point and bite the bullet and say we must sort out this thing once and for all. And Mr. Speaker, we also have to find out what do we do with those government officers that have spent beyond what they are supposed to spend? Because what is it that causes spending bills? Maybe there are some people that give contracts or jobs when there is no money to pay. So, Mr. Speaker, we have to be careful as a country so that we don't continue endangering our people. It is a song that we have sung. We must stop the singing now and make sure that we take action. Mr. Speaker, there is also the issue of prioritization. How do we prioritize our expenditure? Mr. Speaker, sometimes I look at the budget and, you find that there are certain areas, because even in your own personal budget, you will prioritize. You will look at those expenditures that you must, like you must pay for your rent, you must pay for your children's fees, you must buy food. Those are a must. Those are recurrent expenditures that you must do. Then you will, whatever remains, then you can endeavor in doing some kind of development. You cannot start building a house when you don't even have money to pay for children's food. So, Mr. Speaker, the prioritization here is strange, because you look at the kind of budget that, for example, will allow State House and the office of the president, and then you ask yourself, how do we spend that kind of money when we have teachers, intern teachers that are being paid peanuts? And then we expect, and they say if you pay peanuts, you get monkeys. How do you expect teachers being paid, underpaid so badly, to go to those classrooms and teach our JS children? So, Mr. Speaker, and then again, look at the number of teachers. There is a shortfall, there's a shortage of the number of teachers. Why is it we are spending so much money in luxury? Any money going into public offices is basically for luxury. It is for tea, for mandazi, for any entertainment money. It is money that we can do away with, so that we can be able to provide funds that can be able to move the country forward. Mr. Speaker, even when it comes to issues to do with development, because the development has to be done, we have to also be careful, Mr. Speaker. How do we develop the country? Are we developing across the country, or are we segregating and developing certain areas and leaving others? Mr. Speaker, I have looked at that budget, and Mr. Speaker, I am a member of parliament representing a constituency called Kathiani in Machakos County. And I must say that the only project that has been in this budget for over the years that directly touches on my constituency is just one road. That one road, which was worth 1.6 billion, started in 2017. Every year you get peanuts, peanuts, peanuts. Mr. Speaker, even the allocation that we'll get will not take this road anywhere. It's only one road. But there are members who have stood. A member has stood on the floor, and I don't want to name members because that would be unfair. And they've talked about the projects in their constituencies. Mr. Speaker, I want to understand, does it mean that these areas...
There is a point of order from the chair, budget.
Honorable Speaker, thank you very much. I respect my leader here, but I wanted him to give me the details of the road he's talking about. The reason I'm asking is because, Honorable Speaker, we have a comprehensive program for road network in the country, where all roads are being improved, and there's no contractor who is outside site as we talk. So I'm keen to see that road so that I can see whether it's being factual or not. Because, Honorable Speaker, from the resources we have in the budget and even from the securitization, we have been able to ensure that all road contracts are going on smoothly. Honorable Speaker, if the leader could be able to share me the details, I'll be able to respond to that is concern. Because the principle of this government is not to segregate any part of the country. Thank you.
Thank you. I'm happy. Yeah, thank you. I'm happy the chair of budget has indicated that he would be in a position to help. It's a road from Keno through Mitaboni, through Kadhiani, all the way to a place called Kaani. Contract given in 2017, and it is even now. I mean, right now there is no contractor on site. Mr. Speaker, these are facts because even not just my place, there are many roads that are stalled all over the country. And the reason I raise this is because there are certain members that are celebrating their areas and they are very happy about the projects they've gotten, the dams and the roads and all that, at the expense of others. And that's why I'm saying that as a house, we also have to take control. I think the biggest mistake we make as a house is to allow influence from outside to make the decisions on our far-flung parts of the country that will get more allocation than areas that are even more deserving. Places where money will be invested and you can see absolutely no return for the investment. So, Mr. Speaker, I want to talk about that issue of equitable distribution of resources. Let us be fair. Let us ensure that it is not just Kenya Kwanza regions that are being supported. Even Lower Eastern is part of Kenya. And every part of Kenya deserves a big share or the fair share of the budget. Thank you, Mr. Speaker, for that opportunity.
John Makali.
Give me the mic. Oh, thank you, Honorable Speaker, for the opportunity to also weigh in on these budget estimates for the financial year 2026-2027. At the outset, I will thank the Budget Committee for spending hours to work up on this particular report. Speaker, in the interest of time, I have 4 critical issues I want to address, which are critical to our national development. The first one is on the State Department for Roads. Honorable Speaker, in this particular budget, we have allocated a sum of 228 billion towards maintaining the roads for the financial year 2026-2027. Honorable Speaker, roads play a very, very, very critical role in our national development. They facilitate access to markets, they attract investment, they provide employment opportunities. How I wish, Honorable Speaker, that we will have allocated more money on roads because, Honorable Speaker, all over the country, we are having a very, very big problem with our roads. In my constituency, Honorable Speaker, you know we have problems with the common C41, the Navaholo, Muskoma, Dorofu Road, which is a big, big problem. But I'm aware, Honorable Speaker, we passed the infrastructure fund, National Infrastructure Fund. We are hoping that during this financial year, we should be able to operationalize that fund so that it can be able to assist in the maintenance of our roads. Yes. As I commend the allocation on these roads, Honorable Speaker, I want to state 4 things to the committee and to this House at large. First, we need to prioritize the completion of stalled road projects that are giving us really a bad name. 2, we need to enhance maintenance of existing roads networks to protect previous investments. That is very, very critical. And finally, also, ensure equitable distribution of road projects across the country. Honorable Speaker, you will hear in some places they have an allocation of 20 billion shillings on account of roads. And you find an area like Western where you only have maybe an allocation on account of roads around only 10 or 12 billion only. We want equity in the distribution of sums of money set aside towards construction of roads. I also support the operationalization of National Infrastructure Fund because it will be critical in removing the pressure on the budget in respect of these particular roads. The second item which is critical to our national development is agriculture. In this particular budget, Honorable Speaker, we have allocated a sum of 79 billion shillings towards agriculture. Agriculture is very critical to our economy because 20% of our gross domestic product is account of agriculture. 40% of the employments in this particular country are from the agriculture value chain. But Honorable Speaker, we will want to point out three things. While appreciating the steps we have made, I know we have made very serious strides in fertilizer subsidy. We have also made a provision for seed subsidy. Those are very, very good strides. We have also made very serious strides in agricultural research. But I will want to propose three things. One, we started up with the sugar reforms. And all the public sugar mills were listed out. But we have not already completed that part of the sugar reforms. I'm happy that in this particular budget, we have allocated 2.47 billion shillings towards settling of the employees' arrears. I will be urging the committee as it retreats back. There were employees who were sacked specifically from employees from Zoya Sugar Company and the other public sugar mills. For us to ensure that all these employees have a good time, we need to allocate more money to ensure that we clear those arrears that were due to employees and farmers so that they can also be able to have a livelihood. But of that, we will want to insist that the government needs to do several other things. One, ensure timely provision of subsidized fertilizer. We find many times you go to National Cereals Board, you find farmers are queuing, and there are long queues. At times the fertilizer is not available, or if it's available after the season, to ensure timely provision of subsidized fertilizer. Two, strengthen agricultural extension services. The county governments, I know agriculture is a devolved function, but our county governments have not been very, very good in supporting agricultural extension services. We would want to urge that the county governments pull up their socks in terms of agricultural extension services. Equally, Madam Speaker, we are spending quite a lot of money on imports. We are still importing a lot of rice, we are still importing a lot of wheat from outside. We need to strengthen our agriculture sector by ensuring that we have sufficient provision of funds to it. Because in this budget, it's only 3% of the total national budget that has been allocated to a very critical sector like agriculture. And in agriculture, three critical things come to the fore. One, food security. Two, reducing imports and increasing exports. In this particular budget, we have only allocated 79 billion shillings. I find that sum is still a small sum, taking into account that we are also signatories to the Malabo Accord, which clearly indicates that at least 10% of the budgets should go towards strengthening agriculture. So, Madam Speaker, we will be urging that the government looks into allocating more resources towards the agriculture sector, because that is our lifeline. When it comes to education, Madam Speaker, I want to commend the committee for allocating the largest chunk of the money in this particular budget towards education. But Madam Speaker, there are a few critical things which I thought we needed to look into. And one of them is ensuring that there is timely release of capitation funds. Every time we go back to our constituencies, the teachers are complaining capitation has not been released. It's one thing to allocate funds towards a specific project, but it's another thing to have that money released. Teachers are actually complaining. So we will be urging that as a house, we keep on pushing to ensure timely disbursement of capitation funds to schools. To address infrastructure gaps in learning institutions. There has been an inequity in distribution of infrastructure funds. I hope as we pass this particular budget, we are going to ensure that there is equity in the distribution of infrastructure funds in schools. We support the recruitment of teachers, and I think we must thank the government for employing, I think, 100,000 teachers. We are going to employ another 20,000. But we need to ensure that as we distribute those teachers, we distribute them evenly so that there are no shortages of teachers in some places, and we find some places teachers are many than other places. So we need to ensure that even if we employ these teachers, there is equity in their distribution to various places. Because you can find some places there are more teachers, in other places there are no teachers. Then TVET institutions. As we push the idea for TVET institutions, we must ensure that those institutions also work on courses that meet the market. Because we find many other institutions are churning out students who are not fit for the market. We need to strengthen to ensure that the graduates from these TVET institutions actually meet the target. Who are the winners in this particular budget, which I want to thank the budget committee? At long last, our village managers are going to have something to take home, however little. Our village managers, I know an allowance has been proposed for 3,000 shillings. I would say that is a good start. We need to support, and eventually we need to up it up. Two, our electoral, we are moving towards the elections. The IEBC has always been complaining of not being funded adequately to ensure that there is adequate preparedness for the elections. If you move around over weekends, you can see the heightened political activity. We hope the funds that have been allocated to IEBC will be sufficient for them to engage in serious electoral preparedness, because this is, I think, the last budget, not the last budget, but the most crucial budget before the 2027 elections, so that the IEBC does civic education, voter registration, and ensure that the polling stations have been clearly marked out. Equally, from this, we will wish to thank the committee also for looking at confirmation of the JSS teachers. The committee has made a recommendation to have 20,000 teachers confirmed. How I wish you will have confirmed the entire 44,000 teachers who are on internship in JSS and have them, all of them confirmed. But moving forward, we can have a very, very nice budget. But, Madam Speaker, as a House, we need to also pull up ourselves to ensure that we monitor the usage of these particular funds. Because if we do not, then we could just have sums of money distributed on paper, but we are not monitoring up the usage of these particular funds. Because every time we move out in our constituencies, you'll find people are saying funds have not been used, programs that were actually budgeted for have not been executed. We hope that this time around, we are going to do our oversight role as much as we can, so that we can ensure that public funds are put to good use. I support, Madam Speaker.
Honorable Member for Tinderet.
Thank you, Madam Speaker. Madam Speaker, I want to also weigh in and contribute on the budget, the estimates for the 2026-2027. Madam Speaker, first and foremost, I want to laud the chair and the committee for work well done. More importantly, in the education subsector, which encompasses 4 main departments. It encompasses the TVET and vocational education training department, basic education and training. It also has university education, and lastly, we have research. Madam Speaker, this budget has allocated education 781 billion shillings, accounting for 26% of the entire budget. This speaks to the intention of the UNESCO, and more importantly, Kenya has stood for the last almost 10 years, having allocated the largest chunk of resource to education. And this money has actually gone into making sure that the sector grows, that we are still moving on with the implementation of the new education policy that was started way back at the tail end of President Mwai Kibaki and the beginning of President Uhuru's time. And now that it is going towards the final end, the university and now the senior school and towards the university. Madam Speaker, first and foremost, I want to say that in technical education, there is provision for resources, especially for capitation. This is an area where the largest group of young, strong Kenyans are. The TVET institutions across the country, and the government has a very clear policy and program on that, to construct TVET in almost every constituency. Resources have been provided. We have TVETs that are ongoing. We have institutions or TVETs that are actually undertaking several different programs running across the country. But the main thing that is actually taking the chunk of this money is the capitation to learners. And I want to laud the committee because the government has allocated up to 9.5 billion shillings for capitation. And this is going to actually allow majority of these students this year to be retained in school. Last time the capitation allocated to TVETs was 3.5 billion. This is almost an increase of 3 times that amount. And actually that reflects the Kenya Kwanza's policy of trying to make sure that learners are retained in colleges and institutions. On the same note, there is a counterpart funding on the issue of equipping TVET institutions. In this House, members of Parliament have really raised issues of completed TVET institutions without equipment. And you know very well that skilling requires equipment, it requires staff, and it requires the equipment to be used in those particular facilities. So there is a provision for for equipping those institutions, those facilities that are completed, and even equipping the labs, equipping the workshops, and the rest. On the same note, Madam Speaker, TVET, that encompasses the polytechnics, the TVET institutions, and also the employment of trainers. One of the things that I think this budget failed to capture, and I think the chair is listening, is to ensure that we provide resources for more recruitment of more trainers. As much as we are constructing TVETs across the country, there is need to employ at least up to 5,000 trainers so that TVET institutions do not use the little resources to employ the BOM trainees across the country. On basic education, Madam Speaker, the resources that have been allocated is quite a lot. There is a provision to support junior and senior school learners in terms of capitation, which is amounting to 81 billion shillings. This money, Madam Speaker, looks a lot, but in terms of student population and in terms of capitating each learner at the required level, there is a deficit of almost 40 billion shillings, or over 40 billion shillings. One of the good things that the government has done this year, and I think it is very important for the country and for all of us to know, is that the capitation for primary schools have been increased from 1420 to 2020. This is an increase, but in real terms, it is going to make a difference in terms of support in running the operations of many of our primary schools. Yes, a number of people have been saying, yes, it isn't enough, but we are actually having a serious constraint in this particular budget, and I want to say that that is going to assist because most of the primary schools have been joined together with the JSS, or the junior secondary schools, which have a capitation of 15,000 per learner. In that, the head teachers of those schools are able to jungle up or to use both resources to ensure that those two sections of our school system run amicably. The other area which I think is very important in basic education, Madam Speaker, is the issue of quality assurance and standards. This is a sector which I want to implore this House and I want to implore the State Department to make sure that there is a serious quality assurance and officers across the country. Madam Speaker, the country allocates huge resources for construction of laboratories, for the construction of infrastructure, about 2 billion shillings, for school feeding program, 3 billion shillings, but there is little inspection and finding out how these resources are utilized. That's why, as a committee, the days of the famous Tuma and the famous inspectors of schools are very important. I know we are in a mourning period when we lost students in Utumishi Academy and in many other the school hundreds that are in the country. But what is very serious is that quality assurance and standards officers need to come out big time to make sure that they are the pulse of our schools. They are the people who make sure that what is set standard is followed. But every time we allocate budget here, quality assurance is given almost nil. In fact, I was asking the CS and the PS, why is it taking backstage? Yet these are the people who keep schools running, who make sure that teaching and learning is going on, who make sure that facilities that we have allocated
Specified areas of the country.
So that's very important. The other issue, Madam Speaker, is the issue of Teacher Service Commission. Teacher Service Commission has been allocated a budget of over 400 billion shillings. This money goes to serve the following purposes. One is salaries, most of it is salaries, or remuneration for the staff, and more importantly, to convert 20,000 interns into permanent and pensionable. I know there have been hue and cry, and I think the government, because of that policy, the 24,000 teachers that are remaining will be converted when they clear their circle, when they clear the contract period. Two, there is money allocated for promotion of teachers, 2 billion shillings. That particular money is very important because over the years, teachers have stagnated in job groups for a while. And to have a workforce that is motivated, they must be promoted. They must be motivated. And the government has allocated this. And this was actually a policy that I think will promote thousands of these teachers. Last year, they were promoted 14,000. The other year, 36,000. And I think this year, out of the retirement savings and this, they'll even promote over 30,000. On the same note, Madam Speaker, we have the issue that is very important and which teachers have been calling for, especially on the issue of the WIBA and they call this other insurance, where they were really complaining, the accident cover. This is an area which the government has not been able to cover for the last period of years I've been in this sector, over 10 years. And every other time, the Teacher Service Commissions come before and they make a plea on that. The other area which I want to really talk about is the issue of the CBA, that this money covers the CBA for teachers, which they arrived and agreed with the government 2022-2027. It has actually been factored in this particular budget. Lastly is on the universities. The universities, Madam Speaker, is a sector that has grown over the years to be the largest subsector in the education sector. The State Department for University Education has been allocated resources, one, for construction and completion of stalled projects within various universities. I want to laud the State Department this time because they have a fair distribution of development projects across most of the 30 universities. And I think this is going to ensure that projects that are 80–90% complete or are supposed to be completed and be brought to use. This is as a result of movement, or actually as a result of an oversight visit by the Education Committee across all public universities. And we found out that universities that had projects that were 80–90%, we actually asked the department to make sure that resources are allocated to each and every university to complete and bring those buildings to use. Madam Speaker, another allocation that has been done at the State Department for Higher Education is funding for the university's CBA. This has been allocated, the much needed resources, and I think the lecturers and staff will be actually feeling good and laughing all the way to the bank. Immediately we pass these particular estimates in due course, and therefore it will actually make sure that the government honors the CBA of 2017, 2022, and the subsequent years to come by. The other allocation that has been allocated to the universities is the capitation, which now has been given the State Department. However, Madam Speaker, the capitation that has been given has only been awarded to the year 5 and 6 universities that are still having the former DUC funding model. The current funding model, most of the students will be actually catered for in the new funding model. And most of the funds are channeled at Higher Education Loans Board and University Funding Board. However, there has been a plea from the Vice Chancellors, and more importantly, from the State Department, that the resources be channeled and be capitated, as it has been over the years, to make ease the implementation of that particular program. Madam Speaker, I also want to thank the Chair Budget, more importantly, especially on the issues that he has actually captured very well in university education. One of the issues that I think is very important is also ensuring that the universities within our country, and more importantly, the lecturers, have their money. On other issues, Honorable Speaker, I want to thank him because in agriculture, there is a lot of resources that has been given for the fertilizer subsidy. And as most of us are from rural constituencies, I in particular, where my constituents are tea, coffee, and sugar farmers, that particular subsidy is going to go a long way in putting money in the pockets of our farmers. We have the issue of IEBC, we have the issue of roads. The issue of IEBC, I've seen there is a good resource allocation, and this is actually to promote democracy in this country. And we know very well that we are going towards the electioneering period. And the resources that have been given is to enhance the country's, to entrench the country's democratic principles, institutions, and to make sure that the next general election will be done very well. Lastly is on the issue of roads. I want to laud that, and I want to say that this government has done very well, especially in ensuring that contractors go back. One of the biggest projects and a flagship project of this administration is the Mau Summit Rironi Road, which I'm seeing, because that is the road I use when I'm going home, is actually being constructed day and night. And I want to say thank you, Chair Budget, that particular program is running very well, though it's a B&P and it is within the requirements that is sought. I think that is what the government has done very well. I thank you and I support.
The Honorable Member for Funyula.
Thank you, Honorable Speaker. In pursuant to the provisions of Article 221 of the Constitution of Kenya, it is right to stand here and make comments on the budget or the statement, the consideration of the budget statement for the financial year, the report that has been tabled by the Chairperson Budget and Appropriation Committee. Honorable Speaker, for the many years I've been here, at times the national budget becomes just a ritual that we have to go through that hardly ever addresses the pertinent issue and the contemporary issues of the day. Unfortunately, due to the prevailing circumstances, the budget estimates we have here today, at no way do they attempt to address the pertinent issues that we have today. They are simply meeting the requirements of the law and to get the government run as is required to do so. Honorable Speaker, from the very basics of macroeconomics, a budget at any given time must dissect what is ailing the country. The budget policy statement was explicitly clear. It picked out what are our challenges, it picked out what are our problems. The Economic Survey 2026 picked out what are our challenges, what are the things that needs to be done to kickstart this economy. Truth be told, and we cannot keep on hiding our head in the sand, the economy is not doing well. That's the plain truth. Anybody who deludes himself the economy is not doing well, it's only doing well for those around us, certain people who are the ones who have taken hostage of the money, as they put it in my village. Honorable Speaker, if you have read the Economic Survey, they are very clear. The issue of reducing per capita income, the stagnant jobs, the low salaries or income, vis-a-vis the increasing cost of living. Honorable Speaker, with core inflation, which is the core, standing at 12%, Honorable Speaker, anybody would have expected that the budget for 2026 would have been extremely innovative to make sure we pull Kenyans out of the hardship and the high cost of living and the endemic poverty that pervades many parts of the country. A country that's supposed to be middle income, if we have poverty index in some areas close to 80%, we cannot surely just make it business as usual instead of attending or attempting to address the issues. Honorable Speaker, I have looked at the policy considerations that have been presented by the committee and were moved my good friend, my neighbor. Indeed, Honorable Speaker, I really expected that the policy direction will stem directly from BPS. We will borrow heavily from country reports by World Bank, IMF, and craft a budget that will kickstart. Unfortunately, I understand I have been in this political space. I do not want to blame the committee. I have been in this political space. I know things, how they work. The letter and the spirit of the Constitution says the National Assembly makes the budget and appropriates. But as many will tell you who have held that position, they know reality is different. The exigencies of the day might force you to go elsewhere. Honorable Speaker, if you dissect the structure of this economy, the way the economy is being structured now, we have no room. There is no headroom for us to change the economic status. The only headroom we have is to completely change the structure of this economy. Continuously relying on agriculture. I can see my colleagues are regulating about fertilizer subsidy. If an economy, in the third, middle income economy, if it's still preoccupied with food production, subsistence production, then we would rather accept where we belong and remain there forever. Honorable Speaker, the income, the profit margin from agriculture are very low, and any invested shilling, the marginal income, marginal utility, actually sometimes tends to be negative. We must focus the economy where we need to make sure things move to the right direction. And where does that lie, Honorable Speaker? That lies in making sure the manufacturing sector, the productive sectors, that's manufacturing, mining, value addition, and the service sector. Honorable Speaker, that's where we have refocused this budget to ensure we invest in those areas that realize better returns. Honorable Speaker, what have we done? What have we done? And Kenyans need to understand this. What have we done? Out of a national budget, national government budget of about 2.3 trillion, we have allocated close to 30 billion towards the executive office of the presidency. That includes the office of the president, includes the office of the deputy president, includes the office of the prime cabinet secretary, includes the office of the cabinet, as it's called, the cabinet affairs, parliamentary affairs, and includes State House, which Honorable Speaker and the Kenyans need to understand has gobbled up a whopping 13 billion. This ending financial year, because the abuse of Section 2 to 3, they actually ended up close to 18 to 19 billion. Yet, Honorable Speaker, when you look at what we have allocated towards enablers of industry is zero. It's negligible. Based on what we can do. Honorable Speaker, it's indeed telling, and we raise this issue. Honorable Speaker, whatever they have told us, this regime has told us they have invested in the manufacturing sector. Honorable Speaker, has been only pumped into brick and mortar, building the KIPES, EPZA, that literal white elephants. Nobody has expressed any investment. Even the investments were pumped into, since they took office in 2022, the return is negative. And you expect Kenya to achieve Vision 2030 of being the most industrialized country in the next 4 or so years to come. Honorable Speaker, when you go through this, Honorable Speaker, it is now time that we put money where Kenyans are so that we grow our economy, Honorable Speaker.
And where Kenyans are not, are unknown. We have seen the government is talking about, fiscal consolidation.
Just let him finish his sentence and then you stop.
Honorable Speaker, please, honorable member, please relax.
I'll give you a chance. Just let him, because he's finishing, he's winding down. Let him complete his sentence because his time is up anyway, and then we come to you.
Honorable Speaker, part of where Kenyans are not is the kind of mechanisms we see government talking about, fiscal consolidation, Kenyans to tighten their belts. Kenyans have no belt to tighten. The belts that are available to be tightened is the kind of budget you have seen in big offices. In these estimates, Honorable Speaker, that an office that used to have 4 billion Kenya shillings in annual budget, now they have a budget cruising 20 billion Kenya shillings as of as by the end of last financial year. Currently, they're asking for 13 billion, and for sure, they are going to overshoot it. Honorable Speaker, it is time to cut the fat, Honorable Speaker, starting from the top, so that we stop this kind of profligate expenditure, Honorable Speaker, at the expense of Kenyans. I submit.
Yeah, Honorable Zamzam, what did you have to say?
Asante sana Mheshimiwa Spika, na mimi niweze kuzungumzia budget ambayo imeletwa bungeni ya 4.89 trillion. Mheshimiwa Spika, Mheshimiwa Spika, ni dhahiri kuwa wajua nyani akikosa ndizi usema mgomba umeteleza. Mheshimiwa Spika, na kwanza nianze kumkosoa ndugu yangu aliyokuwa chair wa budget kwa kuja kudanganya Wakenya, kwa sababu anajaribu kuwasha moto. Hii moto mara hii haiwezi kuwaka, kwa sababu wakati ukiwa kwenye hicho kiti wewe ulitupangia vitu hapa, tulivyokuja kukukataza ukawa mkali kweli kama pilipili. Lakini Mheshimiwa Spika, yote mimi naangalia katika hii budget ambayo imewekwa hapa, 23,000 schools zimejengwa zile za JSS, Mheshimiwa Spika. Ukiangalia katika agriculture ambayo inasaidia ndio uti wa mgongo wa taifa la Kenya, Mheshimiwa Spika, tumewekewa 63 billion ambayo imeongezwa wakulima, Mheshimiwa Spika. Na hii italeta chakula Kenya, hatutakuwa na matatizo tena kule kwenye ukulima kama tulivyokuwa tunaona, Mheshimiwa Spika. Mheshimiwa Spika, hapa tulikuwa na mjadala wa wazee wa mtaa. Nakumbuka mimi mama Mombasa County nikisimama nikitetea wazee wa mtaa. Siku hiyo sikuona Ndindi Nyoro akiongea chochote kuhusu wazee wa mtaa. Na wazee wa mtaa toka wakati yule president mwingine alikuwa hawakuwahi kukumbukwa, na yeye alikuwa hapa bunge, hakuwahi kuleta mjadala hata siku moja kuweza kutetea wazee wa mtaa, Mheshimiwa Spika. Sisi tulioleta tunashukuru hata hichi kidogo ambacho wamepewa, kwa sababu haiwezekani kuwa wewe unasema budget imepanda imekuwa juu, wakati ambapo baada upande mwingine unasema hawa waongezewe kitoka wapi? Wachukue mawe wapewe kama budget? Haiwezekani. Hii ambayo nataka iongezwe ndio hii ambayo naisoma hapa leo, Mheshimiwa Spika. Kwa hiyo Mheshimiwa Spika, mimi kwanza nipongeze sana kamati ya budget kuweza kuwakumbuka wazee wa mitaa ambao kila siku watu wakikosana katika majumba yao, Mheshimiwa Spika, kesi zote zinaanza na mzee wa mtaa. Mtoto akipotea ni mzee wa mtaa, mama sijui amefanywaje ni mzee wa mtaa. Leo wazee wa mtaa hichi kidogo ambacho wanapata ndio mwanzo wa kuanza kupata hadia kutoka kwa serikali, na hii itaweza kuongezwa kadri tunavyoendelea kukaa katika taifa hili na kutunga sheria, tutaweza kuongezea zaidi, Mheshimiwa Spika. Na najua wazee wa mitaa mahali wako, hasa wangu wa Mombasa, walikuwa wanangoja ni siku gani watanyoshewa mkono japo kidogo tu na serikali, na leo imeingia katika budget. Niwaambie wazee wangu wa mitaa mahali pote mpo Mombasa na Kenya nzima, mara hii William Samoei Ruto na hii serikali yake wamewakumbuka, mnaenda kulipwa chochote kiinua mgongo kitaweza kuwasaidia, na inshallah tutaweza kusukuma hapo mbele muweze kuongezewa kadri wakati unavyokwenda. Mheshimiwa Spika, naangalia kule marginalized communities. Ukiangalia wajua hao wanapiga kelele kwa sababu mfuko wa serikali ulikuwa unaenda sehemu moja. Ukiangalia shule kule mahali Ndindi Nyoro anatoka, hata aliulizwa hakuwahi kujibu, Mheshimiwa Spika, kwa sababu the low hanging fruits alikuwa anachukua anajiwekea upande wake. Sijasema ameiba, Mheshimiwa Spika, lakini hakuweza kujieleza, Mheshimiwa Spika, shule zake alijenga vipi, wenzake wanatukanwa, yeye amejikunja miguu, kule kunaendelea kule kwake. Mara hii paka amekula mkeka wa Mbeya, watakaa wapi? Huu mgao unaenda kila mahali, Wakenya wote waweze kupata huu mgao, Mheshimiwa Spika. Mheshimiwa Spika, niweze kusema, naangalia zile barabara za kule North Eastern. Kaa chini Ndindi Nyoro, wakati wako utafika, mama kaunti wa Mombasa anazungumza. Mheshimiwa Spika, ukiangalia kule kule North Eastern, kule kwa wenzetu kule walikuwa marginalized for the first time. Tumeona hata stadium imeweza kujengwa kule, Mheshimiwa Spika, mpaka rais wa taifa analia kwa sababu anajua miaka nenda miaka rudi, sisi watu ambao tunatoka katika communities ndogo ndogo, Mheshimiwa Spika, tulikuwa tumesaulika. Huyu atanitatiza, Mheshimiwa, ana ukorofi tu, aliongea hii budget jana, leo baada amekuja kuongea, Mheshimiwa Spika. Aniachie wakati wangu mimi nikiwa na moto, huwa nataka niendelee na shughuli zangu, Mheshimiwa Spika. Mheshimiwa Spika, leo
Honorable Zamzam, is allowed to respond since you mentioned him. Okay.
Thank you very much, Honorable Speaker. And Honorable Zamzam, I will not have interrupted you, only that I just needed to guide you that we are debating the report of the committee, not Ndindi Nyoro. But secondly, you stop also misleading Kenyans. I agree all public primary schools in Kiharu look like academies, they are tiled. And in fact, our learners in these secondary schools, they pay 500 shillings per term. This is an NGCDF project, and one of my roles is not me teaching you how to execute your GAF or NGCDF. All the things you have done in the education sector is on the basis of NGCDF, which I am not part of how the formula comes about. So it's important that you be factual and stop misleading Kenyans. Many times when you talk too fast the way you are doing, you may not coherently be able to transmit what you are thinking and what you are saying. Please be stable.
Now you're being derogatory. Proceed, Honorable Zamzam.
Asante sana Mheshimiwa Spika. Wajua mtu ukimchuna bahali yake kama vile wenzetu wao wanasema huwa inauma sana. Kwa sababu Mheshimiwa Spika, haiwezekani kule ule mlemba kule kwake zile pesa zile anazozipata hata akifinya vipi hawezi fanya vitu ambavyo huyu amefanya. Na huyu alikuwa kwenye budget committee, sisi tunajua alikuwa zile low hanging fruits. Hii kitu inajulikana bwana. Alikuwa anajichukulia mabarabara na nini, na leo mimi nitakwambia wazi wala sitetereki, mimi naitwa Sibor Madakos, jike la simba. Na huwa sibabaishu na kitu chochote. Kwa hiyo mimi nataka niseme Mheshimiwa Spika, imefika wakati Kenya hawa watoto wote wanasoma katika mashule zote waweze kupata same wawe mgao wa kisawasawa Mheshimiwa Spika. Na mimi niweze kushukuru pia budget committee wamekumbuka capitation capitation ya mashule na wameweka vizuri. Watoto wetu walikuwa wakibaki nje Mheshimiwa Spika, wameweza kuweka pale. Nizungumze na niseme pia nakumbuka wakati ule tulikuwa tunazungumza mambo ya finance bill hata ikaleta matatizo katika taifa Mheshimiwa Spika. Budget wakati ule ilikuwa imefika 12 billion nakumbuka. Ya State House peke yake, manake ninayo hapa. Asije kututetesha huyu hapa leo. Imepungua huku paka imerudi chini leo Mheshimiwa Spika, kuambiana kuko kuelewana ndo hakuna. Kwa sababu yuko kule upande wa upinzani basi atasema lake tu lifike. Hatuwezi choma hii nchi, mara hii tutaambiana ukweli ndani ya hili bunge. Mimi ndo nilitetea wa Kenya nikasema ile finance bill ilikuwa mbaya. Ilofuata Mheshimiwa Spika ilikuwa smart kabisa. Lakini sasa huyo asije kudanganya hapa wa Kenya kwa sababu wanataka kuchukua nafasi ya siasa katika taifa. Tunaelezana ukweli. Wewe wataka shule zijengwe, zitajengwa na mawe Mheshimiwa Spika? Hazijengwi na mawe. Na wengi hapa hata katika upinzani wamesimama wakipongeza hii budget. Lakini na mimi nawaongoja kwenye finance bill kwa sababu hii budget vile ilivyo lazima itatoka tax uweze kufandi hii budget hii. Na hapo ndo tutaka tuulizane, wewe ulitaka pesa ziwekewe huku nyingi, hizi pesa zilikuwa zitatoka wapi Mheshimiwa Spika? Mheshimiwa Spika, naona stadium zimejengwa kama kule juzi Northeastern wamefurahi, nimeona mabarabara zimejengwa na hapo ukiangalia infrastructure wameka 170 billion Mheshimiwa kutoka kwa 70 billion. Hii yote inaonyesha kuwa miundo misingi katika taifa itakuwa imenyooka vizuri sehemu zote. Mara hii hakuna kwenda sehemu moja. Hata sisi kule pwani tunataka Mombasa ing'are, ile barabara yetu tumeona imeanza kutengezwa na hata juzi Mheshimiwa Rais alikuja akaweza kuizindua. Ilikuwa barabara mbovu, sisi tukiangalia sehemu za wenzetu wako wamekaa vizuri lakini sehemu zetu sisi zilikuwa mbaya. Kwa hiyo lazima hii mimi narudi pale pale, mgao wa taifa lazima uende sawa sawa katika kila sehemu. Wao wasionewe wala sisi tusionewe Mheshimiwa Spika. Mheshimiwa Spika, nazungumza juu ya ile pesa ya vijana ambao tuliona 4.7 billion Mheshimiwa Spika ambao ilikuwa inaenda kwa vijana. Wakati wa nyuma tulikuwa hatujui hizi pesa na zilikuweko katika budget. Wajua mimi nilikuwa najiuliza hii 5 billion hii iliyokuwa hapa na World Bank na ilikuwa inaenda wapi? Sasa juzi nimepata kijana anaelezea vizuri walikuwa wanafuata taratibu sehemu moja ya nchi, hizi pesa zinaenda huko. Lakini leo nataka nishukuru, Nyota program imeelekea kila mahali. Ukiangalia kila constituency, vijana wamechukuliwa na Nyota program. Isipokuwa tu kitu ambao nataka ifuatiliwe ni kuwa hii Nyota program wa vijana wakipewa mapeni pia wafuatiliwe, waangalie zile biashara zao wanazifungua kweli ama wamezubaa Mheshimiwa Spika, kwa sababu juzi tumeenda Kwale tukapata wachache wamefanya, wengine pesa hawakuzitumia vizuri. Lakini wengine nawapongeza walionyesha maendeleo yao, tukitembea na committee ya social protection tuliweza kuona Mheshimiwa Spika. Kwa hiyo pesa ambazo zinatumika Kenya ni nyingi. Ukiangalia kama ile Women Enterprise Fund, kitu ilinishangaza Mheshimiwa Spika kwetu, mbona mimi napewa nafasi kidogo jamani, huyu amechukua nafasi yangu mniongezee Mheshimiwa Spika. Mheshimiwa Spika, wacha hata niache Women Enterprise Fund itakuja kuzungumzia kwa komiti yangu. Naona katika child welfare wameongezea milioni 500. Watoto mayatima wale wanakaa katika mashule ambao wanasaidiwa na serikali imeongezewa. Cancer centers pia wameongezewa pesa. Umeona, tunaona 20,000 teachers wamewekwa kuwa pensionable. Hii ni kitu kizuri sana. NGCDF serikali yako Mheshimiwa Ndindi Nyoro mmeongezewa 61 billion from 57 billion. Hii inaonyesha kitu kinaenda vizuri Mheshimiwa Spika. Bandari yetu, bandari maritime ya kule Pwani wamewekewa 140 million ya kuweza kutrain hao vijana kuingia kazi za ubaharia Mheshimiwa Spika. Mheshimiwa Spika, na naona pia baba yetu aliotangulia, baba wa taifa Raila Amolo Odinga, katika ile monument yake kumkumbuka na ukumbusho wamemwekea ka budget pale ka 30 million waweze kutengeza vizuri ili watu na watoto wetu wa vizazi vijavyo waweze kujua baba Raila Amolo Odinga alikuwa ni nani Mheshimiwa Spika. Nimeona pia na kitu kingine nitazungumza Mheshimiwa Spika, pending bills pia tuweke hapa kwa budget. Mheshimiwa Atandi na wenzako tujue kama tuweza kulipa madeni ili Kenya iweze kusonga mbele. Lakini yote ya kuisha Mheshimiwa Spika, mining kulikuwa na shida mpaka kule Kwale. Mheshimiwa Undo amezungumza lakini haelezei kuwa Wakenya wenyewe ndio huwa tunaleta shida wakati ambapo mambo yanaanza kuja mazuri ili tuweze kupata faida, tunaanza makelele. Kwa hiyo bado yatatuliwa, mining itakuwa tapped vizuri na pesa hizo zitaweza kusaidia uchumi wa taifa Mheshimiwa Spika. Kwa hayo mengi na machache, asante sana, na niweze kusema police budget yake isikatwe. Mtu amesema hapa polisi wasipewe helikopta. Wakati mtu anakwama ndani ya bahari, unaona unaambia polisi enda utoe, anamtoa namna gani? Lazima aende na hiyo helikopta atoe mtu ndani ya maji. Kama juzi nimeona kule katika Central kuna mtu alikuwa katikati ya maji na nchi kavu, walienda wakamtoa na helikopta. Kwa hiyo Mheshimiwa Spika, mimi nataka hii ya polisi pia iangaliwe, health iangaliwe vizuri na mambo mengine yote iangaliwe vizuri, na support Mheshimiwa Spika.
Asante. Member for Magarini.
Asante Mheshimiwa Spika, kwa nafasi hii nikaweza nami kuweka sauti yangu katika makadirio ya fedha ya mwaka 2026-2027. Kwanza kabisa nianze na kupongeza kamati kwa kazi yao nzuri walioifanya na kuhakikisha ya kwamba kila pembe ya nchi inapata mgao
sawa na sehemu zingine. Kwanza nipongeze kwa upande wa elimu, hatua ya kwenda Mombasa, safari ya kwenda Mombasa inaanza na hatua ya kwanza, vile ya kwamba tuko na walimu wa GSS 44,000
na hivi sasa bajeti imeweza kuwawekea 20,000 kwamba wakaweze kuingia katika kuajiriwa kikamilifu. Hiyo ni hatua ya kwanza, na nina imani kwamba tunapokuja kukadiria sehemu ya pili ya budget tutaweza kuwachukua hao 24,000 ambao wamebaki. Hapo ningependekeza iwapo itawezekana wakati mwingine tuweze kutumia kama vile wakati tunafikiria kuajiri wanajeshi.
Kuna wakati mmoja training ya wanajeshi ilikuja ikasitishwa. Pia vile vile kwa upande wa walimu tumeweza kusomesha wengi, lakini kuajiri imekuwa changamoto. Hivyo basi ningependekeza ya kwamba wakati mwingine iwe tunaweza kusitisha ili wale ambao tumesha watrain waweze kuingia katika kuajiriwa kwanza, ndipo baadaye tufikirie masuala mengine ya kuendeleza. Pia vile vile nipongeze kwa upande wa vyuo vya kiufundi, hela ambayo imetengewa ya kuhakikisha kwamba wanaweza kupata masomo kwa njia ya urahisi, na pia vile vile kuweza kupata fedha za kujikimu wakiwa pale chuoni. Hiyo mimi kwangu nipongeze, kwa sababu inaendeleza ile ndoto ya serikali hii ambayo ni kwamba ni kuhakikisha kwamba kila kijana anapata ujuzi na kuona kwamba anajitegemea mwenyewe. Pia vile vile katika hazina ya nyumba Mheshimiwa Spika, katika hazina ya nyumba tumepata kuona pia vyuo hivi vya kiufundi vimetengewa fedha za kujenga mabweni, hasa imepata kufika hata katika sehemu yangu ya Magarini. Hivi ninavyozungumza, Magarini Technical and Vocational College
inajengewa bweni la kisasa la orofa 4
pamoja na soko ndani ya hilo bweni. Hiyo ni kupongeza.
Nikifikia kwa upande wa afya, Wizara ya Afya pia imepangiwa vizuri. Na hapa pia nitazungumzia swala la SHA. SHA kwa hakika inafanya vizuri, lakini kwa wakati mwingine tunapata ya kwamba wale ambao maafisa ambao wanaishughulikia hii kwa upande wa malipo kuko na utepetevu kiasi, na hivyo ndivyo inachangia kwamba lawama zinakuwa nyingi. Pia vile vile ukimulika nyoka usimumulike mbali, mulika kwa mguu kwanza, ndivyo umulike sehemu nyingine. Tukizungumzia swala hili la SHA kwamba inafanya kazi, ni masikitiko makubwa kwangu kwamba baadhi ya wafanyikazi wa ofisi zile za constituency, ofisi za maeneo bunge, hii SHA kwa hakika haiwafanyii kazi kikamilifu. Wanatozwa fedha za kupimwa peke yake, lakini hakuna pesa za matibabu. Hapo ningeomba wizara husika ikaweze kuangalia na kuona kwamba hata hawa wafanyikazi wetu katika ofisi zetu za constituency pia nao wanapata mgao wao kisawasawa, wanafidiwa kisawasawa, sio pesa za x-ray, pesa za mambo mengine. Hapana, wawe pia hata kwa matibabu wanajumuishwa, maana wao nao pia wanatoa changizo zao katika SHA. Nikirudia masuala ya wazee wa vijiji, ni swala nyeti ambalo tumejadiliana kwa miongo mitatu sasa. Tumepitisha kwamba wakaweze kulipwa, lakini haikuwezekana katika serikali nyingine yoyote ila serikali hii ya Mheshimiwa Ruto kupitia kamati ya bajeti ambayo inaongozwa na Mheshimiwa Bwana Atandi kwa wakati huu. Nipongezi Kenya nzima. Nimesema hatua ya kwenda Mombasa ama safari ya Mombasa inaanza na hatua ya kwanza. Ni chanzo, wazee wa vijiji ni chanzo, wamepata angalau pesa ya kuweza kupiga simu. Manake tatizo lolote likitokea kwa kijiji, mtu wa kwanza ni mzee wa kijiji. Pia vile vile tunaposonga hapo mbele, nafikiri kutakuwa na wakati ambapo hata wale mabalozi wa nyumba 10 watafikiriwa. Kiwango hichi kilichoko ni kidogo kwa sasa, lakini ni imani yangu kwamba kadri tunavyosonga mbele itafika wakati ambapo hata mzee wa kijiji anaweza kupokezwa 10,000, 20,000 kulingana na vile ambavyo tutakuwa tumejizatiti kiuchumi. Mheshimiwa Spika, pia vile vile nigusie masuala ya barabara. Masuala ya barabara tumejionea wenyewe jinsi ambavyo rais anashughulikia barabara zetu za Jamhuri ya Kenya, jinsi ambavyo hachoki, halali, kila kukicha anafikiria ni vipi nitaimarisha sehemu hii ya nchi ambayo ilikuwa imewachwa nyuma kwa muda mrefu. Mheshimiwa Spika, nipongeze zaidi kwa kamati, kwa sababu kamati imezingatia miradi yote ya barabara ambayo ilikuwa imesimama, imeweza kuitengea fedha, na kwa wakati huu hata mimi nami nimepata mugao wa kuona kwamba ile barabara yangu ya kutoka Sabaki kuelekea Marafa kwenda mpaka Baricho imeweza kukamilika. Imetengewa milioni 248 ili kwamba ikaweze kukamilika ile barabara, na ni katika serikali hii ndiyo ambapo tunaweza kuona na sisi vitu vikitendeka, nasi tukipata kufurahia. Mheshimiwa Spika, maswala ya uchumi ni maswala mazito. Lakini pamoja na hayo, Mheshimiwa Spika, bajeti hii imezingatia hata maswala ya kilimo. Maswala ya kilimo ni muhimu sana kwa upande wa wananchi wa mapato ya chini. Iwapo nchi inaweza kulima na inaweza kupata mbolea kwa bei nafuu, hapo ndipo wanaweza kuzalisha na kujitegemea wenyewe wananchi. Na hilo tumeona limezingatiwa katika bajeti hii. Ni majibu ama ni mujibu wa kila Mkenya kwa sasa hivi kuona kwamba anashiriki kikamilifu katika nyanja hiyo ya kilimo. Mheshimiwa Spika, kuna mengi ya kunena, lakini tutaweza kuendeleza wakati tutakapokuwa katika ile kamati ya nyumba nzima. Kwa hayo machache niseme asante Mheshimiwa Spika, ninaunga mkono.
You ready? I'll come to you, and Justice Kemeos, I'll come to you.
Thank you, Honorable Speaker. Honorable Speaker, allow me also to rise in support of this motion for consideration of the budget estimates for the next financial year, the year 2026-2027. And as usual, allow me, Honorable Speaker, to begin by thanking the Budget and Appropriations Committee, the Chair, the Vice Chair, all the members of this committee, and also all our members who sit in various departmental committees. Because when the rest of us proceeded on our 3 weeks recess, many of our members who sit in departmental committees and those who are in the budget committee did not have that luxury to have a recess, because we had a working recess to consider the budget estimates after we tabled them towards the tail end of the last session, just before that recess. Therefore, a lot of work has been input into the consideration of these inputs, and I must take this opportunity to thank all members who dedicated their time and a lot of their resources into ensuring that we have a report ready for debate. And I've keenly listened to many of the speakers this afternoon, Honorable Speaker, who have contributed to this debate, and I must commend the very detailed analysis that the members who have contributed are analyzing these budget estimates with. When I listened to the member for Magarini mention specific projects in his constituency, the member for Mombasa, Honorable Zamzam, speak to specific issues that touch on the people, then you know we have a budget or budget estimates that are people-centric and that are responding to the needs and aspirations of the people of Kenya. And it's quite commendable, Honorable Speaker. Having said that, Honorable Speaker, we are passing this budget, or rather we are considering these budget estimates at a time that the entire global economy is faced with a lot of uncertainties. 6 months ago, nobody knew there would be a war in the Gulf region. Today, we are living through that war. And as I said the last time we were speaking about the fuel crisis in the country and in the world, we are living in wartime. And therefore, wartime economies can never be similar to peacetime economies. And this uncertainty is likely to go, we do not know, but is likely, in my estimation, to go into the next financial year, because we are yet to see any indications of any respite in the war in the Middle East, or at least the unlocking of the global trade routes, or even opening up of the logistical movement of goods and services, and opening up of trade around the world. Therefore, Honorable Speaker, with this kind of uncertainty, it becomes difficult for us to be able to budget with the certainty that what we are budgeting today will see us through to the end of this financial year, or rather the next financial year. And I'm saying that, Honorable Speaker, to caution us that we are likely, probably in the near future, and I know the chair of the Budget and Appropriations Committee will bear me witness, we are likely probably in the next financial year to have an earlier supplementary budget than normally we do. Because we will have to realign our budget estimates, our revenue estimates, with the realities that will pertain when we begin the next financial year in July. We remain hopeful that this war will come to an end, but again, because it is not within our control, I just want to caution us that even as we plan today, we must plan with that in mind, that we are dealing in a very uncertain world, and the global economic challenges that pertain around the world, we are not isolated, and we have to live through them. We are just speaking this afternoon about the crisis in this region, the East African region, or the Greater Lakes region and the East African region, touching on the Ebola virus. And that also is a threat to our economy and the regional economy. That will have an implication on our normal trade routes between us and the other East African countries, and therefore will have an impact on our revenues. And therefore, we must all be alive to these things, so that even as we plan and as we think through how we'll roll out the next financial year, Honorable Speaker, we must be aware that these global challenges are there with us. However, Honorable Speaker, we must be thankful to God that the Kenyan economy has remained very resilient. Even amidst all these uncertainties and the global challenges that have been there, we have supported a very stable macroeconomic environment, and sustained investments in key sectors of our economy have ensured that our economy remains resilient and continues to make steady but certain strides in growth. Honorable Speaker, if you think about it, when we began this session, we never knew we would have to reduce our VAT from 16 to 8% on fuel. That reduction of 8% has an implication on the revenue projections that were factored in when we were doing these budget estimates. And although that has since been rectified, Honorable Speaker, I'm only saying this for us to be alive to the fact that there are many things that will come that may affect how we roll out this budget, and therefore we must be prepared that whenever things happen, we must be ready to change as things change, Honorable Speaker. And the budget estimates before this House today, Honorable Speaker, as I said, will demonstrate in a very clear manner the interventions that the government has made in terms of having targeted interventions that strengthen our food security. If you look at some of the interventions that are there, going through these estimates, you see figures that support our food security, about 18 billion shillings going to the fertilizer subsidy program to ensure that we improve access to affordable farm inputs for many of our agricultural neighborhoods. Some 2 billion shillings that is going to the seed subsidy program, again targeted to ensuring that we have increased crop production and food security is guaranteed in our country. Because a country that cannot feed itself, Honorable Speaker, cannot even grow its economy. And therefore, many of the interventions that you see here, as I said, are targeted to ensuring that we have interventions that ensure we have food security, others that are supporting vulnerable segments of our population, the cash transfer program. I have heard Honorable Zamzam and other members speak to the Nyota program and other programs that government is implementing to ensure that we have targeted solutions supporting our vulnerable segments of the population. And also, Honorable Speaker, many of the other targeted interventions that you find in these budget estimates speak to enhancing the domestic revenue mobilization while preserving our fiscal sustainability in a big way. Honorable Speaker, I must take this opportunity at that point to speak to the new Commissioner General of KRA. As I said, since we have all these challenges, the only way, Honorable Speaker, to ensure we do not significantly or in a big way disrupt our budget implementation program is to ensure, one, that we stick to our revenue targets. And that is very well done, Honorable Speaker, by harnessing on technology. And I want to speak to the new Commissioner General of KRA. Please, former Cabinet Secretary Adan Mohamed, do not fall prey to the cartels that have pervaded and taken charge at KRA over the years. Do what you must do to ensure that we leverage on technology to make sure that we are able to mobilize as much as we can in terms of domestic resources, Honorable Speaker. And if you look at the resources that we target to mobilize, Honorable Speaker, this year, you see, Honorable Speaker, we estimate to collect about 3.6 to 9.7 trillion shillings. Or 3.629 trillion.
And that is equivalent to only 17.4% of our GDP.
Honorable Speaker, if we are not able to mobilize more of our domestic resources as revenue coming into the country, then it will become very difficult to be able to finance this budget and also be able to carry on with all the programs that we have planned to carry out without disrupting other programs, Honorable Speaker, that had been rolled out before. And I was just trying to look through the figures that were there last year, Honorable Speaker. If you look at the figures we had in 2025-2026, we had an 18.4% of revenue against our GDP. Or rather, the revenue versus our GDP was at 18.4%. The next financial year, we are projecting that at about 17.4%. That is a 1% decrease. And that points to the challenges that I'm talking about, the global challenges, Honorable Speaker, in terms of being able to mobilize resources with all the disruptions that come in. At the same time, Honorable Speaker, if you look at our expenditure, the overall expenditures are projected at about 4.785, or 23% of GDP. Therefore, that tells you, Honorable Speaker, you have a deficit of over 1 trillion shillings. Actually 1.1, almost close to 1.12 trillion shillings in deficit, equivalent to about 5.3% again of GDP. Honorable Speaker, this may be now. We do not know what will happen in the next 2-3 months. The pressure that is there for additional expenditure, Honorable Speaker, is certain. But the revenue is not certain. And I say that, Honorable Speaker, because very soon the Finance Committee is out there listening to members of the public on the finance bill proposals. And everywhere you listen to Kenyans speaking, they tell you we do not want any additional taxes. And I must thank the National Treasury and the Finance Committee because unlike what was being propagated by those who propagate a lot of propaganda and lies, this year's finance bill does not have the burden of additional taxes as those who are lying to people out there that, oh, the finance bill has taxes on land. And I think now Kenyans have come to realize it is not true. In fact, one of those foolish people who was propagating that thing on social media, I saw him now change gears and start saying, oh, it is not in the finance bill. It was in a rating bill. There is no rating bill. It is now an act of parliament. And therefore, if anyone was paying taxes, you would already be paying it because it is already an act of parliament. And therefore, Honorable Speaker, I must encourage each one of us. And by each one of us, I mean ourselves here and the people we lead, the people of Kenya, that we must be aware that we are in very uncertain times, and therefore there are certain things that must change. And part of the things that must change is how we expend our resources. And I've listened to a few of the speakers here, and I don't know whether my good friend who was seated behind me has left. And when I listened to some contributions and I hear somebody saying, oh, borrowing is excessive now. And I looked at the figures in these books, and Honorable Atandi will bear me witness. If you look at the executive budget of about 2.817 trillion, recurrent expenditure, yes, high at about 1.9. Development budget at about 840 billion. If you go, Honorable Speaker, to look at the figure that is there for CFS, the Consolidated Fund Services, and this is where you look at debt. I would dare the person who tells us that this government has overborrowed to tell us whether the 1.501.3 trillion shillings that has gone into the Consolidated Fund Services, the bulk of which is interest on loans. And if you look at the figures, Honorable Speaker, domestic interest payments are at about almost $1 trillion, 986.7 billion. Foreign interest payments at about 267.5 billion. Pension share, salaries and allowances about 247 billion. So, Honorable Speaker, as a former chair of the Budget and Appropriations Committee, when I stand here today and I pretend that the government is overborrowing, this 987 billion and the 267 billion that is going into interest payment, I would dare any former chair of a Budget and Appropriations Committee, including myself, because I'm a former chair of the Budget and Appropriations Committee, to tell the people of Kenya, be honest as I am. Because when I was a chair Budget and Appropriations Committee in 2017, 2018, we borrowed and borrowed heavily. This is what we are paying for today. This is not only about Andy and CS Mbadi, who have borrowed this money, that we are paying 1.2 trillion shillings on interest in the last 1 year, not even in the last 3 years. These are things we did over a decade plus ago, and we are paying for them now. But the fact that those who are in power today cannot run away from the responsibility of governing a nation and doing what must be done is to ensure, Honorable Speaker, that increasingly as these pressures continue to rise, we are also able to move away part of the expenditure that we were expending from the budget process to off-budget implementation, especially of development projects. And that is, Honorable Speaker, in the wisdom of the President and the resilience of our nation and the commitment and the patriotism of many members of Parliament, we established the National Infrastructure Fund. That fund, Honorable Speaker, if you look at the figures today of 840 billion that we are able now to dedicate to development expenditure, we would not have been able to do that without NIF. And I dare say, Honorable Speaker, in the next 2-3 years, we will see this figure of 840 billion surpass $1 trillion, $1.2 trillion to $1.5 trillion being dedicated to development expenditure from the budget, because we are now able to lift off a number of the projects that would have been implemented through the budget, off budget, through the National Infrastructure Fund and through private public partnerships, Honorable Speaker. That is what we meant when we said that we will have innovative new ways of raising revenues, of ensuring that we're able to mobilize resources to be able to roll out our development agenda without necessarily overburdening the people of Kenya, either through additional taxation, like we are not doing today, or either through excessive borrowing, like was done over the last decade. And unashamedly, Honorable Speaker, I have watched none other than the former President Uhuru Kenyatta, attempt to lecture the people of Kenya or the leaders of Kenya. And you know, I looked at Uhuru and I wondered, where was this man living before? Where were you, Uhuru Kenyatta, when Kenyans were buying a packet of unga for 260 shillings? Where were you? Now that you have become oversensitive to the needs and the suffering of the Kenyan people, where were you when Kenyans were queuing to buy an available fuel at pump stations across the country? Where were you? No, Honorable Speaker, I don't want to say what Honorable Meriani is saying behind me. Because I respect all former presidents, but I have greater respect for former presidents who are patriotic, who love this country, who are not driven by hatred, You know, when Unga was selling at 260 shillings for a packet, Uhuru Kenyatta was the president. When we were subsidizing fuel, Honorable Speaker, using billions of shillings, borrowed money, because that is what we are paying for today. We borrowed money to subsidize fuel. We borrowed money to subsidize a packet of unga that was not available, fuel that was not available. But a few people walked away very rich. One commercial bank in this country, Honorable Speaker, had the monopoly of foreign exchange. And those in the central bank know what was happening that time. That is how we depleted our foreign reserves to the lowest ever in the history of our country. The lowest ever. Even the colonial government had greater reserves than the Uhuru Kenyatta government. Today, we have tripled those foreign reserves. Speaker, if you can add me 2 minutes. That is the resilience of the Kenyan people, the resilience of our economy, and the visionary leadership that we have seen, that those today who are dying of envy and jealous cannot live with. And I dare say from this floor, forget about organizing that disorganized opposition. I hear them saying, oh, we are organizing some disorganized opposition. Now, if you could not organize something when you are in power, how will you organize anything from the bush? You know, Honorable Speaker, this resilience I'm talking about, God being with us, when the National Infrastructure Fund gets the resources that we target to get into that fund, we will be able, as I said, to be able to lift off some of the development projects that are commercially viable that would have been carried in these budget estimates, and implement those projects and be able to grow our economy, to be able to generate more jobs. And that is why I spoke about strategic interventions that are spoken to by these budget estimates, targeting investments in ensuring that we are food secure, ensuring that we protect our vulnerable members of society, ensuring, Honorable Speaker, that even those who are in school are well taken care of. And let me go to conclude with that, Honorable Speaker, that if you look at the investments in the education sector, the free day secondary school has an allocation of almost 55 billion, 54.6 billion, 30 billion to free day secondary school. Junior secondary school, a capitation of 7 billion for free primary education. And in addition, another 56.7 billion has been allocated to HELB, or the Higher Education Loans Board. Honorable Speaker, in that light, Honorable Speaker, there is an amendment that I've seen from the Education Committee, which I would want to speak to the chair of the Budget Committee. Something I saw reading to Kenya KCID for county stakeholder engagements. Something, now that I'm short of time, I may not have it here, but I'll be engaging with the chair of the Education Committee and the Budget and Appropriations Committee. We cannot be spending 200 million shillings to engage stakeholders at a time when we should be deploying resources to educate our children. Engagements, county stakeholder engagements are not things you go and engage people and spend 200 million shillings on. You can engage without spending 200 million shillings. I want to propose that we take that money either to HELB or school capitation, or if anything, to NGCDF, if you have nowhere else to take it, to be able to take care of bursaries, Honorable Speaker. But we cannot be KCID, these, you know, some of these institutions, Honorable Speaker, people are used to just gobbling money, gobbling.
What's your point of information? Honorable Meli.
Thank you, Madam Speaker. Madam Speaker, with all due respect to the majority leader, the Kenya KICD, you know, is an institution that is in charge of curriculum. We have senior schools, Madam Speaker, and this is a curriculum implementation process on CBE. Madam Speaker, these county dialogues is actually engaging the parents, the institutions, and all the stakeholders on the new educational systems. And Madam Speaker, this was actually the money that was meant for KICD on construction of a stalled project, which every time we allocated 400 million, and we removed from that particular sector because they were asking us money for engaging on senior school CBE. And I think this is a new curriculum, Majority Leader. Thank you. Yes.
Honorable Speaker, this increase of 200 million in recurrent for Kenya Institute of Curriculum Development to support county dialogue and stakeholders engagement as part of CBE sensitization program is what I have a serious problem with. Because it is possible to engage our parents from our schools. This money, even if you took it to NGCDF as 500,000 shillings, you can get these members of parliament to convene forums for you at the lowest level. School AGMs. Yes, you do not need to spend 200 million shillings to go and sensitize people about a new curriculum. That is the kind of wastage, Honorable Speaker, I am speaking to, and I will be moving the chair. I will engage with the chair education and the chair budget. These kind of things are the things we do not want to see. Let us dedicate more money into development expenditure, not recurrent expenditure, especially sensitization. You know, Honorable Speaker, in the NGO world, they had those sensitization workshops, conferences to sensitize those who are sensitized, to go and sensitize other members of the public. We cannot run government, ministries, and agencies like the NGO or the NGO world, the civil society world. We must be very keen. Honorable Omboko Miremba is a very good teacher. He is a trade unionist within the teaching fraternity, and he will tell you his teachers under KUPPET understand the curriculum. If you convene school AGMs for them, they will sensitize parents. If you even sensitize the chiefs through the teachers, they will do a better job. And sensitize these members of parliament, MCAs, they will do a better job. And it will cost you absolutely nothing. This 200 million at hand, you must remove it and take it to better places.
Okay, thank you.
Honorable Speaker, I support.
Thank you. Honorable Milemba.
Thank you, Honorable Speaker. Let me, on the onslaught, take this opportunity to thank the Budget Committee for a very good job they have done, and we have seen that over the years, the Budget Committee has continuously targeted some of the very lowest people in the society. We saw and we have still seen the introduction of fertilizer, which is still supported, and this has really helped in promotion of agriculture and reduction of the food prices. We also have had monies budgeted to the CHPs, who are actually doing a good job. Honorable Atandi, I would really wish you don't go. I want to speak on education, and you should listen to this. You should listen to what I want to speak to. In fact, don't go away. And then we have the Nyota program, among other things. But now that I see the chair of the budget wants to leave, let me go straight to the issues that I want to raise. And this time I'll be very specific on the education sector. As a government, we also need to include in the budget things which the president may have mentioned or talked to or committed himself to, because as the broad-based government, it's very important that we achieve the agenda of the executive, and that executive is led by the president. Honorable Speaker, there is the issue number one, which I want to thank the Budget Committee for having considered, because I see on the CBA, you have included 8 billion for the CBA, and I want to thank you for that. But remember, there's a promissory note which was given to the more than 600 teachers of Kenya, that CBA will be paid in 2 phases. And therefore, it was very important that in the onslaught, and I will be asking Parliament to help me when we make such amendments, and the Budget Committee to consider that we increase this to 16 billion, so that we are able to do exactly what the promissory note was to the 600 teachers of Kenya. And this will be very good, because that's what even the chief executive expected in order to make that sector to be calm. And we were looking towards and forward to this particular budget to achieve this. The next thing, Honorable and Chair of Budget and Honorable Speaker, is the issue of the promotion of teachers. That a promissory note was given by the executive again, that there would be a minimum of 50,000 teachers being promoted. I want to thank you for the 2 billion, because I've already seen in the budget you have 2 billion for promotion of teachers. But if you did these promotions with 2 billion, we shall only be able to achieve only about 25,000 teachers. And therefore we are pleading that this is a sector that needs calm, given that is a very important sector. And therefore we need an addition of another 3 billion to make it 5 billion in order to promote the 50,000 teachers. And that sector will be very, very calm. And that will include the SNE teachers who had a promissory note too, together with the other teachers within that particular sector. Honorable Speaker, when we talk about the budget, we have to be very, very calm and very objective. Honorable members, you realize that the intern teachers will always be knocking on your doors, and they'll continuously so knock. And this is the house that can actually make the big change by simply asking the budget committee together with ourselves to see where we can chop the flesh so that we actually actualize the putting all of them as permanent and pensionable. And there are 44,000. I want to thank the budget committee because you have budgeted an amount that can deal with the 20,000. But then we have the sector having 24,000 of them being left out. And remember, in a court ruling at the Court of Appeal, we had this act of having these teachers as interns being made unconstitutional. Because again, when you go to Article 237 of the Constitution of the Teacher Service Commission, you will realize that it is actually unconstitutional. So this is another area we need to make an adjustment. Honorable Speaker, there's something called group life cover. And this one, Honorable Japheth, allow the chair of budget to listen to group life cover. That all the civil servants get group life cover. What's group life cover? When a civil servant dies, he's paid certain amounts, or the spouses are paid certain amounts for equivalent to a salary of 7 years. It is in law, and we thank the government that is working for the civil servants. So for the civil servants, they are paying 5 years. For police, they are paying 7 years. For teachers, they are paying nothing. This is a discrimination which can just lead us to a level of an industrial action that is unnecessary. We need to budget for group life cover for teachers. And where do you get the money, Honorable Chair? Through the Speaker. Remember, we presided over the transition of the teachers from Iron Minute to SHA. That's a story for another day because we are fighting with SHA and we want SHA to work because it's cheaper. It's government run. It's not private owned because we cannot collect all the monies from taxpayers and give to a private enterprise. So we want government to run that thing and we are supporting that area. The rest we shall talk to it another day. But now, when we transited to SHA, we saved 4.8 billion, Honorable Speaker. Yet, what we require to have group life cover for teachers is 5 billion. If only we would have even played in that space, which we did ourselves, by transiting, then we should get the 5 billion, which is required for group life cover for teachers, so that they are not discriminated away from the police and other civil servants as it is today. Honorable Speaker, capitation. We are doing very well with capitation. But are you aware, Honorable Speaker, that yes, and this one can shame us because, you know, I'm part and parcel of the broad-based government. I'm right inside there because the president talked about capitation. But now today I'm from Utumishi Academy because part of the work I do is that. The schools have received 5,000 as capitation. I'm reporting to this house and we have done that research. What's happening in the ministry? Some schools have received 9,000. Others have received 20,000, I'm talking here, members of parliament, because you'll get it back to the constituencies. That is the capitation that went there. There must be a real problem in the Ministry of Education, because when we declare, Honorable Speaker, that capitation has gone to schools, and then a school can show you a reception of 6,000, how will you deal with it? In fact, Honorable Speaker, what is actually running the schools is a little capitation coming from JSS. Our primary schools would be in their need if the JSS money was also not going there. And therefore, this is something that we need to address through this budget so that the capitation, when you speak to it, it is actually going to the schools and arriving in schools. And this can be done, an investigation by any one of us, because it's affecting our constituencies moving forward. Now, Honorable Speaker, and the chair of budget should listen to this. Pokot, let the chair listen to this. That we don't budget money for National Examination Council to pay the examiners, to pay the invigilators, to pay all the staff around that space. Honorable Speaker, this House can make a difference. The reason why the examiners have not been paid to date is that this money was never budgeted. It was hoped that it would be found along the way, because we made an intervention of visiting body, and then he says this money is not budgeted. So we have to possibly ask the president to use 223 to get such a money. This is a very important task in this country. Could we be sure that the chair budget will make sure that money for Kenya National Examination Council, for examiners, for invigilators, for the police, and people around that space is budgeted? Shameful to the House that today, as I speak, those who did supervised exams last year and mark have not been paid. And the Education Committee chair is just ahead of me here. He should help me to make sure that we make a change together with the Budget Committee so that we actually mainstream Kenya National Examination Council monies moving forward. Honorable Speaker, I can see my time is done. I would wish to indicate that those are important. Yes, let me hear the information you want to inform me, the chair. I don't know which information.
Yes, Honorable Chairperson.
Yes, thank you. Thank you, Madam Speaker. I do agree with the member for Emuhaya. Actually, the Education Committee took action because it is very shameful that these teachers have not been paid. And we reallocated 1.5 billion for the examiners in this particular budget. And it was actually the decision of the committee that there was no way, actually, we can do another exam before the teachers are paid. Thank you. And the invigilators.
I just hope that again we shall now not budget the NEC money for the following exams, so that again we shall have a situation whereby we have to come back here to say that we have redone it when the teachers who did this work are outside there and suffering. Thank you, Honorable Speaker, and I support.
Thank you. Member for Sigowet Soin.
Thank you, Madam Speaker, for the opportunity you've given me to also express my support for these budget estimates before us today. Madam Speaker, on the onset, I wish to express my satisfaction with the way the budget has been done this time round. But there is still a lot, Madam Speaker, that we need to do in the budget-making process. When the Honorable Atandi moved to the motion, Madam Speaker, he said that 99% of this budget reflects the feelings of the departmental committees. That I really appreciate, because at one point, Madam Speaker, some of us who believe in proper budget making were getting disappointed and disillusioned, and we thought probably it was not appropriate even to take part in the process altogether. It is not enough, Madam Speaker, for interventions only by the departmental committees. We need to reform the budget-making process altogether so that the line ministries, the departments themselves, originate the budget within the ceilings given by Treasury. Treasury, at the end of the day, Madam Speaker, should be a facilitator of the budget-making process. All said and done, Madam Speaker, I wish to appreciate the amount of money given to the Ministry of Education, which will make sure that the various critical programs are undertaken. But I want to join my colleagues, Madam Speaker, that the capitation issue is one matter that must be comprehensively dealt with. While we hear from the Presidency, Madam Speaker, that this amount of money has gone for capitation, in actual sense, we don't know what's happening between the ministry and the schools, because the amount of money received by the schools do not reflect a pronouncement like that of the President. There must be something that is not happening somewhere. And Madam Speaker, if it continues like this, then we probably have to ask the minister to come and explain to us in the House how the money has gone, and to give us specific schools that have received their money and the amounts received by those schools. Madam Speaker, I want to go to the Department of Agriculture, where I have dedicated a lot of my time and a lot of my energies in terms of improving issues in the Departmental Committee of Agriculture. Madam Speaker, my disappointment is that when you look at this critical sector, the budget allocated is only 67 billion, which translates to about 2.3% of the overall budget of the country. It's a productive sector. We normally speak very rosy matters about the agriculture sector. We talk of it employing the greatest majority of our people. We talk of it earning us foreign exchange. We talk of it being the basis for industrialization in this country. But a budget of 2.3% of the national budget is not sufficient at all, Madam Speaker. The declarations and the treaties which Kenya has signed with the rest of the world dictate that we allocate the agriculture up to 10% of the budget of the nation. 2.3 is extremely low. We are happy, Madam Speaker, that critical intervention measures like fertilizer subsidy, seed subsidy have been taken care of. At 18 billion shillings, we are sure that there will be enough fertilizer in this country. At 2 billion shillings, we are sure the seeds will be subsidized to the extent that agriculture production is cheap enough for the farmer to participate in it and to make ends meet at the end of the day. Madam Speaker, I want to speak again about energy. While we talk of energy policies in this country, what have we really done to make sure that we reform the energy sector in this country? The war in the Middle East has taught us a lesson. But we have solutions, Madam Speaker. The sugar industry in this country can produce a substitute for the oil that we get from the Middle East. We can produce ethanol, Madam Speaker. We can change the policy in this country to make sure that motor vehicles that are being manufactured use both ethanol and fossil fuels. If we do that, then the sugar sector in this country, which is growing at a very fast rate now, can be able to substitute the amount of money that we use in the purchase of fossil fuels from the Middle East. And the effects of a war, which we never had anything to do as a nation, would be ameliorated by a policy direction that makes sure that the energy that we can get from this country can replace the energy that we get from the Middle East. On top of that, Madam Speaker, the sugar industry is also capable of producing electricity. Cogeneration is one aspect that we can be able to promote in this country and to make sure that we produce enough electricity even to satisfy this country. Madam Speaker, I want to go to one other critical area, which is to appreciate that this time round we're able to give the village managers a token of Kenya shillings 3,000. While this may look small, Madam Speaker, this is the beginning. And I want to ask the Budget Committee, and indeed Treasury as a whole, that this lowest cadre of public servants should be brought on fold as public servants in this country. They do a lot in terms of social control. They do a lot in terms of handling deviant characters in society. They do a lot in terms of policing. And village managers, at the end of the day, have been living very, very miserable lives. Madam Speaker, my request would be, let us move as Parliament, let us jointly with the government make sure that we bring on fold these village managers to the service, to public service. Madam Speaker, we lose a lot of money. There are stories, Madam Speaker, that we may be losing even close to 6 billion on wage bill matters, on payroll matters in this country. The amount of money that we could be losing in payroll, Madam Speaker, we can be able to make sure that that amount of money is given to this low-ranking cadre of public servants in this country, and I'm sure they will be able to do a good job. Finally, Madam Speaker, I want to join my colleagues to say the amount of money that we've dedicated for the employment of GSS teachers, while it takes a step forward, Madam Speaker, I wish we could be able to do more so that the entire fold of 44,000 teachers are taken into permanent and pensionable. And while I'm speaking, Madam Speaker, the Chairman of Education, Honorable Melly, should be listening to us. Honorable Melly, there is something, I'm sure there is something we could do to bring on fold the remaining JSS teachers on contracts into permanent and pensionable. I wish we could be able to do that. And finally, Madam Speaker, how do we as a country rely on teachers to mark exams and make examination credible when we are not even paying them for allowances to make exams? Madam Speaker, I wish the Chairman of Education and also the Chairman of Budget could be able to do something so that all the examiners are paid their dues. And it's not big money, Madam Speaker. And finally, Madam Speaker, on the issue of electricity connectivity, we are given similar schemes across the entire country as constituencies. But then there are constituencies, Madam Speaker, that have got a connectivity rate of 80% of 90%, while rural constituencies and the marginalized constituencies of this country, including my constituency, Madam Speaker, are given the same number of schemes. When will we ever catch up with the rest of those constituencies which have a higher connectivity? Madam Speaker, an intervention is required, and maybe the budget chair and the